Senate Committee on State Affairs will come to order. Welcome back. The chair now lays out Senate Bill 14. Senate Bill 14, and we welcome Senator Campbell to the committee and recognize her to explain the bill. Welcome, Senator.
Thank you, Mr. Chairman and members. Let me get the right book here. Members, sometimes we must work hard against something in order to fight for something. SB 14 fights to stop puberty blockers, cross-sex hormones, and mutilating surgeries that are used in order to change sex so that we protect children. This bill is not about adults. It's not about those who are of maturity that can make a fully informed consent and decision. SB 14 is all about child protection. You will hear today multiple terms: gender dysphoria, gender-affirming care, transgender surgery, puberty blockers, cross-sex hormone, gender surgery. Just to give you some perspective, 15 years ago, Boston launched the first pediatric gender care clinic. Today, there are over 100 such clinics, and if you add up what Planned Parenthood and the like are doing, there are over 200 ways that children can access practices that change their sex. This boasts to me of a cottage industry, and I'll touch on those dollars later. This bill prohibits the use of puberty blockers, cross-sex hormones, and surgery for the purpose of changing a child's sex. It prohibits surgical removal of healthy tissue for the purpose of transitioning in a child. It prohibits Medicaid and other taxpayer dollars for use in changing a child's sex. It revokes a doctor's license, their renewal, or their ability to have a license if they participate in the practice of sex transitioning of a child. Enforcement of this law is by the AG to issue an injunction. Today, members, testimony will be some truth, and you'll be able to see that. But lies, many; guilt, plenty; regret, some; and some to come. But supportive, scientific research, none. Our children need counseling and love, not blades and drugs. Thank you, Mr. Chairman. We have invited witnesses, and I'll speak intermittently on different topics that may come up with testimony from other witnesses.
Thank you, Senator Campbell. Committee members, any questions before we begin testimony? Senator Menendez.
Thank you, Mr. Chairman. Senator Campbell, I heard your layout, and as I was thinking about the words, the comments you were saying, it struck me, you know, we both sit on education. We sit on the Education Committee, correct? And on the Education Committee, we've heard bills about helping children with their asthma medication and helping children, and we always talk about parental consent. We talk about the involvement of the parents, helping the schools get better. But it strikes me that your bill seems to get between the parent, their relationship with their child, that this bill seems to do that. Why do you think we need to have this bill? Why did you bring this bill before us?
You know, I got into the Senate or government because I wanted government out of our lives. Mm-hmm. I'm a doctor in the ER. I saw insurance companies and government getting in between the doctor and the patient. Mm-hmm. But if there comes a time when a profession, such as the medical profession, cannot regulate itself to protect patients, protect children, then the government needs to step in. I believe that parents, they love their children. They know something is wrong. They seek counseling. And what we're finding is this is like a social contagion, if you will. We're finding that, and witnesses can speak to what I'm saying a little later, but we're finding that in some cases, counselors are telling a child, maybe they start asking questions, and then it starts doubting, causing the child to doubt, are they really happy with their gender? And a parent wanting to do the best for their child is actually told in, I'm not going to say every case because I don't know that, but there are ample examples out in society where a counselor has actually said in front of the child to the parent, your child is likely to commit suicide if they don't get this gender-affirming care. That is a purposeful misguidance of a parent, because that's not the truth. I need to find my card that's got more statements on that. But that is why.
So
I think parents are doing the best they can.
Right.
They want to keep their child from committing suicide.
Of course.
And they feel that this is the only thing to do.
So if I'm understanding you correctly,
I'm sorry, what?
if I'm understanding you correctly, your response to my question is that even though parents are trying to do the best thing for their children and you support that, that you feel that sometimes parents are being given, or misinformation is what you've said to me, that they're being misguided, and that they're being told in some cases that their children might commit suicide if they don't get this care.
Likely to.
Likely to. So this is why you brought this forward. So I was just curious because I just didn't see that this was a huge issue that's ongoing, but I wanted to know what you were trying to solve, and I appreciate you taking my question. I look forward to hearing the testimony. I think that there are facts out there. I'd like to know. Do you have the numbers in terms of the suicide rates? I don't have that in front of me, but I'm sure there was someone out there that could get us the.
We do. And we've got a doctor coming that has statistics.
Okay.
And I don't want us to get lost in statistics. Mm-hmm. And the doctor can correct me if I'm wrong. But when you look side by side at, well, first of all, for those who undergo transitional drugs, surgery, many of them have what we call comorbidities, which just means other behavioral mental problems. Sometimes it's eating disorders, anxiety, depression. I mean, the DSM-5, which is the list of diagnoses that apply for psychological or behavioral illnesses, the list goes on. But they accompany gender dysphoria. Those that have committed suicide with comorbidities, mental illness, plus gender dysphoria, is actually the same rate as those who have comorbidities, gender dysphoria, and have undergone some type of treatment for transitioning. So those numbers are the same. Now, there's also, I think, deceitful information in that true suicide is very low. What is not low is suicidality.
Ideology.
No, suicidality.
Ality.
Yeah, it's like a combination of both. And that bundles many behaviors together. Anything from I'm not happy with myself, a poor body image, eating, it bundles everything together. Self-cutting, harm, saying you're going to hurt yourself, sometimes attempting in some way, taking some drugs. Most of the time, those are outcries. They're cries for help. But this large group that are defined as a behavior that would fall into suicidality has a higher percentage. That group that say they're likely to commit suicide is a higher number, but true suicide is not in that group. There's suicidality, behaviors that may imitate but not have a serious action to commit suicide, versus suicide, which includes the actual death or such a serious attempt that it's taken seriously as a suicide, more than an ideation, but with a plan.
Senator Campbell, is there, do we know how many children are undergoing this type of treatment that you're trying to prevent?
I've probably run across it. I think I'll let one of the witnesses answer
Okay.
that. That's a great question.
Okay. So in the one...
But I can tell you
Yeah, go ahead.
that without giving you specific numbers, over the course of 15 years, this has exploded in children coming forward saying this is, 15 years ago, it was really rarely heard of. Now it's just exploding, and it used to start with young teenage boys. Now it's just a plethora of young teenage girls.
Okay. And I guess what I think you're trying to get to is you feel that the parents are misguided or being given misinformation, and your concern is that people may regret the decision of what happened. But I guess the facts that I have, or the information that I have, is that 97.5% of the children who come out as trans stay trans their whole lives. But let's go on to the one pager you...
So let me make sure I hear
go
that
ahead.
number again.
97.5% of the children who come out trans stay trans throughout their lives.
97% of those who choose trans go through transformation, stay trans throughout the rest of their life.
Yes, and otherwise, the overwhelming majority do not regret having the decision, the fact that they feel that they were born in the wrong gender.
Well, and I wouldn't want us to mix the idea that just because they haven't detransitioned means they are happy that they did transition. Because these things, any surgery, it's permanent.
Sure.
So trying to change back is not easy.
Sure.
And not only that, which is just a side note, it doesn't really specifically stay to your question. For those who do want to change back, detransition, they're left on their own. Insurance companies are not there. Doctors are not there. And you'll hear that from some of the witnesses.
So it's my understanding that the surgical procedures outlined in this bill are not permitted to be performed on adolescents under 18 unless there's a particular medical circumstance or the person has completed several barriers prior to surgery. So is that your understanding? Because I know that parental consent is necessary, but I think
you know what?
even if...
I'm just sorry.
Yeah, go.
The acoustics are hard for me.
I understand completely. The acoustics are terrible in here. My understanding is the overwhelming majority of all surgeries are not allowed unless there's parental consent, and there also have to be completed several barriers prior to surgery. So I'm trying to see, under your bill, you're outlawing any surgeries, hormone therapy, and puberty blockers, correct?
They're what?
In this bill, you're trying to prevent puberty blockers, hormone therapy, and surgeries. Is that correct?
Yes, that is correct.
Okay. All right.
If there is a genetic disorder of sexual development, that's on its own development, not changed on purpose.
Okay. How do you, it's come to my attention recently that some children experience puberty much earlier than necessary. Precocious puberty. It has also come to my attention that because they're so young, that the parents have sought medical attention and said, my little boy, my little girl's too young to be going through puberty. Can we help them?
Yes.
So would your hormone therapy prevent them from helping children who are going through that?
I'm glad you asked the question. No, it doesn't. That's precocious puberty that you have described. And we have different levels of development, sexual development in the development of a child. Somewhere around Tanner stage 2, age 8 and 9, they start showing signs of development, sexual development, but that does occur early in some children, and it's called precocious puberty. The drugs that are used, some of the same drugs, are used, they delay puberty development. They do not block it, they do not stop it. And the child continues on the medication until they catch up where the age they need to be. On the other hand, in contrast, the drugs used for transitioning block development, doesn't delay. While the child is on, while a precocious puberty treatment is going on, there's still development.
Okay.
But the puberty blockers stop it. And so what we find are actual side effects that can be permanent for those that have it blocked, their puberty blocked, versus those that just have it delayed.
Okay. Is there anything in your legislation that could be seen or used as any type of conversion therapy?
Conversion therapy?
Yeah.
No. It doesn't get into any type of counseling. It doesn't discuss watchful waiting. None of that. The counseling, non-drug, non-surgical treatment is what this bill addresses, not any type of counseling.
Thank you for asking me my questions. I appreciate you answering my questions.
Yes.
Thank you.
And I know I hope to be able to bring this to the floor. So if there are any other questions, I'm happy to try to answer those.
Thank you. Thank you, Mr. Chairman.
Senator Lamontia, you're recognized.
Thank you, Mr. Chairman. Senator Campbell,
Senator?
we spoke earlier about precocious puberty as well,
Yeah.
and I have personal experience with that through a family that I know. And so I just want to clarify that this won't make it more difficult for those children to get this treatment, and it won't affect doctors being able to treat these patients that have precocious puberty.
That is correct. This bill will not. Its intent is not, and I hope we've made it clear that it doesn't. If, on your further examination of the bill, or even your contact that you have, if anybody feels that this steps on the treatment of precocious puberty, let me know to make sure we can shore that up.
Got it. Thank you. And because we're allowing or banning this medical treatment for a specific group of people, but allowing it for others, do you see that it may have an issue maybe raised regarding the Equal Protection Clause?
No, because we're not for puberty blocking for puberty blocking in a child for the purpose of changing the sex. That is clear, and everybody's treated equally. Mm-hmm. For precocious puberty or at birth with chromosomal changes, that is clear also that this does not affect those instances. So it also will not affect the doctor's practice who deal with children that have precocious puberty or any kind of confusion at sex at birth.
Got it. And those children who are currently receiving this, treatment?
Precocious puberty children?
The transgender children.
Trans children.
Who are currently receiving this treatment, when this bill if this bill passes and goes into effect, how will this affect them and the doctors treating them? And are the doctors, if they are forced to immediately stop treatment, going to be opened up to malpractice liabilities without having a STEP program or something else?
You know, I think that's a great question. When it takes effect immediately. When it does take effect. There is no provision to allow continued treatment or a waning of treatment or any stepwise therapy. It stops treatment. It does not stop the doctor who has been caring for the child with a concern for the child's welfare to continue treating the child now to help them detransition, meaning, or stop the medication. And just as the doctor, and this is so loud, I don't mean to be too loud, but just as the doctor should be following a standard of care for delivering these orders, this treatment, they should equally have a pathway based on science to know how to stop or what to do for the child who has to come off of the medicine. So, and I think you'll find from some witnesses, that's not out there.
And the Texas, you mentioned the Texas Medical Association and the Texas Pediatric Society and Texas Psychological Association all oppose this bill. Have you spoken to them, or is there a reason why, I guess this bill's been filed despite their opposition?
Right. You know what? I can't speak for them, and I don't speak for them. I think that they are careless. I think if they oppose this bill, physicians that oppose this bill need to think twice. Some of them oppose the surgery, but not the drugs. So are they just opposing part of the child's body image and desire? When we find that something hurts someone, we don't say, well, let's slowly let you stop hurting yourself. And I may be, drifting a little bit. And I did talk with somebody who represents the TMA and let them know exactly how I feel. And as I said already in the layout, or answering a question, I think Senator Menendez's first question, if a profession cannot regulate itself and see where they are causing harm, somebody needs to step in there. And we've all heard of first do no harm. That doesn't really just apply to doctors. That should apply to all of us. Do no harm. And these medical associations that have their license and their goal when they're training is to make sure we do the best we can to deliver health care and not damage or hurt someone, they need to go back and really examine where their views are coming from. You can still care and believe that that the child needs to have that concern addressed. But there are other ways to do it than puberty blockers, cross-sex hormones, and surgery, which are permanent. A child can seek counseling adolescent, the hormones are everywhere. Behaviors, thoughts are not always controlled. And a very high percentage, 80 to 90% of children that have gender dysphoria, and the expert witnesses can come up after me to either change the percentage or verify it or lower it. But from what I understand, 80 to 90% of children that have adolescents that have gender dysphoria grow out of it and come to be in line with what their biological sex is. And to think that we are going to, and that's a temporary thing, but to apply permanent changes or give medications that can easily, if taken long enough, be permanent for an image that may be temporary, I think is careless and is not in the best interest of a child.
Thank you for answering my question, Senator.
And thank you for asking me the question about my own profession. Thank you.
Senator Betancourt.
Senator Campbell, thank you so much for bringing the bill.
Thank you.
And the point that you've just closed on is very important, that any type of irreversible surgery is simply irreversible by any definition. And once that occurs, it can't be reversed. So the fact that you're focusing on that is very important, because I don't care whether, people decide to be for or against your bill. There's no fact or supposition to the fact that once a child goes through irreversible surgery, there's no returning back. And that's a very important point about what you're trying to accomplish. And so I just wanted to commend you for just saying it like it is, because it's very important for everyone to understand that's what we're dealing with. Because if a minor child makes that decision, or effectively through, parental consent, whatever the combination of factors could possibly be, all the permutations out there. But once that surgery occurs, there's no way back.
Yep. Thank you.
Senator Perry.
Hey, Senator Campbell, I know that this conversation seems to be an evolving conversation for now about 3 sessions. We started a while back, and what I've noticed in it is science is finally beginning to catch up with the conversation. Europe was ahead of this issue years and years and years before anybody else.
Yes.
And it may be a better question for one of your witnesses coming up, but they are now pulling back.
They are.
After you are beginning to see enough people that have went down this road, and they're having, as you, I think, laid it out, regrets and some of those conversations. So there is a movement afoot that science is finally catching up, because I guess there's enough people to have the conversation that maybe, just maybe, it's not a good path to get on in some cases, or a lot of cases. But is that true, that there is beginning to have a evolution of science that is beginning to pull back recommendations that were very commonplace just 6 years ago?
I think, and I'm not going to call it science, what I'm going to say are case studies, the population, what it seems to be revealing. But there's no good control with a control group. But there's some that are starting. Some research is beginning to develop. But what you say is right on point. Just quickly, I'll touch on this. Sweden's, which was one of the leaders, Sweden's National Board of Health and Welfare. And I know this is wordy, but it's important for us to understand, because this initiative has been going on around the world. Sweden's National Board of Health and Welfare has ended the practice of prescribing puberty blockers and cross-sex hormones to gender dysphoric patients less than 18 years. One of the world's most renowned hospitals in Sweden used the Dutch protocol, experimental, and they had been using that. The Dutch protocol, minors treated with puberty blockers at age 12 plus. Some are treating at age 8. Cross-sex hormones, age 16. There's a proliferation of medical interventions called medical affirming that have a very low certainty of benefits, yet carry significant potential for medical harm. So when you're looking across Europe, which is where a lot of it started, when you look across Europe, what they're finding, this statement is kind of a general statement, but the proliferation of interventions, just lump them all together and call them medical affirming, they are finding has a low or very low certainty of benefits, yet carry a significant potential for medical harm. Would you go you have to bring me back if I go off on too much of a tangent, Chairman. But would you go to surgery to have something done, your hip, anything common, where they said there's a very low certainty that you will benefit from this, but there is significant potential for medical harm, but I'll do it anyway? How many of you would sign on the form? So what I'm saying is that is the tide is beginning to turn, and America is behind. I mean, Finland, UK, I could tell you. Here, let me just tell you one thing. Scary but sad. Without a science base, the support for without a science base, the support for an arena of truth for which we base our practices on. That's what we base our practice on, an arena of truth and best practices. Without this science base, we do not have a base of truth. Some states mandate public and private insurance coverage for medical and surgical treatments, regardless of age or mental status. I'll try to find where I got that part and get to you, because with me making that statement, I feel like I need to get it to you. Yes, Senator Menendez.
Thank you.
Senator Menendez, you're recognized.
Thank you, Mr. Chairman. Sir, so it sounds like to me that your biggest concern is that we prevent children from having things that are not reversible, right? You don't want them to have the surgeries or these hormones that are, if taken for too long, they won't be reversible. Does that sound accurate?
Yes.
Okay.
I don't want to get trapped in whatever else I might think, but
Well,
yes.
you know I'm not a lawyer, and I'm not
I
going to...
know, but you play one well in the Senate.
Well, I'm not trying to trap you.
I believe that you are not.
I am not trying, I just want to get to what we're trying to do. So because surgeries, especially in 2017, there were 230,000 cosmetic surgeries done on minors. Would you be open to not having any cosmetic surgeries done on minors since those are not reversible?
No,
So what's the difference?
because you could have ptosis, a child with trauma or born with ptosis, which is where your eyelid comes down too far, and it decreases your visual field. That is something that needs surgery. Some insurance companies, believe it or not, call that cosmetic, but it's not a blepharoplasty. We're lifting the lid because it hangs down and it blocks the child's vision.
Okay.
So that's just one example. No, but that's not done to change the sex of the child.
Correct. So your focus is on not changing the sex of the child.
Yes, sir.
Okay. Now, you stated earlier, and I just want to clarify, puberty blockers that prevent the oncoming onset, that delay it, that is not
Precocious.
correct. But those puberty blockers, those are not the subject of your bill?
No.
Okay. All right. Thank you.
I mean, puberty blockers for the purpose of changing sex is part of the subject of the bill, obviously, because I'm stopping puberty blockers.
So here's where I find...
I mean, I want to make sure I...
Here's where I have the difficulty in finding the consistency.
Okay.
We have stated earlier that parents, any parent, would more than likely not want to have their child, their sexual development come at an age that's much sooner than the rest, than what's become norm in society. You wouldn't want to have a 3, 4, 5, 6, 7-year-old have facial hair or other signs of puberty.
Yes.
Because of all of the things that could come with it. So you're saying it's okay for parents to step in with their doctor and delay their puberty to...
For the purpose of precocious puberty. Yeah, because it's delaying. And
Correct.
that will not change the sex of the child because it's given in lower dosage and...
Understood. But my point that where I'm trying to find the consistency is if those parents have come to the realization with the child and the medical professional that you having puberty at a young age is not something that's healthy, what about the family that comes to the decision that that child does not feel that they were born the right gender and they don't want to go through puberty, period?
Because there's no proof that helps. There's no proof that intervening, or no proof that to treat that child's feeling that they are not of the gender they were born with, there is no proof that providing puberty blockers, cross-sex hormones, or surgery changes that.
Correct. So fine, let's go with what you're saying, because there's no proof that delaying puberty helps either. But
Yes, there is. Because the child doesn't become precocious. I mean, we're delaying the precociousness.
But the end is the same. So here's where, okay, in the event of delaying puberty, in precocious puberty, where you've said that's fine, there would be the same net effect if you delayed puberty until that child was an adult. And if they didn't take the ones that were not reversible, then that child could make the decision for themselves at age 18, could they not?
If you're If the child at age 18 is an adult, they can make the choices themselves.
Okay.
You're asking if you drag on the delay of pubertal blockers
Correct.
past the age of which normally would stop for precocious.
Correct.
Is that
Because-
okay?
Right.
It's not okay.
Why?
Because why do you need it after you pass the stage? When you're supposed to be developed at a certain age, why would you continue the drugs?
Because the parents and the child are delaying them for the same decisions that they made for the child when they were precocious.
The child, if the child's precocious, they're making the decision based on the precocious development.
Correct.
If you're making the decision for treatment of precocious puberty, when the child reaches the age for which now they need to come off so that they can
Go through
catch
puberty?
up,
So they can become they
so that
can,
they can go ahead and now that their development will move at the stage it's supposed to for that age. Then that's what, and then they back off the drugs or stop them.
so I've heard you many times talk about, and I think you did it in your bill layout, how you think government needs to not be in our lives, less government in our lives, right?
Well, that's why I got into this.
Right.
But if somebody is harming somebody, if there's an association of physician that's harming, I mean, there's suits all the time where somebody harms someone. No, I'm not even saying it's malicious or it's with intent, but I do believe it's with lack of knowledge. But yes, I think the government needs to step in.
So the only reason that I see the lack of consistency is because in this case that I'm just saying, it's not reversible, it just delays it. It's the decision of the parents that we've always said in this building that we must have parental consent. And 97.5% of kids who say, I was born, I'm not the gender I was born, they remain that way. So why are we in government trying to get in between them and their decision when it's
Because-
reversible? When it's reversible.
Well, if you carry all, I'll let the witnesses talk about to that extent, but if you continue these drugs for a long enough period of time, it is not reversible. Bone mass changes, height may be higher, gonadal development, the ovaries, the testes are not likely to be developed as usual because you've carried the drugs longer. In precocious puberty, they make sure that the timing, I mean, it's science-based.
Sure, I understand.
But for changing a child's gender, it's not science-based. The amounts, the drugs, they're all over the place.
So if we could have research or science, as you've said it, that would demonstrate that gender-affirming care improves mental health, would you be okay with it?
No.
But you just said it needed to be science-based.
Well, it does need to be science-based, yes. But I also think that not only science-based paired with the full understanding, the brain development at a mature enough level that the child can make the decision, not someone else. It needs to be the child making the decision, not the parent. Parent guidance, parent love, but at 18, they can go get a tattoo, and they can go get their surgery if they want.
Thank you for taking my questions.
Yes,
Thank you, Mr.
sir.
Chairman.
Thank you.
Thank you, Senator Campbell. That was all those questions and your answers, I think, helped everybody. And with your medical background and your study on this, it's helping us all. So thank you very much. So if you're ready, we'll start by calling up your witnesses.
Yes, and Mr. Chairman, if I might just be able to sit at my desk, but if after, or sit at Schwartner's desk, but if after some witnesses testify, if I wanted to just come up and just interject a little bit, I'd like to be able to do that.
Senator Campbell, you can, and there's going to be some empty seats up here. You're free to use these whenever you need them. Over there.
Well, I can sure do that, too.
Yes, ma'am.
Thank you. I just didn't want to take another senator's seat.
Thank you, Senator.
Thank you, Mr. Chairman. And members, thank you. And obviously, I'll be around. So any other questions? I think your questions were good. I think I need to make sure I can answer more precise so that there's not inconsistencies there. So thank you for your questions, and we'll get on down the road.
Thank you, Senator Campbell. We'll open testimony on Senate Bill 14, and we have some invited testimony. The chair calls Prisha Mosley, Dr. Bethany Rife, and John M. Long. So Prisha Mosley, Dr. Bethany Rife, and the John M. Long. Miss Mosley, we'll have you on your right on the side there, and then Dr. Rice, and John Long on that side.
Should I start?
Almost. Oh, almost ready for you.
Oh, sorry.
You're doing great. You're doing great. That's okay. We're all going to work together. All right. Welcome, and we're ready. Introduce yourself and give us your testimony. Welcome.
My name is Prisha Mosley. I was a 15-year-old girl when the trans community found me. Already diagnosed with multiple mental illnesses, including anorexia, a body dysmorphic disorder, and borderline personality disorder, a trauma disorder, I was easy to manipulate and convince that I had been born in the wrong body. I was told that this was the reason for all of my mental and emotional distress. I was told that changing my gender would cure me. As an impressionable and mentally ill child, I fully believed this. I also believed that my sexual assault, which happened at age 14, only happened to girls. I wanted to transition to be safe, and I was allowed to make permanent changes to my health due to these beliefs. Beginning at 17, high doses of testosterone were injected into my anorexic body. This was done by a pediatrician in the same hospital where I was seeing a nutritionist for my severe malnutritionist and regularly receiving stitches for cutting and other self-harming behavior. What I don't understand is why they never offered me counseling to help me with the depression, the trauma, the personality disorder, or my ongoing self-harm. It was clear that they were solely focused on pushing me into transition without any regard for all of the other clear challenges and issues I was experiencing. Testosterone had extreme side effects, more and more of which I am discovering every day. I suffered hair growth all over my body and hair loss on my head. My shoulders rapidly broadened beyond my frame, causing me to be disproportionate, clumsy, and in pain. My neck, back, and shoulders constantly burn, and all of my joints ache all of the time. Testosterone also caused changes in my vocal cords and throat. I can no longer sing or really raise my voice, and speaking for long periods of time causes me pain. My endocrine system is ruined, and I'm no longer able to regulate my own hormones. I have no choice but to be medicated for this for the rest of my life. One of the worst side effects has been vaginal atrophy. This is the shrinking and thinning of the vagina. It is so severe that I am no longer able to use tampons because it is so small, and I'm afraid that I will tear. This has happened before. 1 year after starting wrong sex hormones, despite persistent self-harm, my healthy breasts were removed. I was told I would have sensation in my chest within 1 year. Instead, my chest is numb except for the occasional zapping pain. I almost lost my nipples. After being grafted, pieces of them stuck to my bandage and fell off, and I no longer have them. During the time in which I was receiving gender-affirming care, my psychiatrists and psychologists had to ask me at the beginning of each appointment what my name was, who the president was, and what year it was, because I was so far from reality. They told me no to liposuction and yes to a radical double mastectomy. I was too unhealthy to consent to lipo, but not to top surgery. I was convinced that my puberty was a disease, and I trusted my doctors and the trans community when they told me they had the cure. But it wasn't true. I stand now before you in an aching body, which is no longer mine. I don't recognize myself when I look in the mirror. I am suffering from severe medical issues with which no doctors will help me, and insurance covers nothing. The medical professionals who did this to me have abandoned me, and the trans community has abandoned me. My doctors assisted me in mutilating myself and then left me in the cold when I wanted the harm to stop. But when I see young girls in my situation, young girls who have experienced sexual trauma, who are suffering from mental illness, and who suffer from body dysmorphia disorders, or who feel pressured by social media or their peers to conform to certain stereotypes of femininity, my heart breaks for them. And while the damage done to my body can never be fully reversed, I can be an advocate for those girls in the same position I was. Thank you.
Thank you for your testimony. Thank you for sharing your experience with us. Committee members, any questions? Senator Campbell, do you have questions?
Thank you. Prisha, thank you so much. You flew down from where?
Michigan.
So members and people watching, Prisha came from Michigan to try to take what has happened to her and help others. She has been abandoned. You can bet everybody was on board to help when she was transitioning. And somebody can speak to the cost. Can you speak to the cost of the dollars that you think insurance put out for all the transitioning?
Insurance paid for the testosterone and all of the blood tests and all of the appointments. It had to be thousands.
Thousands. And today, you were how old, if you don't mind me asking, 26?
25.
25. And you do have insurance? Or you do not?
Yes, and they will cover nothing.
So while insurance paid thousands upon thousands, and just in 2021, just the surgery alone cost, just the surgery market cost raked in $1.9 billion. But that's going forward. Who's taking care of the people if they decide to go backwards? Who's there for their detransitioning? Nobody. So whether you agree that they did it or not, the insurance companies paid, and the people doing it took the money. Now that she's made this decision to detransition, nobody is there. How is that ethical? I ask each of you to think about that. Now, let me get to a question. Tell me about your hormone predicament. Because if you're not getting care, you've sought care, you're not getting care. What are you doing about hormone therapy?
After finally getting my doctor to get a blood test, which she ordered in the male range for some reason, but we finally got it straightened out and figured out that I'm just not producing my own hormones after years of testosterone abuse. And no, she won't prescribe it. She said, I know what you need, I know what dose you need, and I'm not willing to treat you like a guinea pig. So now I'm treating myself with herbs, trying.
Were you? Okay. And when you were getting hormones, you had to have blood tests frequently, didn't you?
Yes.
Right. Yet now that you're off, they've abandoned you.
Yes.
Were you told you would be in chronic pain? I understand you're in chronic pain. That's how you described it.
I was not warned anything about the chronic pain. I have joint pain and my body burns and my pain tolerance is lower.
Is that because you're detransitioning?
Yes, it is due to the testosterone abuse.
All right. Prisha, can you tell me, why did you decide to detransition, if you don't mind? How'd you come to that decision? I think if you're willing to say that, we need to hear, because I don't know.
So I got into a type of trauma therapy called dialectical behavioral therapy, which helps with extreme emotions, emotional regulation, and black and white thinking. And all of the magic that was supposed to happen when I transitioned, like the healing and the euphoria, all happened through actually healing my trauma.
By actually what? I'm sorry?
Healing my trauma.
Oh, so that therapy helped you heal the trauma that you had as you started your testimony, you had prior to the surgery. So after you had surgery, you then found the right counseling that got to the root of the problem, so the arrow was shot at the right target, but after you transitioned.
Yes.
Thank you. Thank you so much, Prisha.
Senator Menendez.
Thank you, Mr. Chairman. Ms. Mosley, thank you for coming today. In your testimony, you mentioned that you were suffering from quite a few things. You said depression. I forget, could you remind me the things that you were going through?
Anorexia and borderline personality disorder too.
So you were going through borderline personality disorder, anorexia, and depression. What age do you recall going through these things?
I got my medical records back, and they predated it to the age of 12. It was like right onset with puberty.
Okay, right around 12. And so maybe that's why someone gave you a diagnosis. Do you recall who made the diagnosis or who told you that if you transitioned that things would get magically better?
Yes, it was my gender-affirming therapist that the trans community told me to find to get a letter of recommendation. That's the key you get that unlocks any hormone and surgery you want. And then the therapist that I was seeing prior to coming out as trans just said that all of my problems would go away, which she had been seeing me for years when I transitioned. Everything was somehow related to being trans.
And you were 12 at the time?
I started serious therapy at 12.
12. And your parents, what did your parents say about this?
My parents were really against it, but I mean, I remember my gender therapist looking him in the eyes and asking, would you rather have a dead daughter or a living son? Do you want to pick up her hormones or her body from the morgue? Those were the only two options given.
How did you end up at this therapist? Who picked them?
I found her myself. I Googled therapists who did gender-affirming care.
So at 12, you Googled a therapist that did gender-affirming care. So
at 15, I started socially transitioning at 15. 12 was when the prior diagnoses of anorexia, borderline, and depression and all that came.
And so when you were having the issues of depression and borderline personality disorder and anorexia, did your parents get you help for that?
Yes, but their treatment-resistant conditions, especially finding DBT, is difficult. There's a lot of stigma against borderlines. It was much harder to find that treatment than trans care.
So it sounds like to me that you had other diagnoses, you couldn't find the right care, and so what you've testified here is that someone said to you, if you do this, this will help, and then in a way they sort of blackmailed your parents, is what you're saying. So it doesn't sound like this was either your decision or your parents' decision, because my concern is not, I don't want anyone to go through what you've gone through. But what I don't want is either for parents who have children who this has been, they've known from a young age that this is what they are, and we're taking that from them, because I don't want them to go through what you're going through. I think that this bill will potentially cause someone to be in a position where they're as unhappy as you are, and I'd hate that for that to happen to anybody. Thank you for coming today, and thank you for sharing your testimony.
Am I allowed to comment on that?
Of course.
Okay, also thank you and you're welcome. But I don't believe that any parent has the right to mutilate and sterilize their child. I don't, but thank you.
I understand.
Senators, any other questions? Thank you for your testimony.
Thank you.
Welcome. Introduce yourself. Give us your testimony.
I'm John Long, a retired pediatrician. I have a medical degree and a master's in physiology from Baylor Medical in Houston. I practiced in the Texas Medical Center area for 33 years, primarily in the Houston metro area, and since retirement, I've obtained a master's in bioethics. I'm present today to support SB 14 as an advocate of children. I view 18 years of age as a bare minimum for gender transitioning treatments, for gender reassignment, or for the treatment of gender dysphoria with either hormones or surgery. Counseling is appropriate if there is gender confusion. And I would say that in my 33 years of practice, I had one instance of some gender confusion in a young boy. It was readily resolved with some counseling, and there were no further problems. It's my opinion that much of this gender dysphoria is projected onto our youth through the culture, through the media, and through their peers and all of the social media with which they interact. That said, I support SB 14 as a protection for all of our youth because they are so impressionable. This gender transitioning is contrary to normal physiology. It subverts natural puberty. It opposes good medical practice when normal tissue is destroyed. It is against the four major principles of bioethics, and those are first, beneficence, to do good, non-maleficence, do no harm, autonomy. Autonomy is the ability of oneself to make serious, rational, and sound decisions, and I believe that is not sufficiently mature enough in young children or even early teens to make these irreversible, life-altering decisions. And fourth, justice is not served when underage youth is permitted or urged to make such life-altering and life-changing, disturbing decisions. Thank you.
Doctor, thank you for your testimony. Committee members, any questions? Dr. Long? Senator Campbell.
Thank you, Dr. Long. It's important, I think, that you're here because of your background in ethics. So of the four principles, bio-principles, there's beneficence, maleficence.
The question?
The four principles of bioethics. You feel two of those four are, or probably three of the four are violated.
Is that why I say 18 is a bare minimum?
Mm-hmm. Well, why do you say that 18 is a bare minimum? Because they're...
Doctor, you were speaking about those principles like
yes.
Beneficence, malevolence, and I think that's what she was asking you about.
What are those again? And what's violated?
I'm sorry, I'm just not getting the
question. Would you go over the four?
What?
It's so hard.
Oh, the four principles are beneficence, which is to do good, non-maleficence, which is simply to do no wrong, and then autonomy, which is one's making of their self-decisions. That's big in medicine now. You can have autonomy about your medical care, whether you want treatment or you don't want treatment, but young children are certainly not in a position to make life-altering decisions such as that. And then the fourth is justice,
and
to do justice, to do what is right.
And I think you touched on it, but why do you think age 18 is the bare minimum? I mean, we set that as adult. Why do you think that's the bare minimum age for these gender-altering procedures? You feel like the age should be moved out?
Okay, can you tell me what she said?
Why do you think 18 is the minimum age?
I think 18 is the minimum age purely because that is just the age of majority. Even in the state of Texas and virtually all other states, the age of adulthood is 21, and so that's a bare minimum, and you're required to be 21 to simply have the transfer of real property or custodial property from a trust or other instrument until you're 21 years of age in virtually every other state. So by legal definition, these children under 21 years of age are not adults.
Thank you. Thank you, Dr. Long. Thank you so much. Where did you drive from, or where do you live? Houston.
Where do I live? I practiced in Houston. I now live in College Station.
Oh, that's right. Thank you. Thank you, Doctor. Thank you, sir.
Thank you.
Thank you, Dr. Long, for your testimony. Dr. Rife, introduce yourself and give us your testimony. Welcome.
Hi. Senator Hughes and members of the committee, hello. My name is Dr. Bethany Rife. I would like to thank you for giving me this opportunity to share my concerns. I've been a pediatrician in Texas for over 10 years, and I am currently raising my own 5 children. I am speaking in support of Senate Bill 14. I would like to specifically address the issue of the lack of evidence to support transgender hormone treatment in children. The American Academy of Pediatrics has supported treating children with hormone therapy to suppress normal pubertal development, as well as cross-sex hormones. In reviewing their policy statement, I find it to be outdated and lacking in any good data to support their stance. At their last meeting, they refused to listen to their members and refused to acknowledge Resolution 27 asking for an evaluation of the new evidence on the issue. In their statement, they cite an article that showed over 60% of gender anxious patients are no longer gender dysphoric after puberty, meaning over 60% self-resolve. And as we've heard tonight, there are other studies that show higher numbers in the 80 to 95% range. Also in their policy statement, they state, and I quote, "Research on long-term risk, particularly in terms of bone metabolism and fertility, is currently limited and provides varied results." So, by their own words, their recommendation is to treat children for something that more often than not resolves on its own with a treatment that we are unsure of the long-term consequences. If I was to treat a cold with the same criteria, it would be medical malpractice. But we're not talking about a cold. We're talking about complicated anxiety issue that is almost always accompanied by depression, anxiety, trauma, and even autism disorders. These children are suffering and confused, and they go to the doctor for help, where they are given hormonal medication that is causing depression, permanent sterility, permanent inability to orgasm, impotence, and lifelong sexual dysfunction. These are not small issues, and the medical community is causing them with this unnecessary medical intervention to stop normal development. And they are doing this while also often ignoring their other mental health issues. These children deserve better. We have studies showing transgender teens are at a higher risk for HIV, STDs, depression, anxiety, and suicide. The American Academy of Pediatrics' answer to this is better healthcare access for them, with no consideration for the most obvious answer. This is a disorder with an almost 90% self-resolution rate. The answer to this is to help them in their self-resolution with counseling and get them out of this high-risk category. Instead, these doctors are helping these kids quickly commit to changing their gender with social affirmation and puberty blockers, often causing irreversible harm. Let me ask you a question. Think back to junior high. Do you remember feeling at all awkward or unsure of yourself? Maybe confused about who you wanted to be or what you wanted with your life? How many teenage ideas or decisions are later regretted? Yet, we're asking these teenagers to commit to permanent, life-altering decisions. For a minute, imagine you're a teen deciding to change genders. So all last year at school, you lived as the opposite gender. Now you're not so sure. Maybe you argued with your parents a lot to get the hormonal treatment, and you can tell that your doctor really supports you. Your doctor even told you and your parents that if you don't do this, you will very likely commit suicide. How do you back out now? How do you tell your friends, your parents, that you want to go back to your original gender? And now that you've been taking this medication for months, it's changing your body. You have no idea what will happen if you stop taking it. Does it sound like the doctors are helping these children, or are they confusing them even more? These children are hurting and they deserve help. Instead, they're being manipulated by the doctors into treatment that destroys their ability to ever have normal sexual function. We need to protect these children from these predatory doctors. Please do so and pass this bill. Thank you for your time, and I'm glad to answer questions about the permanent damage these hormones can do in just a few months.
Dr. Rife, thanks for your testimony. Senators, any questions for Dr. Rife? I saw Senator Middleton first, and we'll go to Senator Lamouty. Senator.
Thank you, Chairman. Thank you, Dr. Rife. Could you maybe go a little more into that, some of the permanent damages that occur from these hormone treatments to children? Because we're talking about both surgical and chemical, but I'd like to hear more about the long-term damage from these drugs.
So when we block the normal development of puberty, we're making these children, we're messing with the children's growth because we're using the same hormones that have to do with growth. So they're not going to grow properly. They may never reach their height that they were supposed to reach. Even though, and I know y'all were talking earlier about slowing puberty and then allowing them to go through puberty later, the growth is already over. You're not going to get that same potential again. So growth is a big thing. After a few months on these hormones, there have been, you get gynecomastia, so the males are developing breasts. Those are not going to go away when we stop the hormones. The females can develop a micropenis. It's not going to go away. The micropenis grows from the clitoris, meaning that this area is incredibly sensitive to them. So there are cases where they have to wear certain clothes in order to not irritate it constantly. And this is a lifelong thing. It's not going to go away. And that's going to be there whether they detransition or not. It's going to destroy, we're going to chemically sterilize them. They may never develop the ability to reproduce at all. That's just a few. The females get osteoporosis. Testosterone treatment has a black box warning on it, causing pulmonary microembolism. That would be a pretty serious issue if you've got a blood clot in your lungs. As she was saying, the vaginal atrophy. So the vagina will not fully develop and the penis will not fully develop. So if you miss that window of normal pubertal development and you delay the normal development, that development does not then progress normally, even if you stop the hormones. So they will never develop a normal size penis. They will never develop a normal size vaginal opening. We're destroying their opportunity to ever have normal sexual function, regardless of whether they decide to detransition or stay transgender. The males are at high risk for hypertension, cholesterol, diabetes in their 20s. The females are at high risk for osteoporosis. There were some cases out of Sweden and those one of the reasons that the overseas clinics, some of those were shut down is they were in wheelchairs because of their osteoporosis in their 20s. That's just a few. I could keep talking.
So in other words, the use of these puberty-blocking drugs is every bit as damaging in the long term as actual surgical
Yes.
interventions. Thank you.
Thank you. Senator LaMantia.
Thank you, Mr. Chairman. Dr. Reif, I had a question about, again, the puberty-suppressing drugs. And you're saying that if you're on them, it's irreversible and the growth will never happen normally. And so they need to go through the natural growth patterns of their body. When we talk about precocious puberty, their body wants to naturally go through puberty at the age of, let's say, 3. And so that stops that from happening, delays it for a period of 10 years until they're about 13. Mm-hmm. And then at that point, are they going to have those same side effects that you talked about earlier, where they won't fully develop because we've delayed that for so long?
So keep in mind, I'm not a endocrinologist. So when we're treating precocious puberty, we are correcting a hormonal imbalance that is wrong. So we're putting them back to normal.
But the body doesn't know it's wrong, which is why it's happening.
But we're fixing it so the body believes it's in the normal state. And we're not using the high doses that we use in transgender treatment. We're using a low dose to correct the imbalance and put them at a more physiologic place. Right. So when they're in their physiologic place, the reason we treat it is to protect their growth, because they will not grow unless we treat them. So we're treating an illness when we're treating precocious puberty. We're treating a physiologic illness that is improper. And so we're going to help them grow. We're going to help them develop normally. And if we don't do that, they may not develop normal sexual function. They may not develop normal growth and those kind of things. So we're correcting the problem. And so it's stopped and they go through their normal pubertal development at a normal age. They still actually, as if I'm remembering correctly, they still tend to be shorter in general than the general population because of their illness. We can't fully fix it to normal. They still tend to be short. And so these drugs are still going to have side effects. But those we're not giving in the high doses, so not like this. But as I described a second ago, we're stopping that so they go through normal puberty. So the pubertal development is going to be normal, so not these side effects that I just described. But those side effects of the drugs that they're taking are going to be gone over by their doctors in a normal fashion, and we're going to get, consent and that kind of thing.
Right, and in the other case of transgender, we're still getting consent, and they're still following medical prescribed practices according to the American Academy of Pediatricians, and yet you're saying that the end result is going to be different than the end result of the precocious puberty situation.
It's different in my understanding. As we just heard in her statement, she was not consented appropriately.
No, I'm talking about when there is consent, and it is appropriate.
I have not heard an instance where a child was properly consented for this type of treatment. I don't know that you can describe all of these side effects and a parent is going to say yes. The parents are told, if you don't do this, and this is probably the third time I've heard this from a patient, the patient is told and the parents are told, if you don't do this, your child's going to commit suicide.
No, but my question was, on the suppressant drug for puberty, are the side effects the same for the precocious child as the same as someone who's transgender?
They can't be the same because the dosages are different, so no.
Okay, but could they, if the dosages were the same, that would be more acceptable?
I don't think it's the same because it's at the different ages. And we're stopping puberty versus when it's supposed to happen versus stopping it when it's not supposed to happen.
Okay. And then with the American Academy of Pediatricians, are there any other issues or topics where you see that they are wrong and they're not issuing rulings or decisions that are not medically or evidence-based? Or is this the only area where you feel strongly that they're doing something wrong and are not advising doctors correctly?
I honestly disagree with the American Academy of Pediatrics on several things.
Okay, thank you. Thank you.
Senator Campbell, you're recognized.
Thank you. Dr. Rife, thank you so much. I can't really see you. I heard you well. Thank you so much for talking to us about the permanency of some of the changes that go on in the body. Thank you so much. You came from where?
I came from East Texas.
East Texas. Thank you so much. And I think I may ask the chair if maybe she can stay, or we could reach her, ask her to stay if we've got another few minutes. We could do that.
Members, any other questions for these three? Senator Menendez, you're recognized.
Just a quick question. How many invited witnesses do we have? I'm assuming these are invited witnesses, and then when does the public testimony start?
Senator, these are invited witnesses, and we have three more, and we also have some folks here from associations and groups so that the committee can get the benefit of all that.
Okay, yeah, I was just trying to figure out for timing purposes, and I understand also to understand the positions. These are witnesses invited to testify, to provide information for the bill, correct?
Yes, sir, that's
Okay.
correct.
Thank you, sir.
Very good. Okay. Ms. Mosley, Dr. Long, Dr. Rife, thank you each for your testimony. Thank you very much for being here. Thanks for sharing with us. We're listening to you. Thank you. And Dr. Rife, if you will stick around, Senator Campbell may have a couple more questions for you. If you don't mind, just hold. In fact, go ahead and keep your seat there, if you will. Thanks. The chair calls Dr. Megan Mooney, Dr. John Carlo, Dr. Louis Apple, and Amanda Afifi. So Dr. Megan Mooney, Dr. John Carlo, Dr. Louis Apple, Amanda Afifi. So we're looking for Dr. Megan Mooney, Dr. John Carlo, Dr. Louis Apple, Amanda Afifi. welcome. We'll begin over here on the right. My left, introduce yourself. Give us your testimony. You.
Thank you, Mr. Chairman and members. My name is Dr. John Carlo. I'm a public health physician from Dallas, Texas, and I'm here speaking on behalf of the Texas Medical Association and it's more than 57,000 members on this bill. I'd like to thank Senator Campbell for the opportunity to have an open door with TMA and to continue this dialogue as we go forward together. The subject matter of this bill, providing gender-affirming medical care to adolescents with gender dysphoria, is a complex one. This is a vulnerable population of patients, which makes the relationship between the patient and the physician even more important. While physicians want to provide medically appropriate care for all patients, we understand that there is an ongoing debate over what is medically appropriate with regard to transgender adolescents. Medical science is continuing to evolve. As physicians, our goal is to treat our patients with the best medical judgment using the best medical evidence available. This includes evaluation of best practices in medical care and continued study and evaluation. Senate Bill 14 would prohibit certain forms of gender-affirming care for adolescents. We appreciate this SB 14 includes exceptions for certain treatments provided with parental consent, such as for those of precocious puberty and for a child born with medically verifiable genetic disorders of sexual development. If this bill continues to move forward with its current prohibitions, we want to highlight a key important area. First, we think it's important for the Texas Medical Board to be the enforcement body for any alleged physician violation and for physicians to have appropriate due process. We have concerns that the bill, as currently drafted, includes language requiring revocation of a medical license for a violation. Second, we would recommend including a grandfather provision or something similar to permit treatment to minors who are already on hormone therapy. It's important to permit continued administration of hormones, as sudden removal could cause extreme negative health consequences. We do not want patients to be negatively impacted by a sudden cessation of therapy or physicians who have to choose between complying with their ongoing ethical obligations and the law. Again, as physicians, the health and welfare of our patients is paramount. Thank you for the opportunity to be here today.
Senator Menendez first. Go ahead.
It's very simple. You represent the Texas Medical Association?
Yes, sir.
And I heard your testimony was very carefully drafted, and you'd like for physicians and doctors to stay in the relationship between the patient and the care. And you, but I didn't get was what was your position on the legislation?
So, on behalf of TMA, we're speaking on the bill.
So you're neutral on the legislation?
Correct.
But even though if the legislation passes, it would change some of the things you described as potentially being, you said something that if you drastically take the hormone therapy away from children who are currently getting it, that would harm them. Wouldn't that go against the do no harm principle?
Mm-mm. We believe in this situation, somebody that is already on hormone treatment, that would represent a significant harm, and so that would be a consideration in the part of drafting the final legislation.
Okay, I've heard that as well, and I was just wanting to clarify because your testimony didn't seem to be consistent with your position on the bill, but I understand there might be other compelling reasons. Thank you, Mr. Chairman.
Senator Campbell.
Thank you. So, like Senator Menendez says, you're saying on, but it sounds like you're against the bill. Sounds like you have a problem with when we have them surrender their license, we take their license away, right? And then you talk about how dangerous it can be just to stop the hormone therapy. But yet when someone wants to detransition, they can't even find a doctor to help them with that. And I'm not saying that's everyone, but can you tell me, and the other associations, obviously you're in the seat first, where is the science for detransitioning so that a doctor doesn't have to just stop it stop seeing the patient. They can then make changes for detransitioning. Where is that science?
So again, let me
Just give me the,
sure.
so I can look it up.
Let me just start by reminding, just on behalf of TMA, we're on this bill, so we're not speaking against it or for it. We
I
have
heard that.
suggestions to make this bill better, and we want to have
Sure.
that discussion. On the topic of detransitioner and that conversation, I will tell you that from the information, that the literature we have, okay, and the science that we have in front of us today, is that gender detransitioning is very, very rare. And we've seen it as low as 1%. And in Texas, when you talk to our Texas physicians that have been involved in gender dysphoria and gender care, many of them know none of their patients that have had problems with detransitioning.
So my question was, where's the science for detransitioning, not how many detransition?
The literature is showing that it is very, very rare.
So what I would, okay, so you're answering a different question. What does the literature show on the rarity of detransitioning? But my question is, where is the science? Where is the protocol, the best practice for a doctor? And maybe they can answer, but where is that protocol for detransitioning?
Okay, I'm sorry, I misunderstood your question.
That's
So
okay.
so you're asking for somebody that is detransitioning, what is the protocol or practice in the...
Well, I really just want to know where the research is, because
Yeah.
something that we all do as physicians, we practice in an arena of truth. We're taught that when we are medical students and we make rounds and we give an answer to our attending. They want to know where you got it. And then they'll pimp us all the way back, which follows the pathology. And we've all had that. That's based on science. And you started out about, you said something about science and how we practice on science. Where is the science to give these puberty blockers? Because there are white papers, there are anecdotal notes, but there is not a controlled, unless somebody can show it to me, there's not a controlled study, a good research study showing a control group and the outcomes.
So I would say first that as physicians, we do this every day.
Do
We
what?
practice medicine with a degree of uncertainty. It happens every day. We wish we had more information.
Let me just cut to the chase. Yes, there are some things that we do, but by and large, for instance, when we take care of congestive heart failure, we know if they come in acutely, then you put a non-invasive mask, CPAP or BiPAP, and you decrease the preload and the afterload, and you try to get them out of the critical state. That's based on science. It's measurable. We can't find science. I have not been able to find any science to show the true best practice to give these drugs and the benefit of them. So that's what I wanted to get, because I am a physician, a practicing physician. I know you know that. But we are not practicing in an arena of truth. And I believe that we are giving treatment to children without, definitely the children don't understand. I believe the parents are misguided and they are afraid their child will commit suicide. And I do not believe that the physicians doing this are practicing in truth and truly believe, maybe they truly believe it's going to change their gender dysphoria, but there's no science to base that on. As a matter of fact, quite the contrary. And that's why European countries are beginning to dial it back. Thank you, Mr. Chairman.
Thank you, Senator Campbell. I want to make sure I'm clear because I heard your testimony. Thank you for being here. And Senator Menendez asked you some questions. So what is your position on the bill? I want to make sure it seems like maybe some of the follow-up remarks might have questioned whether your position really is your position.
Again, this is a complex issue. We at the TMA, speaking on behalf of 57,000 physicians that are using the best evidence in the science to take care of all of our patients, are speaking on this bill with the hope and the opportunity to engage in further discussion to make the corrections, as I pointed out, effective.
Senator Menendez.
Mr. Chairman, I'd like to apologize to Dr. Carlo. Dr. Carlo, I did not mean to put you in a difficult position. Obviously, you made a conscious decision when you hit the button that you were for, on, or against. You have your testimony. The reason that I did was because I recognized that a year ago, TMI issued an amicus brief where you recognize, and I quote, gender-affirming care as the accepted medically necessary treatment for adolescents with gender dysphoria in Doe versus Abbott. So I would have understood or felt that TMA's position there was still TMA's position today. But today, you've testified you're on the bill, and for the reasons you've testified. I'm sorry that I questioned your position. I apologize, Mr. Chairman.
Mr. Chairman.
Senator Campbell.
Did you all poll all 57,000 doctors? Because it's easy to come in and say you represent all of us. Did you poll them? All
So,
57,000?
Senator Campbell, you know how the TMA works and
I
how our
do.
process is. So if I'll just real
Makes
quickly
my
go through it.
question easy.
Real quick. Yep. We follow a House of Delegates system, and we have policy in place that talks about gender.
And what I'm wondering, and I know I just spoke over you, but I don't want to belabor this. What's the median age of those making the policy? Those that decided just to be on this bill or against or promoting the gender affirming care?
I'm not sure I understand your question.
I just want to know the age of the doctors, the age of the delegates that come together and make a platform, list what you're for and what you're against.
So you want the average age of the 500 some odd delegates
That get together.
We can certainly give you that. I don't know that off the top of my head.
Okay. Well, I think you can put down 56,999 because I definitely am not on that list. And I am a member of TMA. Thank you. Thank you, Mr. Chairman.
Doctor, did you hear the testimony from Precia Mosley earlier?
Yes.
Did anything she said have any effect on your view of this issue or this bill?
Well, I think we all, when we hear any situation like what we heard today, my heart goes out to her, of course, and we all understand that these situations are very, very complex. And what did speak to me is the importance of how a doctor and patient relationship is really what makes the difference in people's lives. And so, I can't say specifically, of course, what happened, but I, always wish that there's always a good doctor for every patient.
Did you hear Dr. Reif's testimony about the irreversible nature of the effects of both chemical and surgical treatment?
I did.
Do you agree with what she said?
I think there is some discussion ongoing about hormones and then puberty blockers as well. I think we agree that surgery is, of course, definitive, but I do think that in particular puberty blockers have been used for medical conditions such as precocious puberty, and we have experience with using those medications, and so we know the long-term effects in those populations. I will say, yes, we don't have certainty like we would like about the long-term consequences of using puberty blockers in gender dysphoria, but this is, again, the best evidence that we have today is what we're using to take care of our patients.
When you say surgery is definitive, if I heard you right, obviously I'm not the smartest guy, but does that mean it's done, it's not easily undone, cannot be undone? When we say surgery is definitive, she described it was unpleasant to listen to, but she described literal physical conditions that exist after these surgeries. Do you agree with what she said?
I would never disagree with anybody in their own perspective and their own narrative at all. So, those stories are her own, and I take those as she said them.
No, I'm asking about Dr. Reif's testimony about the physical effects of those surgeries.
So, yes, I think the physical effects of surgeries are developed and they are permanent, as we've discussed. And so I think, this is why when we look at any type of a medical intervention, we have to look at the risks and the benefits. And so going into any type of things like a surgery, we'd have to know those consequences ahead of time.
Senator Perry.
Yeah, and I'm just going to take a point. And first of all, I appreciate the fact that y'all were pretty clear probably a session or two ago, and I think your white paper or whatever Senator Mendez quoted, but today you said you're on it, and you referenced ongoing science. So in some ways that gives me some comfort that you're paying attention, but I guess, and it's not a question you can answer, it's kind of, we don't have the science to know what's good. And even between the patient, and I understand that conversation, but it's an evolution. That's what I said on the front end of this. You talk about this issue 6 years ago, there was a lot less conversation because there wasn't as many, but a lot of things are beginning to come out. So it just turns me a little bit that it really is something that we have probably more harm than good, because I heard the question earlier about, what about the detransitioning? It's only 1%. Well, the truth of the matter is, it's a self-fulfilling prophecy. There's not anything you can really do to reverse it, so why go down that road? If you do it, it's extremely expensive, and I'm told very painful. So that's not a fair comparison. I mean, the fact that nobody's doing it and it's the obvious is I'm not going to undo it, and it's expensive and it's painful. So I don't know that that's a good statistic quote, but I will give you credit for what I'm hearing is an evolution within your medical, the ears, you're listening to a lot of folks and things and seeing it, but it just seems to me that there's more that can happen that's bad and it's good, and I'm not a physician, but the fact that it is irreversible, you acknowledge it's irreversible, you heard the testimony, and there's many people like that, but at 1%, detransitioning doesn't give me any perspective, because most people that get into this don't see an out,
Right.
because there is no financial help, and there's really, and you can't reverse it. But I do give you credit as an association, and I think it's a maturity of an association I wouldn't recognize 10 years ago. I don't think they would always come in here and be heck bent on against whatever it was, but I do appreciate the fact that what I sense is y'all are clearly saying we don't know what we don't know, but we think the best practices are. But and we're not going to win that debate, but best practices are today. There just seems to be a mountain of evidence stacking up against that every day.
And is it okay if I just make a quick comment?
Go ahead.
Thank you. While I agree, we've made the statement that science evolves. This is very true, but I do want to not forget the fact that today we're taking good care of people, and there are people with gender dysphoria that have had significant benefit as a result of these therapies, and they may not come in here today to talk, right? You may not hear their voices. We'll have other people that are going to be talking for them about those patients. But if you talk to the doctors that are in this state taking care of patients that have been doing this, they have great results. They've made people's lives better. And that's where I focus. Yes, no 1% is still unacceptable. I agree. And we should be doing more to make sure we understand this phenomenon. But right now, with the science that we have, I just don't want to forget the fact we do a great job for a lot of people in this state that have no other option and would have just never been able to get past this. Thank you.
Senator Menendez.
Very quick question. Do you practice this type of medicine, or do we have any doctors here today that practice this type of medicine?
We're going to have others coming up. Yes.
Great. Well, because I just want to, the question that I have so that anybody can get ready is, when visiting with a potential patient who comes in, what are the safeguards and the steps that go into before you start making medical decisions that could have long-term ramifications? Because sometimes it appears that the narrative is made that this is something that's done, I'm not going to say cavalierly or lightly, but I just cannot begin to imagine that anybody would take long-term, potentially irreversible medical decisions lightly. And so, when we get to the people who actually do this, I'd like to know, what do you do? And if this legislation becomes law, where do you see the potential unintended consequences? Because in my heart of hearts, knowing Senator Campbell as a doctor and watching her heal people, knowing her as a parent and watching her parent her child, I know that in her heart of hearts, she wants to do the right thing. So I don't think she'd ever want to do the wrong thing. So I just want to know, how do we get to a place where people aren't hurt? So if you're not that person, I'll wait. Thank you.
Very good. Introduce yourself. Give us your testimony.
Good afternoon, Mr. Chair, members of the committee. Thank you. Sorry about that. Good afternoon, Mr. Chair and members of the committee. My name is Dr. Megan Mooney. I'm here representing myself as well as the Texas Psychological Association in opposition to SB 14. I'm a licensed psychologist practicing in Houston, and I have the privilege to serve parents and their children in my practice. The kind of medical care that SB 14 seeks to prohibit for children is literally life-saving. Both the Texas Psychological Association and the American Psychological Association support gender-affirming psychological care and psychologists' important role in helping parents making decisions about possible medical care for their children. The role of psychologists and other mental health professionals in the care of transgender and gender-diverse youth includes supporting parents in understanding normal child and adolescent development, careful consideration of DSM-5 criteria for gender dysphoria when appropriate, along with the WPATH standards of care for transgender youth, and providing recommendations for parents to make the best decisions in the best interest of their child's health. This treatment includes a careful and thoughtful process. It is not quick. It may last months, if not years. This treatment process, like all others for mental health care of youth, is collaborative and involves considerations of the goals of the young person as well as their parents in the context of our professional standards of care and the evidence of effective therapies. The role of psychologists often includes supporting transgender youth in the context of harassment and discrimination, as well as helping them manage expectations, anxiety, and dysphoria while regularly assessing for the potential of suicide risk. We have considerable data about the important mental health benefits of medical interventions, including puberty blockers and hormone treatments for transgender youth. Research has demonstrated that gender-affirming medical care decreases suicidality, depression, and anxiety, as well as increases self-confidence and improves body image. With appropriate medical care, transgender youth may have decreased need for therapy and psychotropic medications. In addition to evidence of the positive mental health impacts of gender-affirming medical care, we also have data about the potential psychological harms of delaying treatment. For example, later age of beginning medical treatments has been associated with worsening mental health, including increased risk of suicidal ideation, suicide attempts, and self-harming behaviors. Furthermore, these youth continue to experience gender dysphoria, and this may worsen, which can result in increased or continued reliance on psychotropic medications and therapy. Thus, requiring a person to delay evidence-based gender-affirming medical care is not a neutral option. It is one that creates increased risk for psychological distress, including thoughts or possible attempts of suicide. I urge you to consider what science tells us consistently. Gender-affirming medical care is the recommended evidence-based approach to treat gender dysphoria in youth. It's supported by every major medical and mental health association and is keeping with my ethics code as a psychologist. This legislation will harm children as opposed to helping them, so TPA and I thus strongly urge you to oppose SB 14.
Senator Menendez.
Thank you, Mr. Chairman. Dr. Mooney, you've heard all of the testimony today. In your opinion, I don't want to put any words in my mouth. What happened to the witness who was invited, who came in, I believe, from Michigan? Is that the type of experience that most patients have, where they're led down a place, or how does that differ from what the care where people are given? Because in that case, it seems like the parents were told that the child might commit suicide. And we've heard a lot about whether or not suicide rates are high or they're not high. You said you have data. So I'm assuming your data is based on actual science, things that have happened. Could you elaborate on this, please?
Yes, sir. Thank you for the question. We do have multiple peer-reviewed studies. We do have peer-reviewed studies in scientific journals for both psychology and psychiatry demonstrating increased risk of suicidality when young children and adolescents' gender is not affirmed, whether that is through medical care, psychological interventions, et cetera. But we also do have data, as I mentioned, that delaying treatment may result in increased depression, anxiety, et cetera. The kind of care that was described by the witness earlier today is certainly not in keeping with any professional standards of care that I have heard from my national association or from international associations regarding standards of care for any treatment of transgender people, regardless whether adults or adolescents.
What is the role that parents get to play in the treatment of their children when they're seeking help? What role do they play?
Again, really, this is standard of care for all of our practice in mental health is parents are involved, right? As has been referenced, minors are unable to consent to treatment. They must have a parent's consent for treatment. And in the standard of practice for those of us who specialize in child and family work, parents are a part of that. They are part of the initial interview, of the treatment planning process, of the ongoing treatment. So that is whether I'm talking about ADHD, anxiety, depression, or gender dysphoria. The standard is parental involvement.
And what are the best practices when treating gender dysphoria?
Right. So, what we keep seeing in the data in my journals is that medical care, gender-affirming medical care, is the standard of care that is the most effective in treating the psychological symptoms related to gender dysphoria. So in addition to that, if medical care is not something we are pursuing, or in addition to ongoing medical care, I also work with the young people regularly on anxiety, on depression, on everyday concerns of adolescents in public schools, with their siblings, with their parents, all sorts of, just sort of average teenage things.
Right. So along those lines, do you feel that you would start treating someone for dysphoria with anything that's irreversible if you felt that they were maybe doing something? Earlier today, there was a witness who said that they felt that it was peer pressure or the media or social, that this was sort of a whim. Do you find that the patients and their parents who come to you, is this something that they've just decided to one day they woke up, or is this something that they've been grappling with? Let us in a little bit into the insight of the typical patient.
Thank you. So first, to clarify, I'm not a physician, so I don't provide any of the medical care that we're talking about in terms of blockers, hormones, et cetera. But in terms of the families who present to me for therapy, I would say typically the young people have been thinking on this for quite a number of years before they get to me and before they've said something to their parents, who are then the ones who bring them to me. And then after they meet with me, we're talking about, as I said, it could be weeks, months, et cetera, of, depending on the interval of therapy sessions, as we are understanding the child or adolescent's treatment goals, their parents' treatment goals, and understanding all the possibilities in terms of best practices and interventions, which then may include a consultation with a medical professional to have them look at their standards of care and see what is in the best interest of the child at that point. But I do want to emphasize this is a very collaborative process where parents are driving this ship, so to say. They are the ones who come to me saying, Dr. Mooney, we need help and guidance. We need resources. And I happily provide them with data and science and articles and resources so that they can make the best possible choices for their children. And then again, refer them to physicians who are providing this care and can give them good medical information about all of the risks and benefits of the care so that they can make the best choices.
It has been stated that some parents feel almost a fear, such a fear that they've been blackmailed to believe that their child may commit suicide if they don't do this. Has it been your experience that the parents are pushing or will push a child into care because they feel that they're being coerced under the threat of suicide?
No, sir. If anything, I would say almost universally the parents are very concerned for their child's health and well-being and are concerned about jumping into decisions and are not wanting to rush into anything. It is usually the young people who are trying to get us to move faster. And so that's where the careful process of working with parents comes in. But no, the parents I work with are very thoughtful, very considerate. They want data, they want science, they want information, and they want to make the best possible choices for their children. They do not do so in a rushed fashion.
Right. My last question is, so based on everything I've heard you say, is it your professional opinion, doctor, and you're a PhD, that's why I keep calling you doctor.
Yes, sir.
It is your professional opinion that parents are making these decisions based on a confidential, thoughtful relationship with the goal being the best interest of the child?
Yes, sir.
Thank you. Thank you, Mr. Chairman.
Senator Lamontia.
Thank you, Mr. Chairman. Dr. Mooney, you mentioned the collaborative aspect of this. How many different doctors and what specialties are all involved once a child decides or comes with their parents and wants to start on the process of transgender and transitioning?
It depends on the age. So we could be talking about, a psychologist or other mental health professional, as well as a pediatrician or an adolescent medicine specialist, an endocrinologist, possibly a psychiatrist. We are talking at a minimum 2 different healthcare professionals. It must be at least a mental health professional and 1 medical physician. That is the bare minimum, and often my experience is that there's more involved than that.
And if at any point any one of these physicians feel that the child maybe isn't ready for the next step, or they feel that there's another condition, a mental issue that needs to be addressed first, they can stop the process and talk to the parents and talk to the child and advise the next steps before conditioning on the transitioning?
Absolutely. That is part of our standards of care.
Thank you.
Senator Perry, you're recognized.
Thank you. I don't know if you track it or would know, but out of 10 kids that show up presenting dysphoria, some kind of issue, do you have a feel for, out of those 10, is 80% grow through it? Do they all transition? I mean, can you give me some kind of a perspective on what your experience has been?
So I'll answer 2 ways, if I might, Senator. So data, again, suggests along the lines of what Dr. Carlo referenced, that we're talking maybe 1 to 3% of people do not persist with a transgender or gender diverse identity from childhood through adulthood, possibly. In my clinical practice, because I'm dealing with young children through adolescence, I would say it's variable. So there are, children, teens, parents who are not ready to move forward with a medical intervention for a variety of reasons. That doesn't mean that they are no longer transgender. So I think that there's sort of important differences there that in my clinical practice, I have not had any young people say to me at some point, I'm no longer transgender.
So 100% of the kids that come to you end up on some type of program, be it counseling, therapy, drugs, or surgery? Because what you just said is your experience, right. You've never had a kid that eventually effectively walked away from the conversation, felt like they were drawn through it, because statistically a large part of the kids get through puberty naturally, they're doing fine. But what you just said was you haven't had a child come through your arena that did not, if some states say, continue to transition, be it surgical or medical or others. Did I hear you wrong?
Yes, if I might clarify.
Yeah, clarify, please, because that's very telling to me that every kid that comes through your program would say they're going to continue with this issue.
Right. So what I would say is that there are a variety of young people and their families who do not continue in therapy with me as they don't need it. So when children are well supported in a safe school, safe community with good parents, good family members, they usually don't need psychotherapy at that time. So many children that I assess actually don't persist in treatment with me at that time.
So you don't know how many kids that went through your program that ultimately quit therapy that may consider themselves transitioning or may consider themselves non-transitioners anymore?
No, what I'm saying is that there are assessments I do, so perhaps 1 session, 2 sessions, and those children are fine and are well supported in their transgender identity by their communities, and so they don't continue in treatment, which I would not define as a program as you're characterizing it. Of those who do continue to engage in psychotherapy with me, that yes, I would say that the families have chosen to see me because of my expertise in this field, and so they do tend to stay with me to receive affirming care in consult with their physicians when that's appropriate.
And I'm just, I don't know statistically how that works in my mind, that every child that comes through your program is going to stay in some type of program. And I know that's not the term for it, but so what that tells me is you're very much, leading's not the right word, but do you ever talk about the other side of the conversation, that you may not be transitioning, this could be natural, some kids have this, it goes through it. I mean, what I heard you say is pretty much everybody that comes through my front door is going to be in the transitioning or transitioned perspective the rest of their life. Now, I'm not putting words in your mouth, but that's what you're telling us with your testimony.
What I'm saying, so no, I see a lot of other children that are not transgender.
Take those off the table.
No,
You've got different population, but whoever walks into your door that says, I feel like I'm the wrong sex, identify differently, you're basically saying 100% of those kids never deviate from that if they come through your program.
There are young people who come to my office and say, I don't know, Dr. Mooney, how I would describe, what language I would use to describe my gender identity. I would like to explore that. I would like to question it. So I do have those conversations with those young people. And sometimes they persist in therapy with me and continue along a path of gender-affirming treatment. And other times we shift focus and talk about anxiety or depression or other things, whatever. Again, this is a process driven by the parent and the child, not by me.
I don't hear a lot of parents in it, but that's just very few things are 100% or absolute. Only one thing I know of that's absolute truth. But in this conversation, it's shocking to me that every kid that walks in your door with that is, from what you're telling me, is pretty much in perpetuity, as far as you know.
Correct.
Yeah, Senator Menendez.
I'd just like to clarify that question. I'm curious. Does everybody who comes before you, do they all get the same treatment? Do they all come in and say, I want hormones, and you put them, or is every person uniquely, and are you like the expert in this field? So therefore people who are questioning what they feel, is that why they seek you out?
Okay, multiple layers to that question. So every single client I see has an individual treatment plan that is developed based on what a young person, their parent comes to me and says are their stated desires for their psychotherapy with me. So a treatment plan for ADHD could be different across 5 different children I see, just as my treatment plan for children suffering from gender dysphoria might be different across all of them. So no, there is not a program, there is not one set treatment. It is driven by the parents and their children what our treatment entails. And now I have lost track of the second part of your question. I'm sorry, Senator.
I guess one reason why many of the people who come to see you, you haven't seen them say, I no longer feel like I'm in transition, or I want to transition, or I don't. Even though you've just testified, they don't all get on hormones, they don't all have surgery, they don't.
Correct.
But it's because many have heard, well, you are a PhD who has expertise in this field. Is that why people come to see you?
Thank you for refreshing my memory. Yes, I would not say I'm the expert, but I would say that I am somebody who does specialize in this care and have done so for over a decade now. And so certainly within my community, I am respected and I treat that with great humility, and I'm honored by the children and families and parents who come see me every day.
So if I have a heart condition, I go see a cardiologist, and just because I see the cardiologist, my heart condition doesn't go away. But if in your condition, you're not going to give everyone that comes to you, you don't try to talk them into anything, because I think that's the picture that people try to say, is that there's a cottage industry of people trying to force them into transition.
Right. No, certainly not. Again, I'm following standards of care set forward by the WPATH as well as the American Psychological Association. So, and I constantly read research journals, making sure that I'm up to date on what the research is saying about the psychological impacts of medical care and of therapy.
Mm-hmm.
Thank you, Doctor.
Senator Campbell.
Thank you, Mr. Chairman. Whenever a child comes in and says, I'm a trans kid, do you believe them?
Yes.
So when a 12-year-old comes in to a clinic and says, I'm trans, you believe her, if it was a
Yes.
girl. So what's the basis for prescribing puberty blockers? Is being trans enough, or are there some trans kids that you might say no to?
I'm not a prescribing physician, so I can't speak to the.
Yes, but you are the one that is there to either sign a paper that says they've had therapy and it's okay to put them on medications, right?
I am there to say that they meet criteria for clinical distress.
So
which
they
may
see you, they get to you because you're a known expert. So they're referred to you, you see them, you believe them, you sign a form, they take it to the doc, and they're able to they've had the counseling, and they're able now to get the medicines.
It is not that simplistic, no, Senator.
Well, I'm just cutting to the chase. That's what they do. Do you ever tell them no? Do you ever not sign one? If they say they're trans child, do you ever not sign the form that would allow them to get therapy from a physician?
There's not a form to sign.
Well, you sign something, a letter.
I write an individualized letter.
Okay,
That is something that a parent requests that I provide for a treating physician.
Okay, so let me stop you there. I just don't. It's a letter, not a form. Is there ever a time when a trans child comes in, or a child comes in, says they're trans, you believe them, that you do not sign a letter? Because the parents are wanting a letter so that they can get the child on medication.
When, again, after
it's just yes or no
conversation with the child and their parent about their treatment goals jointly as a family, and if I judge that in what I know from psychological science, that's in the best clinical interest.
I really don't need all that. But your decision is based on the child believing the child is a transgender child.
Yes.
Okay. So you used WPATH. You want to tell them what WPATH is. And do you use the recommended guidelines from this place called WPATH?
I'm sorry, can you say that last part again?
Do you use the guidelines recommended by WPATH? And tell the group what WPATH is, please.
It's the World Professional Association of Transgender Healthcare. We are on.
And speak into that mic a little better.
It is the World Professional Association of Transgender Healthcare. We are on Standards of Care version 8. And yes, I would say that I follow those standards of care in terms of what psychological care entails.
Okay. And members, I do believe it's an activist group that is presenting itself like a medical group, and I know it's mixed with different professionals, and they provide guidelines, but I have not seen. I'd like for you to share with us the research that you say you read your magazines, your journals all the time. I'd like to see research, true research, not just what somebody thinks, not what they've just seen in their practice, not anecdotal. I'd like to see research, because the European countries have all, Sweden, Dutch, UK, Finland, all, and I'm leaving somebody out, have all not found enough medical evidence, psychological evidence, to support therapy with transgender therapy. They've not found that. They have found do you believe there's comorbidities? I think you did say they come in with additional DSM-5 diagnoses, correct?
Yes, ma'am.
So if they come in with those, are you directing care for if they're depression with an anxious mood or an eating disorder? Are you taking care of that before you recommend gender-affirming care?
If that is the predominant clinical concern,
But of course, if the child says, and I am kind of locking you up in a box because you're telling me every time a child says, yes, I'm transgender, that's a pathway they go down. But we know there are comorbidities related. You know, just gender dysphoria just doesn't come up isolated on its own. Well, let me do say, this World Professional Association for Transgender Health, their latest guideline, they deleted the chapter on ethics. They deleted all reference to age recommendations. And they did add, you recall what at least one of the new viable gender labels are that they added to the book?
I'm not sure to what you're referencing.
They added a new gender viable or viable gender, a new diagnosis that a child can know they are. They added a new one. Do you know what it is?
Are you referencing gender incongruence?
No, I'm referencing eunuch.
Oh,
You aware?
no, Senator.
Yes. What do you think about that? Would you like to tell them what that means?
I'm not sure how WPATH has defined that term, and that sounds like a medical term that would be outside of my scope to provide testimony.
All right, well, it's exactly what it says it is, that a child can know that a male, they can know that they're a eunuch and they want their penis chopped off. And that they're old enough at age 8 or so, they know that. So this WPATH, that you follow their guidelines, and their guidelines are not standards based on science. But they have added that diagnosis. So at some point, I'm expecting to see it in the DSM-5. Well, that's if I looked at DSM-5 more. The American insurance companies look at this group to rely on what they feel is necessary, medically necessary. Do you know who Dr. Rita Catalia is?
No, Senator.
And that's really probably a loaded question, I'll admit that, because that's a chief psychiatrist at University of Pediatric Gender Clinics in Finland. So who's going to know about that? Except somebody who is an expert in their field reading journals. She's a top expert on pediatric gender medicine. She said, quoted, I'm quoting, "It is not justified to tell parents of young people identifying as transgender that a young person is at risk for suicide without medical treatments, and that the danger can be alleviated with gender reassignment." She added, "The transition or suicide narrative is purposeful disinformation. Spreading it is irresponsible." So the association you used to get guidelines from is called the World Path, it's called WPATH, World Professional Association for Transgender Health. So they are aware of all the data from these countries, which again is just data. I won't go any further, but members, I want you to know that that association has some questions about itself. Thank you, Mr. Chairman.
Thanks for your testimony. Welcome. Introduce yourself. Give us your testimony. Hold just a second. Senator Campbell.
I do want to ask Dr. Rife, thank you. I do want to ask Dr. Rife, you've heard what TMA said, but more important, you heard somebody who practices psychology, an expert in her field. You are a pediatrician and deal with children that have psychological concerns, behavioral illness. Is there anything you'd like to add or make a statement about what her testimony was? Would you push that?
Okay. I'm curious how many sessions and how long the therapy that they do with these kids, how many sessions do they have to do with a counselor before they move on to hormonal treatment? I haven't seen any kind of consensus on what that amount of time is. And I'm not sure what WPATH recommends. But I am curious as to that, like how many sessions. She mentioned at one point 1 or 2 sessions, and I'm not sure what she was referring to. But how many sessions do they require? We do know the Washington University in St. Louis, the whistleblower that came out there, she said they were requiring 1 session with a psychologist, and then they were referred over for hormonal treatment with an endocrinologist. And so it's very concerning. They need more than 1 session. This is not fair to these children. So I was curious what her standard was.
Okay. And I probably should have asked you the question so she could answer, but we do need to move on. We've got a lot of folks waiting. Thank you. There's one more after the next witness. Thank you, Chairman, Mr. Chairman.
Thank you. Introduce yourself. Give us your testimony. Welcome.
Hi, Chair Hughes and committee members. My name is Dr. Louis Appel. I'm a practicing pediatrician and current president of the Texas Pediatric Society, which represents more than 4,800 pediatricians, pediatric subspecialists, and medical students. I'm here testifying on behalf of...
I have to get a little closer to the microphone.
I'm sorry.
So we can hear you.
I'm here testifying on behalf of the Texas Pediatric Society in opposition to Senate Bill 14. SB 14 would cause significant harm to the health of transgender youth in Texas and prohibit physicians from using their medical education, training, and experience to work with families to determine the best course of treatment for their children. Indeed, SB 14 would require the Texas Medical Board to revoke the license of a physician following established care guidelines. There are carefully developed guidelines supported by multiple medical organizations that provide for safe and appropriate health care for transgender youth. Transgender children and teens are particularly at risk of feeling unsafe and are at significantly increased risk for suicidal ideation and suicide attempts. When transgender youth with gender dysphoria are provided with appropriate gender-affirming care, including puberty-suppressing medication, there are mental health benefits that include decreased levels of suicidality. The decision of whether and when to initiate gender-affirmative treatment is personal and involves careful consideration of risks, benefits, and other factors unique to each patient and family. The process involves psychological and medical evaluations over time with the participation and consent of a child's parents. Before puberty, no medical or surgical treatment is used at all. Only after the onset of puberty is medical treatment considered, and only then in certain patients, again with the consent of the child's parents. Treatment with medications to temporarily suppress puberty is reversible and allows the patient and their family time, with the ongoing medical supervision of their doctor, to explore their gender identity, access psychosocial supports, and further determine their treatment goals. Puberty-suppressing medications delay the development of secondary sex characteristics that often spark intense distress for transgender patients. These same medications are commonly prescribed for other conditions, such as early puberty in children and prostate conditions in men, and their safety is well documented. Later, generally after the age of 16 and after living in their gender identity for some time, teenagers with the consent of their parents can elect to receive hormonal therapy if it's indicated. Hormonal therapy has some effects that are reversible and some that are not, and when it occurs, only occurs after extensive discussion among the patient, family, and healthcare team. Surgical procedures are not a part of the standard of care for minors. As physicians, we must be able to practice medicine that is informed by our years of medical experience, education, and training, and available evidence, which does evolve with time. All medical treatments involve weighing the risks and benefits of both treating a condition and not treating it. Gender-affirming care and the treatment of gender dysphoria is no different. In weighing the various factors that come into play for individual patients and families is something that is best left to the patients and their families, with guidance and consultation from their healthcare providers. A blanket ban on these medical treatments is a very blunt instrument for the state to use and prohibits treatment options that are critical for the health and well-being of transgender youth with gender dysphoria. Thank you.
Doctor, you said it was a very blunt instrument. Did you hear Prisha Mosley's testimony at the beginning of this hearing?
Yes, sir.
What did you think about that?
I agree with others who said it sounds like a very unfortunate set of treatments and does not seem to me to prescribe to what the standard of care is.
Blunt instrument would be an understatement for what she went through, wouldn't you say?
I don't want to characterize what she said. She spoke for herself, and I think that's appropriate. When I'm referring to a blunt instrument, I'm saying completely banning a class of medications for the treatment of a condition without taking into account the complexities of the individual situations and the individual risks that are occurring for a child and the parents who are trying to do the best for that child, completely taking those options off the table and making them illegal, I feel is simply doesn't take into account the individual circumstances that occur with individual patients. It doesn't allow for an individualized assessment of risk and benefit.
I was struck by what an odd and ironic word choice it was, given the testimony we've heard. Members, any questions for the doctor? Senator Menendez.
Thank you, Mr. Chairman. Dr. Appel, do you practice this type of care, or did you just draw the short stick on behalf of the Texas Pediatric Society?
I am a primary care pediatrician. I have not prescribed these medications for any of my patients specifically. I do wish that the environment were such that the folks that are more expert in this care and directly provide it did not feel that their safety and the safety of their patients was threatened by being able to come forward and speak on legislation such as this.
So what you just said, you wish that the people who practice this, that their safety, that they didn't feel unsafe and could come forward. Is that what you just said?
Yes, sir.
I'm very saddened and concerned by that as well. I don't believe anybody should feel unsafe coming before us. Your last paragraph says, this bill rejects thoughtful and effective evidence-based treatment. So you have evidence-based this treatment for a vulnerable group of children. It creates barriers that will cause Texas families irreversible harm, increasing the risk of negative health outcomes for these youth. So you feel, because I've heard from Senator Campbell, that as long as things were science-based, and so you believe that there is science that affirms that this is treatment that is actual medical treatment. Is that your testimony today?
That is my testimony. I will agree with what Dr. Carlos said earlier, which is that information evolves, and in medical practice, we stay open to understanding what the best science is. But the best science, to my understanding at this point, and the assessment of the Texas Pediatric Society at this point, is that the best science supports this care.
And it appears from your letter that you have here that teenagers, after having living their gender identity for some time, teenagers with the consent of their parents can elect to receive hormonal therapy if it is indicated. So the decision is based on a combination of with the patient, sometimes being teenagers, the parents, and the medical professional. And so is this something that you would see do you think someone would see a psychologist once, say they want hormones, and then the doctor starts treating them?
What I can say is that the physicians that I have spoken to who provide this care, that is not the scenario that they have described. And the physicians that I've spoken to involved in this care, the involvement with the patients is on a much longer time frame.
Thank you, Doctor. Thank you, Mr. Chairman.
Senator Campbell.
I'm not going to ask you any questions because we've got some other witnesses we really need to get going. But Dr. Rife, just real quickly, do you have any response to what he had?
You mentioned the age of 16 in your testimony.
But talk into the mic a little bit.
You mentioned the age of 16. What was that? You said at the age of 16 start hormones, or could you clarify? I might have missed it.
Just that typically that's my understanding in terms of what standards have been, that it's typically around that age or later.
That they're starting hormones.
Okay. Thank you, Dr. Rife. Thank you.
Senators, any other questions at this point? Senator Lamontia.
I just had a quick question about the drugs to temporarily suppress puberty. Person's testimony that it causes severe side effects and damages that will never, even if they decide to stop, have long effects. Is that the case, or is it something that can be reversible It's not until we get to the hormones and surgical where you start having the irreversible type effects.
Yeah, I'm not a pediatric endocrinologist either. But yeah, my understanding with the puberty blockers is that they are reversible. And with hormones, there are non-reversible effects of hormones, and surgery, certainly is surgery.
Thank you. Thank you.
Thanks, Senator. Thank you very much, Doctor. And Dr. Rife, thank you for sticking around for some follow-up. And Ms. Afifi, as you prepare a testimony, as you prepare to testify, we're going to call 3 more witnesses. The chair calls Karina Khan, Irene Erickson, and Abel Garcia. So the chair calls Karina Khan, Irene Erickson, Abel Garcia. Make your way and choose a seat here. And Ms. Afifi, thank you for waiting. And introduce yourself and give us your testimony.
All right. Yeah, thank you, Chair Hughes and committee members, for the opportunity to provide testimony. My name is Amanda Afifi, and I am the chair of the Government and Professionals Relations Committee for the Texas Association of School Psychologists. And I am writing on behalf of myself and TASP, and we are speaking in opposition to SB 14. Actions restricting or limiting gender-affirming care will have negative consequences for transgender children, families, mental health, and medical professionals. Gender-affirming care as treatment is completed at the request of an individual with consent from their parents and made in consultation and with the advice of a team of qualified medical and behavioral health professionals. According to the International Journal of Transgender Health Standards of Care for the Health of Transgender and Gender Diverse People, prepubescent gender-diverse children are not eligible to access medical intervention. Therefore, when professional input is sought, it is most likely to be from a healthcare provider specialized in psychosocial supports and gender development. Hormone therapy for eligible youth who have reached the early stages of puberty usually focuses to delay further progression, and in these cases, pubertal suppression is considered medically necessary. The use of puberty blockers is not isolated to the realm of gender-affirming care. It has been a research-based course of treatment for decades for children experience precocious puberty and is regarded in the medical community as a safe and reversible treatment. Current professional guidelines and standards of care typically do not recommend surgeries for people under the age of 18. However, guidelines acknowledge some adolescents qualify and benefit from surgery. The surgery may outweigh the risks of worsening gender dysphoria and the feeling of discomfort or distress a person may experience when their gender identity does not match their sex assigned at birth. Opponents of gender-affirming care often cite the risk of post-transition regret as a reason to ban these procedures in minors. In a meta-analysis of 27 studies involving almost 8,000 teens and adults who received gender-affirming surgery, only 1% expressed regret, and of that 1%, some regret was reported to only be temporary. Gender-affirming care and therapy that our clients are provided by their affirming providers is literally life-saving. Eliminating access to safe and affirming care negatively impacts transgender and gender-diverse youth. Transgender youth already experience higher rates of bullying, harassment, and violence. These traumas can lead youth to develop anxiety, depression, and suicidal ideation, as well as attempts. We can protect these vulnerable youth by continuing to provide access to potentially life-saving best practice healthcare. Thank you for your time.
And thanks for your testimony. And I have a question or two. And again, we know everybody gets to testify, and you need to be here to share your position. And I don't know the answer to this. Senator Campbell was talking to the representative from Texas Medical Association about the process they use and for taking positions. Help us understand how many school psychologists in Texas are members of organization. Just estimation is fine. And then just tell us the process that your organization went through to reach this position. We're not fussing at you. We just want to know how that works.
I'm sorry, I can't remember exactly how many members we have. I want to say it's roughly like 1,200.
Okay.
And we do send out a legislative survey just regarding kind of broad overviews of what our members would like us to advocate for here at the Capitol, and providing, care for the most marginalized students is one of the things that came up that our members said they would like to see from our organization. So that's
okay. So,
but not every member will complete the survey.
Well, I understand. And again, we're not angry. We just want to understand it. So to make sure I'm clear, was it a general question about providing care for marginalized students, or was it in particular, what is your position on this type? We're talking about these therapies, hormones, chemicals, and surgeries on minors. I'm just curious if you know, will your membership ask about that specific question?
Not specifically regarding these medical treatments. It's more protecting the children and their parents' ability to determine what's best for themselves.
Well, that makes sense. Thank you very much. Members, any other questions? Thank you for being here. Thank you very much.
Thank you.
All right, welcome. Please, we'll begin over here on your right, my left. Introduce yourself and give us your testimony.
Okay. Just want to get my timer started here.
No problem.
Okay. Irene Erickson, a senior research analyst at the Institute for Research and Evaluation, nationally known for its 30 years researching youth prevention programs across the U.S. I've been an invited speaker or consultant at the National Academies of Sciences, the CDC, the Department of Health and Human Services, and United Nations conferences. We recently published a summary of research related to medical gender transition. I share key findings in the hope of helping gender-confused youth receive the best care. First, it's well documented that roughly 85%, or 6 out of 7, gender-confused children will desist and embrace their biological sex by young adulthood if transition is not encouraged. There are 11 studies about this. It's really well established. But if you administer puberty blockers, it starts them on a path of transition. It interferes with the normal desistance process, and roughly 95% of them will proceed and do the transition. This means if you administer medical transition to 7 of these gender-confused children, you will be imposing unnecessary life-altering changes on 6 of them, but there's no way to know ahead of time who those children are. I want to also differ with the statement about detransition, which is different than desistance. Detransition rates are increasing as we go forward. The research is changing on that. The most recent evidence I have seen shows 20 to 30% detransition rate, and that this may be low because detransitioners stop going to treatment. They drop off the radar screen of the clinic, and so they are lost to follow-up. Second, research claiming that medical transition is beneficial to teens is generally of poor quality and cannot be relied on. Problems with these studies include no comparison groups. Comparison groups are necessary in order to test causality in a research study. Small sample sizes, non-representative samples. Some of these surveys that have been cited are based on responses of people on transgender websites to surveys, so they're a self-selected sample. High dropout rate plus actual misrepresentation of study findings. I'm sorry to say, but it's very easy to get published in a peer-reviewed journal now with a study with all of these problems. So the research really is, people in Europe are catching up to the research, and so England's National Health Service, Sweden's National Board of Health, Finland's Board of Health Care, and Norway's Board of Health Care just 2 weeks ago, or Board of Health Care investigation, have all determined that puberty blockers, cross-sex hormones, and sex change surgery should not be the standard of care for gender-confused minors because of the lack of credible evidence about the effects. The benefits are unknown and the risks are too great. Just last month, an investigation by the British Medical Journal, one of the world's foremost scientific publications, criticized the evidence undergirding endorsements of youth medical transition by the American Academy of Pediatrics and WPATH, and concluded that the bottom line of the scientific research is that we don't know its real impact. In a previous article, this prestigious journal described these medical treatments as essentially an experiment on children. Third, sound research does not show that gender transition prevents suicide. In fact, there is evidence that medical transition may increase suicide risk in gender-confused teens. Again, I've read these studies. They are very flawed and often misrepresented in the abstract of the study. The question was asked earlier about suicide rates. The Tavistock Clinic, the largest transgender clinic in the world, did tracked over an 11-year period of all of their patients. 3 out of 10,000 committed suicide. That's the rate. It's on par with the suicide rates for teens who have other mental health problems like depression and bipolar disorder. So there is not good evidence that this is life-saving care. And so for these reasons, we support this legislation. Thank you.
Thank you for your testimony. You want to wait for all the witnesses for questions? Is that okay, members?
Yes.
Very good. Welcome. Introduce yourself. Give us your testimony.
Thank you. My name is Corinna Cohn. Chairman Hughes and committee members, I'm here today in support of SB 14. For the past 3 years, I have been doing advocacy work for gender care recipients. I started taking estrogen in 1993 at the age of 18, and at 19, I was the second youngest patient operated on by my surgery for sex reassignment surgery. I was too young to know myself, although at the time I thought I did. I am arguably the first person to start transition because of the influence of the internet. Today, there are tens of thousands of boys and girls who receive all the validation they could want, assuring them, and sometimes their parents, that the best thing that they could do to become
Corinna,
whole...
keep going, but get a little closer to the microphone so we can hear you. Go ahead.
Certainly. To become whole and healthy people. Pardon me. Let me get my space here. To become whole and healthy people is to take steps towards surgically removing their sexual organs. I'd like to tell you that I've lived as a woman for the last 30 years, but that would be a lie. I sought to change my sex, and it took me more than a decade to arrive at the understanding that I was trying to do the impossible. I did not live as a woman, but as a man doing my best to blend into the world as a woman. My heart breaks for the young people who are being lied to by well-meaning enablers, as they will need to learn the same painful lesson that I learned. 3 years ago, I founded a nonprofit called the Gender Care Consumer Advocacy Network. I've spoken with patients and clinicians, and it's abundantly clear that there are numerous gaps in the care provided to young people who identify as transgender. You can count on groups like the ACLU to show up to protect the doctors who have no accountability to these children, but who will speak up for the young patients. The members of the Texas Senate should be curious about the actual evidence and come to join us at the table with patients, policymakers, and clinicians who are trying to find reasonable solutions to a growing medical nightmare. This is not a debate whether trans people exist, but rather what treatments are supported by evidence. And the procedures that are banned by SB 14 are not supported by any evidence. You will hear opponents of SB 14 say that transgender medicine is science-based and has been accepted standard practice for decades. This is a fabrication. Texans should follow the lead of Finland, Sweden, and England by pressing the brakes on these unproven experiments on children. Thank you.
Thank you for your testimony. Welcome. Introduce yourself. Give us your testimony.
My name is Abel Garcia, and I am a detransitioner. I grew up in a traditional Hispanic family. My parents were illegal immigrants. Being a non-traditional male in my family was hard. I began my transition in California, but because I was permanently injured by doctors who sought to affirm my gender, I have moved to Texas in the hope of finding better care. Although SB 14 covers minors, and I started medical transition at 19, it was when I was a minor that I was first affirmed to adopt a false identity. Minors need better safeguarding to protect against irreversible medical decisions made on their behalf. I was misled to believe that these medical procedures are perfectly safe. But now I am 26 years old and I am dealing with genital atrophy, urinary issues, possible sterilization, tremors on half of my body, back pain, memory loss of my eyesight, and many more issues that I may develop as I age. The current affirmation model validates the patient's transgender identity, while discouraging therapists from exploring underlying mental health issues. The medical care that is offered can lead to castration of males and females through invasive surgeries or sterilization through puberty blockers and/or cross-sex hormones. The puberty blockers themselves are not tested or approved for use in medical transition. Instead, they are used off-label. My story is not an outlier or that of a failed transition, but the realization of the truth of this practice. If you look online, you will see many stories like mine. Those are currently of young men and women who were lied to and damaged as minors. I hope you take this to heart. Looking back, I wish there was proper safeguards to protect me from these life-altering consequences. But because the adults who I trusted betrayed me, and states like California prefer to turn people into lab rats and lifelong medical patients. I request that these bills be passed so that we can protect all children in Texas and allow them to grow into their healthy bodies, an opportunity that has been denied to me. The medical system has chosen to ignore our health issues because we no longer identify as transgender. Besides managing the negative medical complications I deal with, I no longer have faith in doctors, nor trust the healthcare system that hurt and betrayed me in California after announcing that I wanted to return life as my biological sex as a man. I want to say thank you, y'all, and God bless Texas.
Thank you for your testimony. Senators, any questions for any of our witnesses? Senator Campbell.
Dr. Erickson, you mentioned about the suicide rate, said it was very low. Not sure if you gave us a number or not. And today, what we've heard on this committee, we use the term, when they're talking about suicide, but then they use the term suicidality, how it's increased. But that's easy to, I'm sure there's a question in here somewhere. Is that easy to, I guess, give the percentage of the growth of suicidality and make somebody think that's an increase in suicide rate?
I'm not sure what your question is.
Well, I'm not sure. I'm doing a good job.
I should clarify, I am not a PhD, I have a Master's of Science.
I'm sorry. What?
Okay. Suicidality is measured in a spectrum, and it starts with suicidal ideation or thoughts of suicide and goes up to suicide attempt with hospitalization, okay? And some of these studies that show a reduced suicidality measure all of that spectrum, and then they find a reduction in suicide thoughts or ideation. There are two studies that are often quoted about this, but no reduction in suicide thoughts with a plan, suicide attempt, and suicide attempt with hospitalization. But they only report in the abstract of the study, which is what the only thing people read, that they reduced suicidality because they reduced suicidal thoughts. But these other measures are the ones that really are more predictive of actual suicide. So that should have been reported in the abstract of the study. So they do some smoke and mirrors with the reporting of the results. And some of these studies I'm talking about, when the data were reanalyzed by someone else, the same data set, they found an increase in suicide of the higher end measures, an increase for biological males who were on estrogen. So, there's a lot of complexity to this question, but overall, the studies that claim to show an increase in suicidality are not credible. And that's why these other, these international agencies that are highly scientific and have done sophisticated reviews have come to the conclusion they have that this care should not be administered to minors.
Thank you, Mr. Herman.
Did that answer your question?
Yes.
Okay, thank you.
And I could have asked mine better, but
yeah.
Today we've heard that 97, I think it was 97% that transition, that they stay transitioned and only a 3% would detransition. Is that true?
That's not the research I'm hearing recently. The more recent research is showing a 20 to 30%, and that it's increasing because it's a long-term process. How many years, does it take someone to realize that this was a mistake? It's usually not within a 12-month time period. So as more kids transition, and then we wait as time goes on, more and more are having regret, and it's being picked up in the research. And then there's also this problem of the dropout rate, where the clinic loses track of them, and they don't track them over time, so they don't show up in the count because they're lost. So,
can you talk about what are the causes for gender dysphoria? That's a pretty broad question.
Well, there's always this nurture versus nature, biology versus the environment. And I can just tell you that a systematic review of studies of identical twins, so multiple studies of identical twins with gender dysphoria, they found a 39% concordance rate for identical twins. So that means when one of the twins had gender dysphoria, the other one did too, in 39% of the cases. That's a high rate. It's much higher than random, okay? So it does indicate, and the authors of the study concluded that it was consistent with a genetic influence, but that there were shared and non-shared environmental factors as well. And their conclusion was that this is a complex process of biopsychosocial components. So with 39% concordance, you've got 61% of the variants not accounted for by biology. So that shows you there's quite a bit of influence possible from social and environmental and cultural factors. And they also found that the influence of social factors was greater for biological females than males. So that's a very interesting finding because it fits the pattern. The pattern in the last 10 years is that the rates of gender dysphoria have been exponentially increasing. So the slope looks like this. It's not a straight line, it's pew. And that's in the UK, in the US, in Sweden, and even in countries that have been very accepting of gender, identity transition for decades, they still are seeing this rise. And it's a rise in rates primarily for teenage girls, not young boys, which it used to be, that transgender identity was mostly something happening with young boys. And now that has switched. The ratio has switched. So it was 2 to 1 boys to girls. Now it's more like 2 to 7 to 1 girls to boys. And all of those things really suggest the role of social factors, of what they call social contagion or social media. And it's hard to tease that out, in fairness, it's hard to sort of prove that. But that change in a psychological and sort of a social phenomenon is really marked. I mean, that's a rare thing to see in the world of social science, that dramatic of a change in something.
Thank you for that. The associations that were here talked about their practices, or we're speaking for the association, the practices that their members do, and had mentioned that, they talked about research, scientific basis, which is what we like to hear. But I have failed to really find any science that they can base to get their best practices from. I know we've got reviews, but so far as true science, is it out there?
Well, there are very, very few of these studies that have control or comparison groups. And that's a real big problem because you can't look at the presence of the treatment with its impact compared to the lack of presence of the treatment, okay? And that's really how you test causality in scientific studies. And so that's commented on in most of the reviews, and that's one of the things that has set the European nations back on their heels. In fact, the UK, they did a 180-degree turn on this. They were really going gung-ho down, train down the track with this Tavistock clinic. And then they did an independent investigation, looked at the research, looked at the practices in the clinic, and put the brakes on and turned around. And they don't even recommend social transition at this point, which is really interesting when you think about it. Because they say it funnels kids, it interferes with this natural desistance process that has been well documented.
And so, just really on the tail end of that, and something you had said earlier, if a child was not given, and we don't know, but if a child was not given, if they have gender dysphoria, not given transitional medication, that those, a high percent, 80, 90%, actually come out of that. Is that right?
Yes. Now, in fairness, That's based on the previous trends of, the research on gender dysphoria. Everything is changing. This trend, this exponential rise, it's adolescent girls instead of young boys. So I don't know if that's going to increase that number or decrease it, but it's kind of too early to know. But we know from the previous, pattern that it was very high, 6 out of 7, 85%.
Would just basically get through it, ride through it without, and it would go away.
They would embrace their biological sex, but also, in fairness, the majority of them would identify as gay or lesbian. Okay.
In the end.
In the end, but as their biological self.
They recognize their biological self.
Right.
Just would
with
turn out to be
a
gay.
homosexual orientation.
But if drugs are inserted in this pattern, then we don't know if they would have changed or not.
Right.
Because
there
it stops
are two
that normal.
Yeah, there are two really good studies. One of them out of the Netherlands, which is kind of the mecca of research about this, that shows it's about 95% of those kids. Just it kind of funnels them into, they go to puberty blockers, cross-sex hormones, and then forward.
And one more time, I'm not going to belabor with a lot of questions, but you've been very good. Would you just tell the committee one more time your credentials?
Oh, okay. Well, I have been working in the field of social science research about adolescents for 15 years, researching adolescent prevention programs, mostly sex education programs in schools. I've had published studies about that. As I say, I have been an invited presenter at the National Academies of Science. I was a consultant, one of 6 national consultants invited by the CDC to consult on their major meta-analysis about sex education effectiveness that was published in 2012. I'm a co-author on that study. I've been an invited presenter at the Health and Human Services and several UN conferences.
And so to close out to close for me with you, that's your experience, that's your credentials, and do you feel that a child with gender dysphoria benefits from the puberty blockers, cross-sex hormones, and the surgery?
Well, I would just say again that the evidence is not there that this is happening. Okay. These studies are not, for example, the Endocrine Society, they recommend, they support this transition, medical transition. Their own analysis of the studies they based that on concluded that the studies were of low or very low quality. By the grade rating system, if you look up the grade rating system, it's internationally recognized system for ranking the quality of research. And their own analysis found that. The AP Pediatrics has the same problem, as does WPATH. These studies are not adequate to tell us what they say they tell us.
Thank you. Go ahead.
Senator Menendez.
Thank you very much, Mr. Chairman. Ms. Erickson, I was looking up the Institute for Research and Evaluation, and on your website, and I don't know this for a fact, so I don't want to mischaracterize this, but it seems that there is a staff of 1, 2, 3, 4, is it 5 people? You're one of the leaders.
Yes, although in fairness, let me give you the history on that. We, in about the 2000 to 2012, we had a staff of 5 PhDs and 2 master's degrees. We had contracts, federal contracts, in more than 30 states and 2 international countries. These were federal contracts that we had to apply for through the federal government.
Not a problem. I'm not trying to.
I'm just giving you the background. That's a fair question. It's a very good question.
Understand. Thank you.
We had done research on over 900,000 kids.
Thank you. So in the about
And I would
section-
just say that our funding was, much of our funding was canceled by an executive order by President Obama when he came into office, and that caused the reduction in our staff.
In the About section of the Institute, I was reading, because I was just trying to get to the basis of your expertise, and I'm assuming you were invited to come down to be an expert witness.
Yes, I was.
Okay. So in reading the Institute, my understanding is it seems here, it says for more than 30 years, you've gained a national recognition for its work in evaluating sex education programs, particularly sexual risk avoidance, abstinence education, and intervention. And as I read through the paragraphs that got to the bottom and all of the expertise that you've done, what I didn't come across was there any expertise in transgender care or any affirmation? I mean, I noticed that you have an experience in sexual education programs, but I didn't see anything that was pertaining to the matter that we're discussing today.
Yes, and that's a fair question. I am not an expert in diagnosing or treating transgender or gender dysphoria, but I do have considerable expertise in research methodology and social science research. And so what I have done in this paper that we distributed is review the research according to those standards and produce a report on that.
Thank you.
So, yeah.
Thank you for taking my questions. Thank you, Mr. Chairman.
Thank you, Senator. Any other questions for our witnesses?
Yes, sir.
Senator Campbell.
Thank you, Mr. Chairman. Karina.
Yeah.
Forey, thank you so much. You came from where? Where did you fly from?
Sorry?
Where do you live? Where do you live?
I live in Indiana, Senator.
Yeah, it's hard to hear in here, isn't it?
It is.
When children who are transitioned reach adulthood, what's their experience in getting further transition-related health care? Because you've lived this. And if you don't mind, how old are you?
Thank you, Senator. I can give you some experiences that I've had, and I can tell you about some of the experiences of people who I know, friends, associates, and detransitioners. The state of healthcare for people who have gone through the transition path is extremely variable. When we're looking at things such as surgical care, it can be very challenging for individuals to get follow-up care from their surgeons. It's frequently the case that individuals will need to travel out of state in order to get care. And when they start to have complications or questions, then they don't have their surgeon available. Frequently, in those cases, the surgeons aren't even ensuring that there's any sort of care plan for those patients. It's very much a situation where you come in, have your surgery, and leave. That was what my experience was in the 90s, and I'm sorry to say that that's still what the experience is in 2022. For myself, as I'm aging and trying to make sure that I am getting good care so that I can reach my senior years, I've been on estrogen for 30 years, and even though I go to the main gender clinic in Indiana, I'm still not able to get questions answered about what my appropriate levels of hormones need to be as I approach my 50s. In fact, the last time that I had my annual, I was told that they would simulate menopause for me, which isn't necessary because I'm not female. So the level of care for individuals who do go through this ranges anywhere from poor to not very good. I've heard all sorts of stories. I think Abel has a story like this, and Prisha also has had a story like this, that when you start to run into any sort of problems, the care teams are not there to be able to adequately respond to you. So as long as everything is going okay, then they will renew your prescriptions. One of the side effects of taking hormones, especially starting at an early age, is that it can lead to bone demineralization. I only learned of this about 10 years after I started taking hormone replacement therapy. And while it would be a fairly straightforward thing for clinicians to start to include bone health monitoring as part of the treatment regime for hormones. That's not standard practice anywhere. So in my opinion, we are a set of people who are being experimented on. Although I did say that once, and somebody said, you are not part of an experiment because there's no data collection.
And no control. Well, and members, I would say, too, it sounds like, the doctors almost don't know what to do.
That's correct.
Because there's no science to develop best practices with. So you're left out there with a guessing game. And doctors, we don't like to guess. We like to be able to help, predict how you're going to do, and give you medication or interventions that are going to work. But you're not getting that. But the doctor also doesn't know what to do, doesn't know what to set your hormones at. Is that right?
That's correct. When I transitioned in 1993, I was one of the youngest people at the time to transition. That was, 30 years ago. There is no data set that includes people like me in it, where we know what sort of health conditions or problems we're going to face. I'm a data set of 0, and I'm sorry to say that because of the numbers of children who have transitioned in the last 10 years, we are actually going to be afforded to develop good data sets. My biggest worry is that the early results that we're seeing don't give me very much hope that the long-term health results from these procedures are going to be positive for the patients.
And Corey, I'd like to take a turn from what we're talking about and talk about, for me, when I first met you, we talked, and you used a term, and so where I'm going with this is to look at societal kind of conversation, if you will. How many of you have heard the children, just children in general, and you're going to have to help me with this, but children in general referred to as eggs? Well, obviously I'm not looking for hands, but I did look around like I was looking for hands. Eggs. Children are looked at as eggs.
Yeah.
And who wants to crack them? And what is it? Talk about that and tell us a little bit about, because when we listen about this, and some of the reviews have pointed out that this is like a social contagion, and maybe this is what's happening to cause that curve, that steep curve, the rise of the young teenagers wanting, saying they have gender dysphoria. What is happening out there in the speech, in the social dynamics? What is egg? That is scary and toxic language.
Senator, this language is from, I would say, the youth trans culture, but I guess it's not restricted to just youth. But the idea of cracking somebody's egg is to...
Talk closer into this, I'm sorry.
The idea of cracking somebody's egg is that you find somebody who is having some identity insecurities, that you present the idea that one of the reasons why they may not feel like they fit into society as they believe the other people around them do, is that one cause for that may be that it is that person is transgender. And so if you go online and you type in questions like, am I transgender? You will see no limit to the number of online quizzes, forums, chat groups, all of these types of implements or assistance on the internet to help somebody rationalize their transgender identity. So when somebody approaches one of these communities and they're new in it and they say, I'm not sure if I'm transgender, the most typical thing that happens is that they will be asked a series of questions that are designed to lead them to answer that, yes, they are transgender. And if you are able to get somebody to go from being questioning to saying that they identify as transgender, then you can say that their egg has been cracked.
That's pretty scary. Thank you for that. Abel. Thank you for being here. And Abel, you live, where
I live in Dallas, Texas.
Thank you. Thank you for being here. So, when we had talked earlier, I think you said that you did not have surgery. Is that correct? Or do you mind telling us about how you decided when you decided you wanted to transition and then you're detransitioning and problems going on with that?
Could you repeat that one more time? It was a little hard to hear.
Sorry. Would you just tell us a little bit about how you knew you wanted to go through the transgender process? What made you decide to detransition? And did you have surgery? And because I heard you talking about complications earlier around the rectum or something, I thought.
Yes, Senator. So, growing up in my childhood, I was not the most masculine kid, especially in a very traditionally masculine culture. Due to that, I questioned myself. I was also very shy and timid. And all that, I just didn't feel comfortable as a young man. I did not really do much until after I had left high school. I had sought assistance through my local LGBT center. And on my first appointment, I was immediately affirmed as a transgender woman by my therapist, who ran the transgender support group and was a lesbian. When I asked her why was I affirmed so quickly, she said she did not want to gatekeep me, and she had my letter to transition right away. I did not accept that letter that day. I continued seeing her for a couple more months until, unfortunately, my father had the idea to take me to Mexico, try to attempt to cure me with a prostitute and $100. Unfortunately, that trauma I did not learn at the moment, but until many years, once I had detransitioned, that trauma was what led me to finally wanting to transition, as I wanted to escape the harm that was done to me. But back to my transition, not into a whole year of transitioning with medication, which was spironolactone and estrogen. I was seen by a medical professional to be given my letter for surgery. I had only requested top surgery for a male like myself, is breast implants. But a few weeks after that session, I received 2 letters. A letter for top surgery, which is what I requested, and bottom surgery, which would have removed my penis and testicles. I did not ask for that, and I am grateful that I never accepted that letter, because if I would have, I would be right now much more damaged, unfortunately. Overall, my entire transition up to the point that I realized I made the mistake went well, and I say that because I was love-bombed, affirmed, and was never questioned on anything. But the moment I stepped out of line, I was attacked, canceled, and I was alone for a couple months, battled alcoholism, and when I requested help from my original therapist, she informed me that the reason I wanted to detransition, or at least question, was because I had just recovered from surgery and I had childhood traumas, which she never told me what those issues were. A second therapist that I went to, same thing, was not helpful. Instead, pushed me towards my transition. And my medical records state that he told me I should not be too cavalier with my gender identity regarding detransitioning, because I do not know the harmful effects of detransitioning. In that time, I was hopeless, continued battling alcoholism, but I got lucky and was able to get assistance from a gentleman on the internet, referred me to a therapist in my local area in California, which was the last therapist I ever had. This therapist under California law is a criminal because he practiced quote-unquote conversion therapy, even though all we did was talk about why I wanted to transition, why I wanted to detransition, and if this is what I really wanted to do. Eventually, I was able to detransition, but the state of California and my insurance did not want me to detransition. They denied my original letter to detransition through surgery. And after enough disagreements with the insurance company, they finally gave in, covered the surgery, and the surgeon who performed my breast implants to be inserted, removed, and reconstructed my chest had to falsify the documents to have the final surgery covered, because even he knew it was going to be near impossible with my insurance as it is in California. The final surgery was just to reconstruct my chest, and he put it under gynecomastia, which the medical term is male breast. I have now been living since December of 2020, socially as a man again, and it has not been very easy.
Can you tell us just real quick, what is the status of your health care now?
My status of healthcare, even though I have healthcare through my insurance, unfortunately due to being harmed, betrayed, and lied to by the medical system in the state of California, I no longer have trust in them anymore, of any medical professional. I am unknown of the current and future status of my health, but I know I need to see a medical professional as I grow older. I obviously will have failing health.
Thank you. Thank you so much. Thank you, Mr. Chairman.
Thank each of you for your testimony. Thank you for being here. We'll now open public testimony on Senate Bill 14. It's important that everyone who wishes to testify is allowed to, because we do have over 100 witnesses who've yet to testify on this hearing. We will be hewing closely to those time limitations. So as we ask the witnesses to come down, just be aware that we will be watching those time very closely so that everyone gets to testify and so that folks are not kept longer than they have to be. I mean, the witness is not us. And so the chair calls Matt Sharp, Denise Siebert, Tracy Shannon, Catherine Ryan, Jenna Rowell. Again, the chair calls Matt Sharp, Dennis Siebert, Tracy Shannon, Catherine Ryan, Jenna Rowell. Please pick a seat as you arrive. We're looking for Matt Sharp, Denise Siebert, Tracy Shannon, Catherine Ryan, Jenna Rowell.
How long is our 2 minutes?
Yes.
We're also going to ask the following witnesses to be down in the chamber and prepared to testify. Next, Honorable Brian Slayton, Evelyn Smith, Miriam Spencer Morrison, Alexander Stringer, John Tomba. And so, welcome. Introduce yourself. Give us your testimony.
Thank you. Good afternoon, Mr. Chair and members of the committee. My name is Matt Sharp. I'm Senior Counsel with Alliance Defending Freedom, speaking in support of SB 14. Children who experience discomfort with their biological sex deserve to be treated with dignity and respect, and they need compassionate, effective mental health care. But activists and profit-driven gender clinics have deceived children and parents alike into believing that unnatural, life-altering, and even permanently sterilizing puberty blockers, hormones, and surgeries are the solution to their struggle. Opponents of SB 14 are wrong that the bill conflicts with parental rights. While parents do have the right to direct the child's mental and physical health care decisions, they do not have the right to demand that their child receive unlawful services or medical procedures. For example, a parent cannot demand that their 10-year-old child be sold alcohol when the state has forbidden liquor retailers from selling to minors. A parent cannot demand that a doctor perform assisted suicide on their child in violation of state law, even if the doctor approves. And a parent cannot demand that their child receive damaging, sterilizing hormones and transition surgeries if Texas concludes that they are harmful to children. Parents may have the right to decide which lawful medical procedures their child receives, but they do not have the right to expand the menu of legally available options. Finally, SB 14 is consistent with the Equal Protection Clause because this bill only regulates based on age. And the U.S. Supreme Court has repeatedly said that age is not a suspect class under equal protection. Our laws have long protected children from things that society has determined are harmful or that a child lacks the maturity and experience to handle. Courts recognize that states have a compelling interest in protecting the physical and psychological well-being of children. As the U.S. Supreme Court has noted, quote, during the formative years of childhood and adolescence, minors often lack the experience, perspective, and judgment to recognize and avoid choices that could be detrimental to them. The state has broad discretion as it sets policy to protect health and safety of its children. Thank you.
Thank you for your testimony. Welcome. Introduce yourself. Give us your testimony.
Hi, I'm Jenna Rowell. I have a public health degree in social determinants of health as well as a master's in education, and I work as a patient advocate here in Austin. Bill SB 14 will deny children the possibility of receiving life-saving care that is already shrouded in restrictions and deny medical professionals and physicians the ability to fully care for their patients, as is their expertise. It restricts the freedom of parents to look out for and properly care for their children. This bill is obvious in its intent not to save children, but to silence and disappear trans people. This especially shows in the bill's use of the language certain children and its exemption for surgery and gender-related care in cases of intersex children, when the United Nations has found that these intersex surgeries on minors are usually performed without full, free, and informed consent and violate the rights and security of a person, right to bodily mental integrity, freedom from torture and ill treatment, and freedom from violence. It does also not consider banning rhinoplasty and other procedures minors can receive with parental consent. This is not about the consent or a child's ability to do so with their parents. This is about the systemic oppression of trans people in an attempt to extinguish lives that don't fit the sponsors and supporters' personal definition of normal. I ask you all to oppose SB 14 as it is not only government overreach and oppression of personal freedom, but also as it continues to promote the systematic genocide of trans lives. I urge you all to consider how this space may not be welcoming to trans people, because you can just look around and see trans exclusionary language on shirts and pins. I also urge you to read the most recent WPATH standards of care, which are fairly restrictive, and also to see that every recommendation is backed in evidence and not presented in isolation like much of the evidence brought up in support of SB 14 today, like claims that puberty blockers are irreversible, and that the DSM-5, which outlines specific standards of gender dysphoria in adolescents, are set to specific timelines.
Thanks for your testimony.
Thank you.
Welcome. Introduce yourself and give us your testimony.
Thank you. My name is Tracy Shannon, and I'm the Texas Director for Mass Resistance, a pro-family organization, and my pronouns are biological sex is real. I'm a trans widow, and as a trans widow, I had a front row seat for just how unethical the practices are in the gender industry. These procedures we're talking about today were onboarded in the United States without the necessary systematic reviews that would eliminate cherry-picked studies, and they are not medically necessary or evidence-based based on legal definitions. The Dutch studies and subsequent studies that followed that support these procedures are supported by studies that contain large degree of bias and incomplete information regarding the risks. In the 1990s, evidence demonstrating that gender reassignment surgery undertaken failed to resolve the trans pretending adults' mental health issues. Doctors hoped less positive results would be resolved with early adolescent transition. In other words, horrors imposed on children because having discovered adults with gender dysphoria didn't get better with sex change hormones and surgery. The obvious was ignored that gender dysphoria is about the mind and not the body. The doctors decided mutilation of younger children might be the answer. And a first world trend was born from cherry-picked bias studies. We must stop these harmful, unnecessary practices that make these kids dependent on medical interventions for life. We must also stop endorsing these practices with taxpayer dollars by prohibiting funding for anything furthering the transitioning of children. Stop the school to gender clinic pipeline and medical predation taking place in these schools through the organizations like the Texas Mental Health Care Consortium for Children, the Nurses Association, and Texas Association of Counselors. Thank you.
Thank you for your testimony. Welcome. Introduce yourself. Give us your testimony.
My name is Denise Seibert. I represent myself. I support SB 14, gender modification ban for minors. Sanctioning mutilation of children is child abuse. If I did this to an animal, I would face charges. But a human, I wouldn't face charges? Stop lying to children. Honesty and truth are on trial today. Why are we sanctioning lying to the mutilation of children? We never can change anyone's sex by surgery. Our DNA determines our sex, and no drug or surgery can change that. Our sex is still male or female by our DNA even after surgery. A child's health plan should not provide coverage for services prohibited by Section 161.703 that are intended to transition a child's biological sex as determined by the child's sex organs or chromosomes. A child is an individual younger than 18 years of age, a minor. As we were saying, do not harm. No puberty suppression or blocking drugs should be prescribed. That would delay normal puberty. The FDA has not approved of these drugs. Drugs may be a lifelong needed after a transitional surgery because the body will always fight to be normal. This is about the pharmaceutical companies and doctors making money and not about the child. This is an unethical and unnecessary procedure. There is no such person as a trans because they can't change their DNA or sex change. Do no harm. To do what is right. I support SB 14, gender modification ban for minors, because removal of healthy tissues is unnecessary and unethical. To apply permanent changes is not the best interest of a minor. Thank you.
Thank you for your testimony. Welcome. Introduce yourself and give us your testimony.
My name is Kay Ryan. I'm Bishop Suffragan of the Episcopal Diocese of Texas. I urge this committee to set aside Senate Bill 14 for the sake of children, families, and physicians. Our Christian faith teaches that all people are created in the image of God and are beloved children of God. Jesus in the gospel shows respect and love to every person he encounters and calls his followers to love others as he has loved us. Loving our neighbors means all those God creates, complex creatures in stunning diversity. Each person reflects the image of the Creator. The Episcopal Church calls upon all the baptized in Christ Jesus to see Christ in all persons, to strive for justice and peace among all people, and to respect the dignity of every human being. And so we oppose all legislation that strips parents and physicians of their ability to provide appropriate care to minors. Transgendered people, children and adults, are worthy of love and respect, and like all children and adults, must be able to navigate healthcare decisions free of interference. Each person is also vulnerable to challenges in this life and needs the help of parents, pastors, and healthcare professionals to navigate those challenges in ways that allow them to thrive. And Christians especially are called to advocate and act to relieve suffering and to ensure that every person may access appropriate care for their bodies, minds, and spirits. And this bill robs the citizens of Texas of their access to medically appropriate care and demonizes physicians and parents caring for minors. No parent wants the legislature standing between their child and appropriate medical care. And so we stand with our transgender siblings and their parents and doctors, opposing interference to their access to medical and psychological care. Thank you.
Thanks for your testimony. Senator Campbell.
And I'm sorry I didn't catch your name.
Bishop K. Ryan.
All right, Bishop Ryan. So if you, I should have written it down, if you believe that this bill, you oppose this bill because parents would not be able to make these kind of decisions for their children and doctors would not be able to perform this gender-affirming therapy. Is that right?
I oppose this bill because it interferes with the appropriate conversations between parents, doctors, and children to receive appropriate medical care.
So can you tell me how you would know, how you would know, or it sounds like you believe the child should have just as much of a part of this decision as the parent and the doctor. Is that true?
Well, of course, children are involved in this conversation.
Well, how can a 12-year-old, a 10-year-old, 15-year-old know with full understanding what the surgery, what these pubertal blockers really do? And they are, depends on how long you're on them, can be have permanent changes. How can you support that when a child, once they have more maturation, how can you, what are you going to do if that child says, that doctor and my parent didn't know what was best for me, and that child underwent this therapy, and now they have lost some of their reproductive, the function of the reproductive organs?
Well, first of all, I would say that the state allows parents to authorize children to do all sorts of dangerous things, in which many more are harmed every year than are harmed by this kind of care.
So let me stop you there. Well, but there's something that I need to address about that, and we won't get into a lengthy conversation, but you said the state allows every day parents or doctors to do things that are dangerous, and I may have
allows parents to authorize children to do things that are dangerous. For instance, play football, which harms many more children every year than any transgender care does.
Oh.
So I don't think that the issue here is to protect children.
Well, I think the issue here is that to me, and Jesus does love everyone. Everybody doesn't love Jesus, but Jesus does love everyone. And I'm a proponent of the counseling and waiting until the child gets of age to make that decision. What would be your objection to just counseling and not the drugs or the not drugs?
Every trans child has different needs, and in counseling and work with physicians, the appropriate care can be decided. But if the legislature outlaws all of these kinds of care, then there are options that are not available. Of course, the appropriate care for a 6-year-old is very different than the appropriate care for a 16-year-old, and that child has a different level of ability to make a determination.
Thank you, Mr. Chairman.
I thank each of the witnesses for your testimony. Thank you for being here. Chair calls Representative Brian Slayton, Evelyn Smith, Miriam Spencer Morrison, John Tamba, Alexander Stringer. Again, Honorable Brian Slayton, Evelyn Smith, Miriam Spencer Morrison, John Tamba, Alexander Stringer. And while they are making their way here, we're going to ask for some more witnesses to be prepared. And we'll ask the following witnesses, please make your way down and be prepared for the next panel. Matt Long, Jonathan Covey, Luke Macias, Michelle Evans. So Matt Long, Jonathan Covey, Luke Macias, Michelle Evans. And Chris Hopper. So will those folks be making your way down and be prepared to take your seats for the next panel? Representative Slayton, we'll go out of order. You go ahead and introduce yourself, give us your testimony, then we'll go back to our normal right to left.
Thank you, Mr. Chairman. I appreciate you hosting this hearing. I appreciate Senator Perry, Senator Hughes, y'all's leadership last session on this, and I appreciate it again this time. I've been watching this whole time, been here, and y'all been doing a great job. Senator Campbell, I don't see her right now, but I appreciate all the work you're doing. And Senator Middleton, I appreciate your help last session in the House trying to help advance this, and I'm glad you're here now. I just wanted to mainly offer that encouragement for what you're doing. I mean, we have a moral imperative to protect children, and we're going to be judged on how we treat children and how our public policy impacts children. And I appreciate, like I say, your leadership. I appreciate you bringing this forward, and I hope that we can get this to the Texas House as fast as possible, and then it'll give us plenty of time to get this through the process in the House. And I just want to say thank you again for your leadership, and that's all, Mr. Chairman.
Thanks, Representative. And we'll go back over to my left. Welcome back. Introduce yourself. Give us your testimony.
Hi, good evening. Marion Spencer Morrison. I'm here again, Mr. Chair, committee members. This is actually the bill that is closest to my heart. It affects my family personally. I'm here on behalf of myself, but because unfortunately my niece and her family are one of the families that are on the list of Attorney General Paxton's list of people who had spent the last couple of years under investigation. They could not be here today. And so they have fear, just like the doctors did earlier, of having their families separated and under the advice of their counsel that they've had to obtain, not just for my niece, but for her parents separately, because of the efforts and impact that the legislation that is before you has had on my family. Senator Menendez asked a question about the cost of the care. My niece goes through 4 shots a year at $4,800 a shot. Her family's insurance covers it at 80% and 20% after their $8,000 deductible. So, my niece has had the shots for 5 years now, and she's on the ones that delay puberty, the ones that the children that go through puberty early are on, so that it just delays puberty. She's not on the hormones yet that would do permanent transitions to allow her family and her body to decide, as they continue therapy. They go to therapy 3 times a week as a part of her treatment. She's been on the puberty blockers for 5 years, so that's a total of $66,000 that her parents have paid out of pocket.
Thanks for your testimony. Senator, we're going to wait till all the witnesses testify and have the questions at the end.
Got it, Mr. Chairman.
Welcome. Introduce yourself. Give us your testimony.
Thank you. Hello, my name is Evelyn Smith. My pronouns are she, her, and I'm a social work student at Baylor University and a member of the National Association of Social Workers Texas, here to oppose Senate Bill 14. I'm currently completing my internship as a youth case manager with a local nonprofit. Bills such as these would detrimentally impact many youth experiencing gender dysphoria and the families I work with daily. It was mentioned earlier by a witness that these kids are being peer pressured or pressured through social media to transition because it would make their life problems go away. In my experience, this is not the case. Those students who I do work with that are trans or non-binary go through constant bullying and harassment every single day for simply being who they are. Research has consistently found that access to this medical care reduces the rates of suicide ideation and attempts in trans and non-binary youth. This bill creates barriers to necessary care that have major implications on the well-being and health of trans and non-binary youth. This proposed legislation strips the rights of families to direct their own health care and jeopardizes the livelihood and mental health of youth. Medical decisions should be left in the hands of families and medical professionals, not the government. I understand that it has been a very long day. Honestly, I was not prepared to testify a few days ago. Last night, I decided to drive down from Waco to testify for the first time because I heard that this bill and others were scheduled. And so I took time out of my school and internship responsibilities because I felt that it was extremely important and necessary to speak against this bill to help you understand that your decisions on moving legislation like this forward will harm real Texans and their communities. Thank you for your time.
Thank you for your testimony. Welcome. Introduce yourself. Give us your testimony.
Hello. Good evening. My name is John Tomba. I'm from Houston, Texas. Good evening, Chairman and Senators. I would like to thank, Senator Campbell, but she's not with us right now. I'd just like to touch briefly as they hand this out to you. This is my written statement that they're handing out now. I'd like to touch briefly on a couple of reasons why I'm speaking in support of this bill, number 14, and why transgenderism is harmful. Number one, so from what I've heard from previous testimonies this afternoon, the whole basis for a child to be able to undergo a permanent life-altering surgery that cuts off their healthy body parts is a feeling. That's all it is. Encouraging children in this harmful path is abusive and cultivates what previous testimonies have proven to be a lie. We've heard multiple testimonies exactly to this point over the past couple of hours. They were real experiences of buying into this lie that harming yourself will somehow make you happy, but they were only left permanently scarred and miserable. This is a disservice to the next generation who we are supposed to be protecting. Secondly, transgenderism contradicts basic biology and science. We've heard science mentioned this afternoon quite a bit, so allow me to quote very briefly a statement from the American College of Pediatricians that can also be found in the handout that you have. Quote, human sexuality is an objective biological binary trait. X, Y, and XX are genetic markers of health, not genetic markers of a disorder. The norm for human design is to be conceived either male or female. Human sexuality is binary by design with the obvious purpose of being the reproduction and flourishing of our species. This principle is self-evident, and they conclude with, individuals with DSDs or disorders of sex development do not constitute a third sex. I'd like to conclude with saying that the science is very clear. Even if a man gets a surgery that makes him look like a woman, which we heard about earlier in one of the powerful testimonies, that does not make him a woman. It makes him a man that looks like a woman because your biology cannot change. It is all a lie. Thank you very much.
Thanks for your testimony. Welcome. Introduce yourself. Give us your testimony.
Good afternoon, Senators. My name is Alexander Stranger. I'm testifying against Senate Bill 14 because I'm here to speak out against hatred and because there's a war on the trans community, okay? The LGBTQIA Ukraine plus MAP community, they are under attack right now, especially when your 5-year-old son, Carla, is in the process of transitioning after Sprinkles the drag queen sat on his lap at a drag show and gave him her thong after her performance. And when these MAGA hat-wearing QAnon Republicans want to stop Carla from taking hormone blockers, it is a literal act of violence. And that violence, Brian, it's bordering on genocide. And look, the violence, it needs to stop, okay? We need to protect the trans community, and the important thing we need to do is protect trans kids, okay? And every day I go above and beyond to show that I'm an ally to the trans community. And that is why I leveraged my house on Pfizer call options. There is nobody doing more for our youth than Big Pharma, and I know that almost every member of the Texas legislature, as well as the Academy of Pediatrics, they agree with me fully on this. Trans kids, they are over 100 times more likely to suffer from depression, anxiety, and other forms of mental illness. And that is why I bought 10,000 shares of Merck yesterday, because the SSRIs and anti-anxiety medications that they are testing, well, this will cause earnings to go through the roof. And this is how we protect our trans youth, by subsidizing the pharmaceutical companies that are clearly doing everything that they can to help these kids. And this is being done for purely moral and ethical reasons. You guys know this. They were really truthful and really honest about the vaccine, and all of the heart attacks that people are getting, they are from climate change. And guess what? The pharma companies, they have a medication for that too. So please do not pass Senate Bill 14. Thank you.
Thanks for your testimony. Senators, any questions for any of the witnesses? Senator Menendez.
Thank you, Mr. Chairman. Ma'am, I'm so sorry. In the purple, what was her name?
Marion Spencer Morrison.
Spencer
Morrison.
Morgan. Ms. Spencer Morgan, you testified your niece has been going to a therapist, getting medical transitions, getting shots, I think, for the last 5 years?
That is correct. And prior to the 5 years of the shots, she spent 3 years of social transitioning, which I don't think we've talked a lot about in this hearing at all, is where when she is at home and outside of school, she would wear a dress and she would wear her favorite colors, which today I'm wearing her favorite color is purple. And so in support of her, I'm wearing her favorite color today. And so as a child, her parents allowed her to be herself. And on top of wearing the clothes that made her feel comfortable, they allowed her to grow her hair out, and they did their best whenever they were approached with people who said really wonderful things, like when adults would approach and say, you know, you really should cut that boy's hair. Or why do you let that boy wear purple and pink and teal? He should wear boy colors. And maybe if you let him hang out at our house a little, we'll make a man out of him so that he could be better. And those were adults that would tell this to a child.
So is it your opinion that is it your brother or sister that caused you the relationship to your niece? Is it through your brother or sister? Was it your niece's parents? Do you feel that they came to the decision lightly for her to get the medication and the therapy that she did?
No. In fact, they actually did a lot of extensive research before they even started the medication. They spent 4 years with their counselors before they even started having the discussion about the puberty blockers, because they wanted to make sure they were doing the right thing for their child. And as I said before, since they are already being targeted by the Attorney General, I would rather not disclose my family's relationship.
Yeah. So no problem. So, and a doctor earlier testified that if someone were to be pulled suddenly off those hormonal therapies, that it could be quite harmful. The young lady in the orange, Baylor, master's in social work, is that what it is?
Bachelor's in social work.
Bachelor's in social work. Did you testify that you work with youth groups?
Yes.
So you've heard testimony today talking about suicide rates and that people are somehow manipulating that use of suicide in the word work in order to get people to think that this is what they want or to manipulate people. What's your experience with the young people that you're working with? Because what motivated you to drive down from Baylor to testify today? Because you seemed very passionate about it.
I am. And the reason I'm passionate about it is simply because I work with trans youth, and these are real people that this bill will be affecting. And I feel like with the numbers and the percentages of suicide rates, and we just throw the word suicide around and add a percentage, and we've gotten high and low numbers from both sides. At the end of the day, these are people, not just numbers, and it will deeply affect every moment of their lives.
Are they confused somehow? Is someone trying to talk them into it? Is it like cool? I mean, are they doing this because, how do they come to the, I think I know the answer, but I think it's important for people to understand this is not, because sometimes it seems like people are saying, well, they're just going through a phase. It's just a phase. Is this a phase for these trans youth?
No.
It's who they are.
It's who they are.
Thank you. Thank you, Mr. Chairman.
Thank you, Senator. Thank each of our witnesses for being here. Thanks for your testimony. The chair now calls Michelle Evans, Matt Long, Jonathan Covey, Luke Macias, Chris Hopper. Again, the chair calls Michelle Evans, Matt Long, Jonathan Covey, Luke Macias, Chris Hopper. And we'll ask the following witnesses to make your way down nearby and be ready for the next panel. So the next panel will ask these folks to be coming down and ready. Carrie Cheshire, Donald Nelson, Amanda Richter, Kurt Peters, Joe McElhaney.
Thank you.
Welcome. Introduce yourself. Give us your testimony.
My name is Michelle Evans. I'm here to testify for SB 14 on behalf of Partners for Ethical Care, a secular, nonpartisan, all-volunteer nonprofit organization. Parents are asked, would you rather have a living son or a dead daughter? It's the greatest fear of every parent to outlive her child. It makes sense for a parent to choose physically harmful interventions when they're faced with that choice from unethical and misinformed healthcare providers, to choose a sterile, de-sexed child over a dead child. It makes sense when a parent is surrounded by people repeating the mantra of life-saving care. The fear is immense and nearly unbearable. But this is the suicide myth, which assumes only two options, transition or suicide. It's a false dichotomy. There are always more than two options, but stopping normal puberty, administering wrong sex hormones, and removing healthy body parts should never be an option. Gender dysphoria is a psychological condition that deserves ethical psychological care. It's impossible to be born in the wrong body. The mind is part of the body, not separate from it. PEC runs an online group of thousands of parents who do not affirm their child's transgender identity. Rather, we support children's social, emotional, and physical needs as human beings. We support them with a foundation of truth and love. We're not aware of any children of parents in that group who have committed suicide because they were not affirmed. On the contrary, we observe hundreds of children who recover from gender dysphoria and thrive once they don't need the crutch of a transgender identity, after their underlying mental and physical health issues are addressed with legitimate and ethical care. In other private online groups, sadly, we have read accounts from parents who affirmed their child's identity, but their children's mental and physical health did not improve and actually deteriorated. Some have committed suicide. The promises of transition joy didn't save the lives of these young people. It was snake oil. I'm here with observations of personal experience from thousands of parents who have trans-identifying children. We know what prevents suicide, and it's not blind affirmation. Suicide is complex. It's not about names and pronouns. I'm sorry.
Thanks for your testimony. Welcome. Introduce yourself. Give us your testimony.
Mr. Chairman, members, my name is Jonathan Covey. I'm the Policy Director for Texas Values. I'm testifying in favor of SB 14. SB 14 helps children struggling to embrace their sex by protecting them from harmful drugs and surgery. As Senator Campbell was talking about earlier, and she said so well in her layout, if a profession can't regulate itself, someone needs to step in and help them. A small but growing percentage of the American population experiences distress identifying with their sex. And for a small percentage of children, for the small percentage who are gender nonconforming or experience distress identifying with their sex, studies consistently show and demonstrate that the majority come to embrace their sex in adolescence or adulthood, thereby rendering most medical physiological interventions unnecessary. However, in recent years, politicized medical organizations have pushed referring children for invasive, harmful forms of treatment that can include off-label use of puberty blockers, administration of cross-sex hormones far above naturally occurring levels, and even sometimes surgery. The pressure is so great that in many states, medical professionals can be legally barred from offering helpful therapy to kids. Social media is also engineered for the purpose of sending kids down an ideological pipeline, as Corinna Kahn testified to earlier. This functionally sends kids struggling with their sex down a one-way path to transition, making it appear to be the only treatment option available. This is especially alarming given the fact that 80 to 95% of children will outgrow gender dysphoria and embrace their biological sex if these experimental treatments are not used. But 100% of children go on to transition if these harmful treatments are used. I would respectfully ask you to support the bill, and I'm submitting written testimony of incredible testimony from Walt Heyer to the clerk.
Thanks for your testimony. Welcome. Introduce yourself. Give us your testimony.
My name is Chris Hopper, and I am the president of Texas Family Project.
an organization dedicated to fighting for families, and I'm here to testify in favor of SB 14. And as of late, we're seeing a drastic increase in the sexualization of children, including a rise in genital mutilation for minors. No child should be subjected to being abused through puberty blockers or gender modification surgeries. This is child abuse, and it should not be allowed in Texas. Unfortunately, it's currently taking place, and I'm incredibly thankful that the Texas Senate has led on this issue, but this legislation cannot be allowed to fail in the Texas House like it did last session. 8 other states have already banned this barbaric practice, and several more are taking steps as we speak to do so. Now more than ever, Texas needs to protect kids and walk alongside children who are struggling with identity issues. The truth is that puberty blockers and cross-sex hormones given to kids cause irreversible damage. The truth is that child modification surgery performed on minors is not loving, but in fact one of the most evil actions that could be taken. The truth is there are some among us who would fight for the parent's right to chemically block a child's puberty, chemically castrate a child, and surgically remove pieces of their developing bodies. Puberty is not meant to be blocked. We must let the kids be kids. Any physician who mutilates the body of a minor is violating their oath to do no harm. And as a result, so-called doctors should be stripped of all medical credentials and spend the rest of their life behind bars for mutilating innocent children. I urge you to take action to protect our children. There is no reason why Texas should lag behind states like Florida on the issue of standing up for our family's values. I urge you to stand up for our kids by passing this bill. Thank you.
Thanks for your testimony. Welcome. Introduce yourself. Give us your testimony.
My name is Matt Long, and I am representing myself. I am testifying in favor of Senate Bill 14. And the point I wish to make in my testimony is that all of the procedures described in this bill are elective procedures. Whether it is surgery or chemical treatment, it is elective. Insurance is created for unexpected and emergency situations. In the human cycle of reproduction, a sperm will enter an egg and the process of cell division begins. The fertilized egg will split into 2 cells, then 4 cells, and then 8 cells. Now, once the 8 cells have been created, each of those 8 cells has all the genetic information that will lead to the development of a human being. This genetic information will be included in every cell of every human being up to and even beyond the grave. If those 8 cells identify a human as XX or XY, that will never change. It's science, man. I do acknowledge the existence of several genetic abnormalities that differ from XX and XY. Those rare instances are considered in this bill. Regardless of the amount of chemicals you pour into your body, regardless of the surgeries you perform, an XX can never become an XY, and an XY can never become an XX. If an archaeologist digs up human bones 1,000 years from now, they will definitively know whether the bones came from a male or a female. Around 3 to 4 days after the fertilization of a human egg, those 8 cells are formed and your sexual gender identity is permanent, unchangeable, irreversible, immutable, and unalterable. All the king's surgeries and all the king's drugs cannot change this. I am asking you to vote yes on this bill and stop the chemical and surgical mutilation of our children. Thank you.
Thanks for your testimony. Introduce yourself. Give us your testimony. Welcome.
Luke Macias. I'm here testifying on behalf of myself in favor of Senate Bill 14. Senator Menendez, I'm your constituent. I know we disagree on this issue, but thank you for listening. And Senator Campbell, thank you so much for bringing this bill, and you've been doing a phenomenal job defending the policy. I see Senate Bill 14 on the transgendering of children as the 20-week ban when it came to abortion. And what I mean by that is it is basically making it illegal for Texas medical professionals to commit the most heinous offenses against children, as the 20-week abortion ban did. It doesn't, and I just think it's important to recognize that it does not stop them entirely from transitioning these children, as the 20-week abortion ban did not on the issue of abortion. You will hear even today from people that are really committed to attempting to do the impossible, which is turn a little boy into a little girl or a little girl into a little boy. And sadly, even in these instances, we're dealing with this on the abortion issue as well. Many of these parents who are committed to transitioning their children will still be able to order these puberty suppressants online. They'll still be able to fly to Denver, Colorado for a couple days. And so ultimately, when it comes to mutilating the genitals of their child, which we've heard horrific stories of, I do think it's worth acknowledging the fact that this bill sadly won't completely end those practices, because we are still allowing a set of parents who are dedicated to transitioning their child to fly to Denver, Colorado, to mutilate the genitals of their child, to come back, to post on social media, to announce publicly, we did this to our kid. And that will happen, and those parents will still afford all of the privileges of being a citizen of Texas. They'll get the privileges of being a citizen here and protected in our state, even though those happen. So I just want to encourage y'all to continue the fight after this bill passes, and thank you for the work you're doing.
Members, any questions for the witnesses? Thank you very much. The chair now calls Carrie Cheshire, Donald Nelson, Dr. Donald Nelson, Dr. Amanda Richter, Dr. Kurt Peters, Dr. Joe McElhaney. So Carrie Cheshire, Dr. Donald Nelson, Dr. Amanda Richter, Dr. Kurt Peters, Dr. Joe McElhaney. And while they're taking their places, we'll ask the following people to be prepared for the next panel of witnesses. So in the next panel, we'll be looking for Ellie Klipp, Jessica Zwiener, Carolyn Lux, Carol Frederick, and Susan Perez. Thank you. Well, welcome. Introduce yourself. Give us your testimony.
Hello, and thank you. My name is Dr. Amanda Richter, and I'm a licensed clinical psychologist in private practice in Houston, Texas. I'm here today to speak out against SB 14. This bill goes against the code of ethics of every major medical and mental health profession, which is first and foremost, do no harm. Every person in Texas and the United States deserve access to best practice and to work with their healthcare providers on the best treatment for them. As a mental health professional, it is my moral duty to care for my clients regardless of race, gender, or sexual orientation. This bill targets a specific group of people and undercuts access to life-saving care. Why are we allowing lawmakers to come into our world and our office and tell us what is and is not life-saving care? Why do lawmakers not trust us based on our years of schooling, training, and expertise? Forcing us to discriminate undermines the credibility of our professions and our reputations in our communities, as well as the communities outside of Texas. This type of healthcare is endorsed by major medical and mental health associations, including the American Medical Association, the American Psychiatric Association, and the American Psychological Association. They are the ones who help us set best care standard practices and encourage us to continue to learn and improve our skills within the field to ensure we are providing the safest and most effective care to our patients. Social support and familial support keeps kids safe. Young people who receive this type of health care are less likely to experience thoughts of suicide. Whether or not someone understands the intricacies and necessity of this care does not invalidate the importance. I am a fifth-generation native Texan, and I have always been taught that we look out for our own, even if we do not understand them. I implore you to vote no against this harmful legislation and to trust the experts that we know what is best for our clients. Thank you.
Thanks for your testimony. Welcome. Introduce yourself. Give us your testimony.
Good morning, Senator Hughes and distinguished members of this committee. Thank you so much for allowing me to speak today. I am Dr. Kurt Peters and recently retired from the practice of pediatric allergy and immunology in Houston. I'm here on behalf of myself and advocating for the minor children of Texas as a proponent of SB 14. The currently accepted self-diagnosis criteria for gender dysphoria, GD, has expanded over the past decades, which has led to an exponential rise in children identifying as the opposite sex and thus being prescribed puberty blockers, cross-sex hormones, and surgical reassignment surgeries in the United States. Having worked with sick children since 1985, I would argue that Texas must protect these innocents from being subjected to irreversible damage to their bodies, as excellent data shows that between 80 to 95% will accept their biological sex by late adolescence if not exposed to social affirmation and medical intervention. The goal of affirmation intervention is to relieve dysphoria. However, a Hayes report, a directory review of 21 studies on hormone therapy, showed no improvement in psychological health, substance abuse, suicide attempts, and sexual functional satisfaction. Post-transitioning, including surgery, did not demonstrate improved suicide or mental disease rates long-term, as documented by the longest 30-year study conducted in Sweden. At 10 years post-reassignment, the suicide rate was 19 times the general population. Gender identity cannot change a person's sex, and therefore a sex change is biologically impossible. The benefits of medically and surgically affirming a child's misunderstanding of this reality are unproven by long-term prospective studies. However, the risks are significant and irreversible, as we've heard time and time again. The treatment of GD in childhood with puberty blockers, cross-sex hormones, effectively amounts to experimentation on and sterilization of youth who are cognitively incapable of providing informed consent. Clearly, there are both scientific and ethical problems with allowing irreversible, life-changing procedures to be performed on minors who are too young to give valid consent themselves. Thank you.
Thank you for your testimony. Welcome. Introduce yourself. Give us your testimony.
Thank you, Chairman Hughes. My name is Kerry Cheshire. I'm from Fort Worth, Texas, and I'm here testifying in favor of Senate Bill 14. Thank you again, Dr. Senator Campbell, for filing this legislation. I think it's incredibly important to protect the dignity and agency of vulnerable young Texans. I mean, I think about this issue very simply, and that is if I decided that I didn't like my pinky on my right hand and I identified as someone with 4 fingers on my right hand, I don't think there's a doctor in the state of Texas that would say we're going to amputate that finger. Or if I wanted to identify as a pirate, I don't think there's someone who would decide that we're going to remove my left eye. What we're talking about here are irreversible decisions that are being made for vulnerable young people who are in difficult situations. These people need love and they need kindness, and we know from Scripture what that is. That's not affirmation of something that they're not. That's not saying yes to a lie. That's not giving drugs to a drug addict. All of these things, when we're talking about double mastectomies on 13-year-old girls, we're talking about literally removing the penis of a 14-year-old boy. These are surgeries that are happening right now. We're talking about chemical castration of young Texans. And we're being told by some people that this is actually care, that by we're gonna support do no harm by encouraging people to take out knives, to take out scalpels, and to take out medication and permanently alter the most vulnerable people among us. I'm incredibly thankful for the work that the Texas legislature has done in the past to protect life, to protect the agency and dignity of young people in the state of Texas. And I view passing this bill as something that is incredibly necessary to continue that long and storied tradition. Thank you to members of the committee for hearing this bill, and thank you again, Dr. Campbell, for filing this legislation.
Thank you for your testimony. Would you please state your name for the record and then give us your testimony?
Hi, I'm Dr. Don Nelson. I'm from Cedar Rapids, Iowa. After practicing in that community, I spent 3.5 decades teaching family medicine residents in the residency there, primarily obstetrics, as well as evidence-based medicine and healthcare informatics. I'm here today as a member of the board of directors of the Medical Institute in Dallas because I was appointed in a capacity to lead a working group involving the Medical Institute and some individuals from other organizations to review the scientific evidence regarding the issues of gender identity and the transgender issue. I'm prompted to remember Victor Borge, the Danish pianist, comedian from some years back. He used to tell a story about a doctor friend of his who had invented a cure for which there was no disease. Sadly, in some ways, the matter of gender affirmation therapy is a similar situation. I don't mean to imply that gender identity disorder or gender dysphoria are not problems. They are becoming more prevalent and receiving more attention in our current society. What I do imply is that the currently fashionable approaches to the problem are not cures. In fact, they may not even be helpful. One fashionable approach, of course, we've talked about gender affirmation therapy, and you've heard enough about that, so I'm not going to explain what that is. But SB 14 would prohibit the medical and surgical phases of this transition to be performed on minors. Some self-proclaimed gender transition experts defend the need for such measures based on the fact that adolescents who experience gender confusion or gender dysphoria also experience high levels of depression, anxiety, and suicidal ideation. The risk of suicide is often used as emotional blackmail upon parents and teachers, implying that those who don't affirm a gender transition are contributing to the risk. But what is lacking is reliable evidence that the transition process actually reduces these risks. Statistics from European countries estimates the suicide rates among individuals with the diagnosis of gender dysphoria about 3 to 4 per 10,000 patients. Any suicide is a tragedy, but these numbers do not support the idea that the alternative to affirmation is suicide.
Thank you. Thank you for your testimony.
Yes.
Would you please state your name and give us your testimony, please? Thank you.
Thank you, Senators. I really appreciate your long suffering here, and thank you for letting me be here to speak. I support the bill. I ask a question to start with. Who is making the very best decision?
Could you state your name for the record?
I'm sorry, I'm Dr. Joe McElhaney. I was going to come to that, but okay. I'm Dr. Joe McElhaney. I'm an obstetrician gynecologist who practiced here in Austin for 26 years. Along with 3 other physicians, I established one of the first successful in vitro fertilization programs in the state of Texas. I was chief of staff of St. David's Hospital, on the board of directors of the hospital too. I'm founder and CEO of the Medical Institute for Sexual Health, which is located in Dallas now, which I started in 1992, committed to the creation, committed to credible science and to research. So I ask a question here at the start. I'm sorry, I should have started this way. Who is making the very best decisions for these kids who are under 18, the people that are part of this bill we're talking about, because it cannot be themselves. They cannot make the best decisions for themselves. I have a lot of experience with kids and so forth. I served on President George W. Bush's Presidential Advisory Council, HIV and AIDS. I also served on the Personal Advisory Committee of the head of CDC, Dr. Julie Gerberding. Relative to this important bill is that I wrote a major book on the science about teen brains. This book is called Hooked. I have a copy here, but I also would provide a copy for any of you that want it, so just let me know that. I want to quote from that book because I think it's said very well. Primarily with the aid of MRIs, scientists have made an important discovery about the brain's growth to maturation. The part of the brain that controls the ability to make fully mature judgment decisions is not physically mature until an individual reaches his or her mid-20s. That's 25 years old. In other words, the part of the brain responsible for complete assessments about future consequences and responsibilities is still growing throughout the teen years into the 20s.
Thank you, sir.
Kids physically cannot make.
Thank you, sir. I appreciate your testimony, and I have read your book. Thank you all for your testimony. And members, are there any questions?
Thank you. Yes, and I'm sorry I didn't catch your first name.
It's Dr. Amanda Richter.
All right, Dr. Richter. So the American Academy of Pediatrics, they have clinical guidelines.
I'm sorry, who?
The AAP, American Academy of Pediatrics.
I'm not familiar with them. I'm only familiar with the APA, the AMA, and then the American Psychological Association.
Okay, so does the TMA have guidelines, practice guidelines, best practice guidelines based on a scientific study?
Again, I'm not familiar with TMA. I'm familiar with AMA.
Okay. Does the AMA?
Yes, I believe
they do.
Mm-hmm.
I'm not sure that they do based on science because there isn't any science to build best practices on. But thank you anyway for that. And I wanted to ask you, Doctor, the book. So the brain is not mature until our mid-20s. So,
No, they do 25.
okay, that's pretty mid between.
In fact, rent car companies won't even rent to people until they're 25 unless having an arrangement with their law firm. Or,
So your point added that is just not only, I mean, we set it at 18 because we say adult in Texas is 18. But your point to that, if I'm not mistaken, is children are not able to make the decision and the brain is really not fully developed to have a mature, truly full understanding until perhaps the mid-20s.
these
right.
are lifelong decisions. They do not.
Sir, could you turn?
I'm sorry. They do not have the cognitive ability to make that kind of decision.
Okay.
They just don't have it.
Right.
And it means that somebody else is making those decisions for them.
Okay, thank you. Thank you, Madam Chair.
May I add
Thank you,
one
Senator.
thing?
Are there any other questions, members?
Just one thing. Okay, just a question.
Senator Middleton, you're recognized.
Thank you, Chairwoman. Dr. McElhaney, I just, if you could maybe provide maybe some more examples and background on why you believe children, so minors under the age of 18, are not able to make these decisions. Physiologically, psychologically, some of the reasons behind that in your research.
I sure can, Senator. I went to the NIH at Bethesda, where Jay Geed was doing the MRIs of kids sequentially. Couldn't do any studies with radiation like CT scans, but they did MRIs sequentially. So they did these year after year for these kids, and they just showed the brains weren't there. The tissue was there, but the brain maturity, and you could see it on his scans, just was not there fully there until the mid-20s. There's some beautiful studies that show that. Which, by the way, I show in the book. So if the brain cells aren't there in a mature fashion, it's impossible for those brains to function in what they call the executive ability, which is projecting into the future what they might do today. For example, if the puberty-blocking hormones are given inappropriately, the kids that get those will never have an orgasm. And there's no way that they can know at that age, let's say 11 or 12 or 13, what it would be like to never have an orgasm. So these are huge decisions that they're making that they can't make. And so it means that you all are doing such an incredible job of putting up a stone wall between those people who would make those decisions for them that really could be harmful for them. So thank you.
Do you think one of the reasons that they're making this decision is adults are leading them to it because their brain is not fully developed? In other words, the primary cause of children, and of course parents as well, seeking out transitionings because of outside influence from a doctor perhaps, or a psychologist, or a therapist, or some third party that's an adult, by the way, that's leading them to this?
Not necessarily. I have a friend who's 11-year-old on the playground was convinced, because she's a tomboy, that she was a girl trapped in a girl's body. And she came home insisting that she be called by a boy's name and so forth. I think social contagion, because we know, you've heard it, that as many as 30% of some girls in some classrooms feel like they're boys trapped in girls' bodies. And that, I think, would be called social contagion. And there are now some pretty good studies going on to establish what that is and why it can have such an impact on young women, particularly young women and young guys, too.
So you think social reasons are a large part of this?
I sure do.
Okay.
Yeah, I think the research shows that, too.
Thank you.
Thank you, Senator. And are there any other questions, members? All right. Thank you all so much for coming and for sharing your testimony with us. And I thank you all for your adherence to the 2 minutes. It helps everyone that wants to testify get to testify. So
almost 2 minutes.
Yes. All right. The chair calls Ellie Clipp, Jessica Zwiener, Carolyn Lux, Carol Fiedrich, and Susan Perez. Ellie Clipp, Jessica Zwiener, Carolyn Lux, Carol Friedrich and Susan Perez. All right. Looks like we maybe only have 2 from that panel. We can call 3 more. The chair calls Cecilia Wood. Ben Wilson and Cindy Asmussen. All right. Let's see. And I think we may have, you want to call 2 more? Oh, you think Ben is here? Okay. Yes, have a seat. Nice sauce. All right, let's call 1 more. Christopher Hamilton. Oh, here's Cindy. All right. So if Christopher will hold. Okay. All right. Thank you all for coming and for your patience. We're trying to stick with 2 minutes as best you can. Thank you for that. And if you would just get us started, please state your name and give us your testimony, please.
My name is Dr. Jessica Zwiener. I'm a board-certified endocrinologist. I'm in private practice in Houston, and my specialty is initiating and managing hormone therapy for transgender adolescents and adults. I'll start with a brief testimony. I know there's been a lot of questions. I'm happy to answer some of those. Medical care for transgender youth is...
Could you speak a little more directly in the mic? You can pull it over toward you if that would help.
Medical care for transgender youth is life-saving. Transition is not experimental, it's not unproven, it's not unsafe. Rather, this care is supported by over 30 years of clinical experience, along with evidence showing dramatic improvement in mental health when adolescents are able to access this care in a reasonable time. In a recent 2022 study published in JAMA, one of the major medical journals that we get our information from, transgender youth who were treated with puberty suppression and or hormone therapy had a 60% lower incidence of depression and 73% lower incidence of suicidality. That's a huge intervention. It's significantly bigger than any antidepressant medications or other treatments like this. When these treatments are accessed during adolescence, these treatments are associated with a decreased lifetime incidence of suicidal ideation. So treating at the appropriate time has a lifelong impact. Delays in medical care result in adverse mental health outcomes. For this reason, medical transition is recommended by all major professional societies as a gold standard treatment for gender dysphoria by every legitimate medical society in this country. The Endocrine Society and the American Academy of Pediatrics both have specific recommended protocols for puberty suppression and initiation of hormone therapy. This particular bill is targeting a specific group of people and undercutting their access to life-saving care.
Thank you for your testimony. Would you please state your name and give us your testimony? Thanks for being here.
Good afternoon. I guess I can know my name without my glasses. My name is Cecilia Wood. I am here on behalf of the Family Freedom Project, which is a project of the Texas Homeschool Coalition devoted to protecting parental rights and the parental child relationship, and also on behalf of myself. I'm a board-certified family law attorney, and I'm here today to testify in favor of Senate Bill 14. And I'd like to thank Senator Campbell and whoever maybe helped her for bringing forward this bill on this very difficult situation. I think this bill does an excellent job of parsing the 2 competing interests in this case. As we know, a fit parent certainly has a right to make health care decisions for their children and to make all decisions for their children. However, there are limits, as Justice Lehrman pointed out, that these rights are not absolute. And one thing a parent cannot do is consent for their child to do something that's illegal and that's not permitted by law. And so, for example, parents have no ability any longer to consent for their children to marry. Children can't marry until they're 18. They cannot consent for a child under 17 to obtain a tattoo, even though my granddaughter says they fade now. But there are only 4 exceptions that the legislature has set out, and past that, a child has to wait. They also can't consent to something like medical marijuana treatment for their children unless the condition is one of the 10 that are listed in the occupation code. They can't just say, my kid's driving me crazy, they're hyper, give them marijuana. So the way this is set up, it does not infringe or in any way diminish our well-cherished right of a fit parent. It simply recognizes that neither a child nor an adult can violate a law in this state. Thank you.
Thank you so much for your testimony. Thanks for being here. Would you state your name and give us your testimony, please?
My name is Ellie Klipp. I'm representing myself and concerned parents of Texas. I was a school teacher from 1968 until 1996, and I'm a mother and grandmother, so I've known a lot of kids. When children are told from an early age that their bodies do not show their gender, but rather it is what they like or what they like to do that shows their true gender, it's no wonder that an increasing number are confused about what gender is or what gender they are. On the 8th day from conception, the male baby's brain is flooded with testosterone thanks to the Y chromosome. This prompts the development of male organs and genitalia. The female body with the XX sex chromosome pair is prompted to develop the female sex organs and genitalia. The rule is, if there is a Y, the baby is a guy. What makes a boy or a girl is the sex chromosome pair coding every single one of the over 30 trillion cells in their bodies. Why would we deceive our children with the notion that they can change their gender chemically and surgically with procedures that will turn them into lifelong patients with bone thinning, interrupted brain development, and all kinds of cancers and cardiovascular risks? Please support SB 14. Thank you.
Thank you for your testimony. Would you state your name for the record and give us your testimony, please?
Yes, hi. I'm Ben Wilson. I'm a physician in Waco, Texas, at a large community health center. I'm an associate chief medical officer there. I speak on my own behalf in support of SB 14, but not on behalf of or an agent of my organization. I had a written testimony that I, for the most part, just scrapped because I have some comments on some things that were said previously. I'd like to issue sort of from a doctor's perspective. I appreciate that the TMA is neutral. It sounds like they're neutral, or a term that's new to me, they're on the bill. I believe that this is a change of perspective for them, which I'm very grateful for. Why they are not for the bill, I can only conjecture, but I believe it has to do with physician-patient relationship, and some other people have already made this statement, but I believe that the physician-patient relationship, because of the violation of Hippocratic oath that occurs with medical or surgical transition, I believe that physician-patient relationship really is not the overriding principle that should be at play here. I do believe, contrary to what the TMA representative, his position, I do believe that it's very reasonable for a doctor to lose their license for something that is a clear violation of the Hippocratic Oath. I'll also just comment, too, that I've reviewed not all of the literature on this topic, but a considerable amount. And I feel that the Master of Science over here that was had presented to the CDC and the UN really is spot on. That was an excellent testimony, an excellent witness, and I completely concur pretty much with her entire testimony. Suicidality has been shown in some of these studies that are quoted by the folks that are against SB 14. Suicidality has been shown to decrease a bit in some studies, but I believe that they're misleading with various sources of bias. And suicide risk does not decrease.
Thank you so much.
Happy to entertain any questions. I guess I'm out of time.
Thank you for your testimony. Appreciate you being here. Would you please state your name for the record and give us your testimony?
Sure.
My name is Cindy Asmussen. I'm the Public Policy Advisor to the Texas Ethics and Religious Liberty Committee and the Southern Baptist of Texas Convention, representing over 2,700 Texas churches. We support SB 14, and we want to thank you for this bill. Our culture is convincing an alarming number of children into the belief that they are trapped in the wrong body, and that gender is socially constructed or self-determined, or there's no absolute truth. It's all feeling over reality and fact, and this is a destructive ideology. Our convention has spoken to the specific issue for more than a decade, and we believe Scripture is clear that gender is not socially constructed or self-determined, but gender distinctions are God-given, rooted in creation, and manifested in biological differences. Being created as a man or woman is an essential aspect of our identity as human beings. Jesus said from the beginning of creation, God made them male and female. For this reason, a man shall leave his father and mother and be joined to his wife, and the two shall become one flesh. Male and female were created for one another in a complementary relationship, both of equal value but with substantive differences of genetics, anatomy, physiology, psychology, and reproduction. Sex is not assigned at birth. It's objective and observable even in the womb. The ideology of fluid sexuality undermines these basic understandings, and the disturbing propagation of transgenderism through public education, social media and entertainment, the medical and mental health fields, activist organizations, and even government has confused children who are easily influenced. We have parents coming into our churches who are deeply troubled about the rapid onset of gender dysphoria that they are seeing among their children and among their children's friends. Psalm 139 says that we are fearfully and wonderfully made by our Creator with uniqueness and God-given purposes and destinies. And we as adults, we need to be affirming a child's God-given biological sex as a meaningful part of their life that has a purpose. And this bill will help protect vulnerable children from a lifetime of regret and damage. Children were never meant to make these kind of monumental decisions at such young ages. They don't have the maturity or the development to do that. Thank you.
Thank you so much for your testimony. Members, are there any questions for the witnesses? Senator Menendez.
Thank you, Madam Chair. I was just going to ask Dr. Zwiener, I believe you said you were from Houston?
Mm-hmm. Yes, sir.
So you are an endocrinologist?
Mm-hmm. Yes, sir.
So just for the benefits of those who may not be familiar with it, what does an endocrinologist specialize in?
So hormones of all different types. We generally take care of diabetes, reproductive issues, thyroid disease, transgender medicine, osteoporosis, things like that.
And there have been many statements made today about sort of a very black and white or A or B type decision about what gender is. Is there such a thing? Are you familiar with an intersex, what intersex means? Could you describe to the committee what that means?
So when we talk about what makes somebody male or female,
right?
It sounds like it's very simple. You're either male or female. But when you are figuring out what sex somebody is, you're looking at internal genitalia, external genitalia, chromosomes, certain genetic mutations, hormones. There's just a bunch of different things. And most people, those all line up, and some people, they don't line up. And you might have most of the characteristics of male, but some things that are female. And sometimes intersex conditions are obvious at birth. Sometimes they become obvious at puberty. Sometimes they become obvious when a couple is trying to have a baby and they can't conceive. And sometimes you never figure out that you're intersex.
So just for you've described a lot of the how intersex actually manifests itself, but intersex is just a matter of chromosomes, right? Some can be XX, XY.
Not necessarily.
No? Okay, just tell us.
There's, for example, one of them is called congenital androgen insensitivity. You have a person who is XY, every cell in their body is XY, but the androgen receptor, the protein that detects the testosterone, doesn't work.
Right.
So this is a person, every cell in their body is XY, they have male levels of testosterone, they look completely female. These people don't get diagnosed until puberty when they don't have a period because they have internal testes, they don't have any ovaries, they don't develop a uterus or a vagina.
So a lot has been made today about the fact that some children could be, so I've heard different words and I'm going to choose just a few of them, be sort of guided or misled by adults to believe or think certain things. In your practice, have you treated anybody who you felt was there because someone else asked them to be there or someone else wanted them to be there? Or is this something that you feel that the patient and let's say in the case of a minor, their parents, and I would assume that there might be parents who might be reluctant, but the fact is that their child is so convinced of who they are that they're saying, this is what I need this to continue to be. I need you to help me. So could you give us a description of what your normal patient is like? What your, not normal, but your most common cases of patients be? And would you or any other doctor, would you consider treating someone if you felt this was not the right thing for them?
So I absolutely would never treat somebody if I didn't feel like it was the right decision for them. If they really, really, really wanted hormones and I thought it was not appropriate, I might give them names of other doctors they could go talk to get another opinion or to work through things. In general, by the time a child arrives at my practice, they've gone through a lot. They've figured out that they're transgender. They have told their parents. Their parents have accepted them. Their parents have figured out that they probably need some therapy. They've had that therapy. They have then decided to go access medical care. I have a very long wait list. It's difficult to find doctors who are competent in treating these children. There's not many of them, even in a big city like Houston. And so most of these kids then have to wait additional 6 to 12 months from the point of deciding to start hormones to then actually seeing a doctor for the first time. Most of the kids pretty much all of the kids who come in are very sure of themselves. They generally have very supportive parents. I do spend a lot of time counseling parents because, every parent wants the best for their kids. They're all worried about risks. But they're also worried about their kids' mental health. And a lot of these kids at puberty really start to, as their bodies start changing, their mental health just goes down the tubes. They get a lot worse depression. They have a lot of anxiety. And social transition generally will start to relieve a lot of those symptoms.
Were you, yes, you did. Were you invited by the committee or any member of the committee to come testify, or what motivated you to come today?
Well, I would like to continue practicing medicine. I would like to continue to take care of these patients. Taking care of transgender kids has been the most fulfilling part of medicine that I've ever done. Watching these kids go from quiet, withdrawn, not really having any plans for the future, not really liking themselves, just kind of existing until they die. Most of them tell me they don't expect to live very long. We start hormones and they just kind of blossom. Mental health gets better. I stop a lot of antidepressants once kids have been able to medically transition. They start making plans for college or careers. They tell me they're able to imagine what it would be like to be old, My trans girls, for example, they'd say, I could never imagine myself as a guy, like a man. That's not right. But now that I could picture myself as a woman, I think I'm going to live a full life. It's very rewarding. Nobody's ever that excited to come see me to talk about diabetes.
Thank you for your answer to my questions and your testimony. Thank you, Madam Chair.
Thank you, Senator Menendez. Senator Campbell, you're recognized.
Thank you. My question is to you, Dr. Zawina, is that right?
Yes, ma'am.
So the Endocrine Society had published some clinical practice guidelines. You're familiar with that. And this was just taking a couple of lines out of paragraphs, so a little bit out of context, but it seemed like the sentences will stand on their own. It said, citing the Endocrine Society guideline in support of a claim about gender-affirming hormones being medically necessary or life-threatening, life-saving is therefore highly misleading. So that's just out of their own statement. And this was in 2017 that it was published, the clinical practice guidelines. It is said that the guidelines are a how-to, not a whether-to, and that should be decided between the practitioner and the DSM-5 diagnostic criteria. And then it said the Endocrine Society guideline assesses the quality of evidence supporting its own recommendations in the relevant category of hormonal interventions for minors the Endocrine Society cites the quality of evidence as being low or very low. Not just that, but when it comes to the low category, which is the higher of the two, the Endocrine Society rates its guidelines as being weak recommendations. Not expecting you necessarily to comment on that, but would you comment on how the super doses of like testosterone make changes in the cardiovascular system?
Yeah, so we don't use super therapeutic doses or super physiological doses. We use the same doses that we would use to initiate puberty in a cisgender child who had some sort of developmental issue and does not start puberty on their own. If you're looking at a transgender man, we use the same doses of testosterone to maintain transition that we would for any cisgender man that had low testosterone.
There is reported, I mean, it's part of the side effects, that these women who trans to men and take testosterone end up with, I mean, they're more of a vasculopath with hypertension and cardiovascular disease. Not all of them, I'll readily admit that. But where I'm getting with this is that the cross-sex hormones, and they are not without having risks and some permanent effects. Would you agree?
I wouldn't agree that they're permanent. What I would say is that when we look at men and women, just cisgender men and women, there are differences in the risks of heart attacks, hypertension, and things like that. We tend to attribute them to hormones. When someone starts cross-sex hormone therapy, their risk profile shifts from that of, say, a woman to that of a man.
Right. Well, I'm just the study, not studies, but the anecdotal material with the cross-sex hormones do show that they are not without the risk of developing, where before the hormones they may not have developed any diabetes, different than vasculopath, or cardiovascular disease, osteoporosis, when higher doses of, or starting early with the cross-sex hormones. It's reported, loss of bone density. You want to speak to that?
The newer data doesn't show a lot of...
I'm sorry, I can't hear you.
I'm sorry. The newer data on osteoporosis really does not show a significant change with hormone therapy. Some of the older data did. There is a significantly higher impact on bone density when we look at physical inactivity,
and that goes for everybody, not just the hormones.
But the effect of inactivity is significant.
But that is part of the risk profile of taking the hormones.
Yes, but it is also important to make sure that we're comparing the correct things. There are slight risks of taking hormones, but there are significant risks of untreated gender dysphoria.
Thus far, there has not been any evidence that supports if someone has a child that has gender dysphoria is given puberty blockers and cross-sex hormones, that makes a difference in the gender dysphoria, because there are many comorbidities of mental problems that go along with gender dysphoria. Gender dysphoria is not found isolated on its own.
Gender dysphoria is sometimes found isolated on its own. It's frequently accompanied by depression or anxiety, but not in all children.
I'd like to thank you for that. I'd like to see that study and how many, because it would help me there, because it normally gender dysphoria comes on after they've already had identification of the other, whether it's an eating disorder, anxiety, depression, manifested as anxiety or something like that.
So we do have a lot of data that the mental health effects are not so much from the dysphoria, they're from the effects of how they are treated. In transgender children who socially transition at an early age with strong parental and family support, mental health outcomes are the same as their cisgender peers. There's no increase. The problems that we see are when they do not have supportive parents, they're not affirmed, they don't have access to medical care.
So let me stop there.
Yes, ma'am.
Excuse me, stop you there. When you have a lot of comorbidities for mental illness or mental problems going on, most certainly if your community is a more secure, loving, supportive family, then you're more likely to have an easier time with those and perhaps resolution of some of those mental behavioral changes versus somebody who doesn't have a supportive environment and then go on to maybe take the gender-affirming medication, but that would be the wrong target that treatment is directed to when there are other mental illness features or types that would be defined in the DSM-5 category.
So when we're when we're evaluating children who come to us and say, I'm transgender, I want to start hormones, we don't just give them hormones. There's lots.
I'm sorry, what?
When children come to my office and tell me that they want to start hormones, we don't just give them hormones. There's a very long, methodical, drawn-out evaluation process. We make sure that mental health issues are well controlled, or as well controlled as they can be before starting. And it's a continuous evaluation process.
Okay.
Once someone starts testosterone, they don't have to take it forever. We talk about goals pretty frequently.
Well, I think that I would like to see a study, if you could bring that, provide that shows definitively that the puberty-blocking drugs and the cross-sex hormones, and if you can find where the transgender surgery actually fixes the gender dysphoria, that would be of interest to me. Because there are permanent side effects of getting the puberty blockers and the sex hormones. We don't have development of the gonads. The hypothalamus, pituitary, gonadal axis is affected, and you don't have the development. And if you don't have that development, you do lose the reproductive ability and most certainly all the complications that comes along with the surgery. Insurance pays going forward, pays for all this, and the industry of all this, the medical treatment, is in the billions. And a
so
drug
is treating heart disease.
I'm sorry, what?
Treating heart disease is also a multi-billion-dollar industry.
Yes, but this is
not relevant.
a disproportional amount. An adult can get the same medication that may cost $7,000, but for a child costs $40,000, and it's because the child is going through gender-affirming care. Their medication, the cost is really jacked up, and the industry. The insurance is paying out billions of dollars, and it really boasts to me of a cottage industry. And I do think children, and I appreciate your information, but I do believe children are very vulnerable to practitioners and counselors who push them in the direction to make them feel all their problems will go away if we have treatment for gender dysphoria. I think that's disingenuous. I think it scares parents. And if it leads to mutilation via surgery, I think that's pretty sad. So if you'll just provide some information for me, that would help me. Thank you very much. Thank you, Madam Chair.
Thank you. Members, are there any other questions? Thank you all so much for your testimony and your excuse. Thank you, members. And the chair will now call the next panel. The chair calls Christopher Hamilton, Dr. Stephen Hotze, Nathan McCravey, Paul Hale, and Alex Burnell.
Could you tell me?
We're going to call one more witness. Cody Pike. All right, great. Thank you so much. Have a seat. And we'll just start from left to right. Thank you all in advance for adhering to our 2 minutes to give everyone time to speak. And if you would just get us started, state your name and give us your testimony, please.
Thank you, Senators. My name is Christopher Hamilton. I'm the Chief Executive Officer of Texas Health Action, a community-informed nonprofit dedicated to providing health care in a safe and supportive environment through clinics in Austin, San Antonio, and Dallas. I'm here to speak against Senate Bill 14. This bill sends a clear message to physicians and other healthcare professionals. The legislature does not trust their training, does not trust their expertise, does not trust their ability to practice medicine, use their medical decision-making, or provide best practice health care. This bill says that the legislature knows better than parents the right health care choice for their children. This bill removes the parents' right to make health care choices for their children. Taking away legally available health care is taking away parents' rights. Senate Bill 14 says to physicians and other health care providers, this is not a safe place to practice medicine or provide best practice health care. Health care that is supported by every major American Medical Association, including the American Medical Association and American Academy of Pediatrics. Many of the providers who treat the exempted conditions in this bill will be put in situations that are not so black and white. There will be confusion, and Senate Bill 14 tells these providers they are not safe to practice in this state. At Texas Health Action, we have lost mental health professionals to other states. We have lost registered nurses to other states because of bills like this. I have been asked by physicians contemplating a move to Texas what the political climate is to practice medicine in this state. According to the Department of State Health Services, Texas Primary Care Office, there are 224 whole county primary care health provided shortage areas out of 254 counties, and 248 whole county mental health provider shortage areas. We cannot afford to lose more healthcare professionals.
Thank you so much for your testimony. Welcome, and would you state your name for the record and then give us your testimony, please?
Thank you, Senators, for the chance to speak to you today. My name is Nathan McCravey. I'm a pastor in Abilene, Texas, as well as a member of the Texas Ethics and Religious Liberty Committee of the Southern Baptist of Texas Convention. I'm here today on behalf of the TRLC to speak in favor of SB 14. All people are made in the image of God and are therefore worthy of dignity, honor, respect, and protection. While this is certainly true for all people, it is especially true for children, who are some of the most vulnerable to danger and exploitation. It is the moral obligation and responsibility of those with God-given authority to wield their position for the good of children. I'm calling on you to use your authority well in this manner and to pass this piece of legislation. For children, there is a natural progression that should take place, which, shepherded by their parents, begin to take on increasing levels of responsibility and make more and more significant decisions as time progresses. For example, a 4-year-old should be concerned with what toys they will play with. A 10-year-old should be thinking about what they might wear to school, and a 17-year-old should be thinking about what plans they want to pursue after graduating high school. The transgender movement and its effects are an affront to this God-ordained pattern, as well as the God-given gift of maleness and femaleness. With the propagation of transgender ideology, many children have been led to believe that they should be making a life-altering decision, a decision that was never intended to be theirs to make. This has seen a correspondence to a rapid incline in reported cases of depression, attempts of self-harm, and suicidal thoughts among children. In other words, the transgender movement has placed the burden of choosing one's gender on the backs of children, and they are being crushed by it. Yet the problem goes further. These same children are being led to believe that at the slightest hint of any sense of gender dysphoria, they should consider making a gender transition. The problem is then compounded when these same children seek medical advice from a healthcare professional. These physicians and other healthcare professionals are administering treatments that will certainly have lasting and devastating impacts on these children. I encourage you to pass this bill.
Thank you for your testimony. Would you please state your name for the record and give us your testimony, sir?
My name is Dr. Stephen Hotze from Houston, Texas, CEO of Hotze Health and Wellness Center. Madam Chairman, committee members, I am supporting Senate Bill 14 because it will protect children from the abuse by the transgender medical industry and its pedophile proponents who sexualize children in order to groom them to participate in their wicked, perverted, immoral lifestyle. These child molesters should be punished. Senators, you have a responsibility before God to protect these children. These pedophiles are now promoting transgender sex change drugs and sex mutilation surgery on children. Doctors who perform these treatments should have their medical license revoked. By the way, General Paxton and Governor Abbott agree that this is child abuse. Jesus said, what causes anyone that causes one of these little ones who believe in me to sin, it would be better to put a millstone around your neck and throw yourself in the sea and drown. God created two genders, two sexes, male and female. They're stallions, they're mares. They're bulls, they're heifers, they're roosters, and they're hens. They're men and they're women. This is just a biological fact. Anybody knows that. The idea that a man can claim to be a woman or vice versa is absurd and unscientific. It's a perversion of the God-given natural order. At birth, you're either female, XX, or male, XY. You can't change your sex chromosomes. This is biology 101. To say anything else is a lie. God says in Isaiah, woe to those who call evil good and good evil, who justify the wicked. Senators, you should lead the way in defending children from these perverted transgender pedophile movement. You have a serious responsibility before God to protect children, and I'm confident that you will discharge your duty. Thank you.
Thank you for your testimony. Would you please state your name for the record and then give us your testimony, sir?
Yes, ma'am. My name is Paul Hale. I'm from Queen City, Texas. That's in Cass County. And I am for Senate Bill 14. I read it. It was very well crafted. It was put together very well and thought through. And it was thought through so well to answer all those questions. In a way, I don't even see what we're all down here for. There's no logical argument against this bill. There's no logical argument for this lifestyle or this devilish culture, or whatever you call this stuff. And they'll even tell you, they hook themselves to Satanism. And if you think Satan is a good thing, then you'll probably be against this bill. But I'm for this bill, and I thank y'all. But I'm going to tell you the practice of a kid getting this so-called this transgender, this gender removal surgery. I cannot even fathom that. How can somebody do that to their body to begin with? But it robs a child of their childhood. It robs them of their normal childhood, but that follows them. It robs them of their adulthood too. It robs them of a normal one. And I pray for these people. I don't hate these people. I think some of them hate me because I've seen some postings on Facebook. I'm a member of that Facebook thing. But I'm going to tell you, this is wrong. It's wrong in the sight of God. It's an abomination. And I gave you all those papers. That was my supporting documentation that I brought. And it's a copy of the first chapter of Romans. And that makes a lot of people mad because it cuts to the quick, just like a two-edged sword, just like one of them knives that they butcher them kids up with. And this is wrong, ladies and gentlemen. But I love this committee. I've watched what y'all have done in the past, and I know that you are going to act and do the right thing and pass this. And I'm asking for a clean sweep. I know some of you are Democrats and some are Republicans, but this is what is right in the sight of God, and we know that. And I'm almost through. You know, it is heartbreaking knowing that these pharmaceutical companies and educated doctors...
Sir, thank you for your testimony. I appreciate you coming, and perhaps someone will ask a question when we finish the panel. Thank you, sir.
Yes, ma'am.
Would you please state your name for the record and give us your testimony?
Thank you, Senator. My name is Dr. Cody Pike. I am a medical doctor. I'm also an attorney. I have a master's in bioethics as well as a master's of healthcare law. I trained at Baylor College of Medicine and went to University of Houston Law Center for Law School. Most of what I plan to say today has already been said by other advocates for trans health and my fellows who are standing against SB 14. So I want to take my time instead to address some recurring themes that have been coming up. First, Senator Campbell, you said that the WPATH standards have done away with distinctions on age. However, Chapter 6 is entitled Adolescence, and Chapter 7 is entitled Children. You also said that the WPATH standards do not address detransitioning. Subchapter 5.7 is entirely dedicated to providing care for those going through detransitioning. Turning to my second point, regarding the strictest standards of scientific evidence on the issue of how gender dysphoria hurts kids. A study conducted by the American Academy of Pediatrics of over 120,000 children, with over 1,700 of them identifying as something other than cisgender, found that transgender children are disproportionately at risk for attempted suicide. You made a lot of discussions about suicidal ideation, suicidal attempt. This is attempts, actual attempts in their lifetime before the age of 19. This is clear evidence that the approach by the legislature of, oh, you'll grow out of it, is not acceptable. It will only result in dead children. Next, children under the age of 18 in this country do not have gender reassignment surgery. I'm not aware of a single case in the United States of a child of the age of minority having a sexual reassignment surgery. Hormones? Yes. Puberty blockers? Yes. But surgery? No. So this rhetoric about mutilating children with scalpels is just fictitious.
Thank you.
I see my time's up.
I appreciate your testimony. Members, are there any questions for the witnesses? Senator Menendez, you're recognized.
Thank you very much, Madam Chair. Dr. Cody Miller, you seem that you have quite a bit of knowledge in this subject matter. You described your credentials at the beginning. What did anybody ask you to come down here? What brought you down here today?
No, sir. I am here only representing myself, and what motivated me is because I am myself a transgender Texan, and this issue is near and dear to me. It is my community being affected.
So you stated that what I thought about, I heard, and I appreciated in your testimony is that there's been a lot of things that have been said, but you stated some corrections, and a lot has been made about whether or not suicide rates that have been purported are true or not. You had mentioned the study of 120,000 youth. Is that what you said?
Yes, sir.
Who conducted the study?
The citation is Toomey et al. 2018 in the journal Pediatrics, which I believe is the most authoritative journal of pediatric medicine around in the United States.
In that study, my understanding is that among non-binary youth, 41.8 or 42% of respondents stated that they had either attempted suicide at some point in their lives. Is that correct?
Yes, sir. I have the numbers if you're curious. So again, that study looked at 120,000 children. We heard a lot of testimony about there need to be comparators, there need to be control groups. The control group was the cisgender children, the other 118,000 or so, because only 1,700 plus identified as something other than cisgender. Among the transgender children, those who are female to male transgender had a rate of suicide more than 50% in that population. Of those male to female, 29.9% had attempted suicide. Sorry, for all of these are confirmed attempted suicides. And for those who identified as non-binary, 41.8% had attempted suicide prior to the age of 19.
I've heard over and over today that there is a concern that there are no guidelines or help for anyone or care for anyone who is attempting to transition. Is there someone out there, are there guidelines in the WPATH?
Yes, I say WPATH, but the WPATH guidelines are over 260 pages of guidelines written by professionals who provide this kind of care, guiding how to best provide this care. Again, not just to those transitioning, but subchapter 5.7 to those detransitioning as well.
And so last question, what are the risks of not providing gender-affirming care to children with gender dysphoria?
Dead children. Oh, and if I may, one point I really want to make that I didn't get to is being trans is not cool. It's not a fad. Trans children are subject to more bullying than any other group. Trans adults are subject to more violence, intimate partner violence, domestic violence, stranger violence, murder than any other group. Since transitioning myself, I have been subject to physical and verbal assaults by complete strangers on the streets. Before I realized I was trans, when I was in high school, I identified as bisexual, and that entitled someone, in their opinion, to rape me. There's nothing cool about being LGBTQIA+. It's not a fad, it's not a social contagion. It is a real identity, and we deserve your protection, not your hatred.
Thank you for being here. Thank you, Madam Chair.
Thank you, Senator Menendez, for your question. Members, are there any other questions? Senator Campbell, you're recognized.
I just would like to have that, if you'll write down or just leave that with me, this study, I'd like to look at that, because does it have a cohort of a control?
Yes, so the cohort was 120,000 children. Of that, only 1,775 or so identified as something other than cisgender. So using multivariate analysis, they compared back to the cisgender children.
Okay, I just want to see the article.
Toomey et al. 2018 Pediatrics.
I'll have my staff come over and get that, because
Toomey et al. 2018.
I will have my staff.
I apologize, I didn't bring copies.
That's okay, you don't need to.
All right, thank you. Are there any other questions, members? Senator Parker, you're recognized.
Thank you, Madam Chair. Appreciate the testimony. I guess this one would be for Dr. Hotze. Dr. Hotze, from a medical perspective, let me give some perspective on, it seems like there's been an increase in the number of individuals that are transgender in recent years. Just curious as to your thoughts from a medical perspective on that, if you wouldn't mind sharing.
Well, without a question, our society has become much more sexualized. And in the schools, the pedophiles are pedophilia is sexualization of children. And what are they doing in the schools now, starting in the 4 years old and 5 years old? They're starting to teach this whole concept of you could choose whatever gender you want. And this confuses little children whose minds are very, very fertile. So that has got to have an impact. It's the sexualization of children in the school that I think has brought this about. The second thing is, in talking with some individuals that have detransitioned, I asked them a question. I said, I asked them about themselves, and they said, well, I was molested as a child, and that affected me. In fact, the person was molested by a family member. It was really sad. And that led to him having terrible mental problems, and he ended up thinking that's the way, it was his fault, that's the way he had to be. And I said, well, how many people in the homosexual movement, in the transgender movement, do you think have had problems with being molested as children? And he says, almost everybody I know in the movement, 90% at least. So I think when we're talking about this, you've got to address that underlying problem that people have been molested and that we need to deal with that. But the solution is not to say, well, just become another sex, and well, you just do whatever you want to do, and we'll give you drugs and we'll change you, because we know that causes long-term problems. What you do is you take away the right for these children to procreate at later times. They don't get that opportunity. So, but we've got to lay down the line. This is wrong. Homosexuality and transgenderism and all this is wrong. It's evil. We don't want that for our society. And if you let it spread, it spreads throughout the society, and it will have an adverse effect. All you have to do, folks, is look what happened to Sodom and Gomorrah. That's the way we're headed.
Thank you.
Okay.
Thank you, Senators. Members, are there any other questions for the witnesses? If not, thank you all so much for coming and sharing your stories. You're dismissed. And the chair will call the next panel: Alex Burnell, Pamela Woodashuk, Cindy Castilla, Sarah Caffey, and Sasha Bouchard. And as you are walking down, I thank you again in advance for just all of you, the respectful tone that's been maintained, and your adherence to our 2-minute time limit. I know that's a short time to say you've waited for a long time, but it allows everyone to have a chance to speak. All right. Looks like we may need Two more? Okay. Let's see. We're going to call two more witnesses. The chair calls Mary Elizabeth Castle. And one more. Okay, thank you. And the chair calls Wayne Maines. The chair calls Susan Briner. Thank you. And you'll have a chance to sit down and catch your breath. All right, we'll go in and get started from my left to my right. If you'd please state your name and then give us your testimony, please.
Good afternoon, Vice Chairwoman Paxton and members of the committee. My name is Mary Elizabeth Castle, and I'm the Director of Government Relations for Texas Values. Texas Values is the largest organization in the state of Texas with supporters in all 254 counties. And I'm testifying in favor of SB 14 to stop the sex change of minors. This is the second session attempt to have common sense legislation to protect children from dangerous, irreversible sex change operations that consist of puberty blockers, cross-sex hormones, and the eventual removal of healthy body parts. Sex change operations should be immediately stopped and inaccessible to children under the age of 18 for three reasons. 1, sex change operations for kids are bad science. 2, they produce terrible outcomes. And 3, they are an exploitation of vulnerable populations. Number 1, they're bad science. You cannot change sex or gender. Sex is an immutable characteristic determined on a biological level. Male and female are determined by XX and XY chromosomes that inhabit your entire DNA, which inhabits your entire body. Sex is not simply a matter of body parts or even sex stereotypical behaviors. Sex change operations are experimental, and their effects on children have not been fully tested. Watchful waiting has been proven as the most effective response to children experiencing gender dysphoria or gender confusion. With this approach, 80 to 90% of kids will accept their bodies. 2, it results in terrible outcomes. Suicide rates increase and not decrease with sex change operations. You can become left infertile, incontinent, and lose bodily function. And one example is the use of biocumatide, a cancer drug that is often used as a puberty blocker, and this causes liver toxicity. 3, it causes exploitation of vulnerable populations. A recent whistleblower at the Washington University School of Medicine saw an increase in teenage girls coming to gender clinics with no previous history of gender distress, declaring they are transgender. She saw that all of these girls had comorbidities such as depression, anxiety, and ADHD, eating disorders, and obesity. With that, we should pass SB 14 to protect these vulnerable populations. Thank you.
Thank you. Thank you for your testimony. Would you please state your name and give us your testimony?
Thank you. My name is Bishop Sue Briner. I serve as the Bishop of the Southwestern Texas Synod of the Evangelical Lutheran Church in America. And I come today to speak in opposition to this bill because the demands of this bill are contrary to the convictions of our denomination and contrary to the love of Christ. In the ELCA, we believe that we honor the image of God in others when we do everything in our collective and personal power to meet the needs of others and empower them to flourish. We also affirm the scientific reality that grouped with those others are people who exist in between our binary understanding of sex and gender, and people whose sex and gender do not reconcile without intervention, who we believe are carried by the Holy Spirit in their journey toward wholeness. Between this belief and affirmation, we faithfully hold the position that God calls us to meet the needs of transgender individuals and to empower them to flourish through the very means of care that medical and therapeutic professionals continue to hold up as the gold standard, and through the sanctity of the relationship between parent, child, and physician. This bill would encourage an environment that heavily contributes to the unnecessary mental anguish of youth who struggle with gender identity, openly harms these children by removing access to an entire category of health care with no opportunity for autonomy or parental input, and denies one of the avenues by which God continues to work in people's lives as they become who God made them to be. I implore you to oppose this bill in the name of Christ, who calls us to love all people. Thank you.
Thank you so much for your testimony. If you would mind, state your name for the record and give us your testimony, please.
Thank you so much. My name is Sasha Bookert, and I represent Lambda Legal and myself, and I am here today to speak out in opposition to SB 14. This bill places the state of Texas a great liability. I think everyone hopefully knows this already, but this isn't a new issue in the courts. You know, a similar legislation was passed in bills in Arkansas 2 years ago, and then one in Alabama last year. And in both cases, the courts looked at the evidence that was put before them, the scientific evidence, by the way, and resoundingly, in both states, issued preliminary injunctions stopping the law from going into effect while the litigation proceeds. And the court weighed, you know, the scientific evidence that we're talking about today, and said that, look, this is rigorous science that we can depend upon, and it's supported by all of the healthcare organizations, the preeminent healthcare organizations that rely upon peer-reviewed science, and enjoy. And then the Arkansas decision was upheld by the 8th Circuit Court of Appeals, as hopefully you know as well. So I think that I just want to flag that this places Texas a great liability of, you know, extensive litigation and losing taxpayer dollars, but the more important point here is that it would cause irreparable harm. As the person that was on the panel last time, I'm going to address a few quick points in the remaining time I have. One would be to, you know, address quickly this point about Europe that's been brought up quite a bit during this discussion, and it stuns me because I do this work for a living, and I just, you know, I want to be very clear that there is no country in Europe that categorically bans gender-affirming care to treat gender dysphoria. No country. Every country, kids, parents, and medical health care professionals make those decisions. So that just needs to be clear. No state, no country is seeking to do what this legislation is seeking to do to target vulnerable youth. In fact, in England, an appellate court overturned a lower court decision and said, this is a decision where we turn to the medical professionals for, and this is a Tavistock decision. In my last 6 seconds, I will just, you know, say that, you know, the social media discussion that we've had today, there is no evidence showing that social media contributes to people becoming transgender, and a citation for that is, I can give it to you later. I can give it to your staff later. Thank you.
Thank you so much. Thanks for bringing your testimony today. And if you would state your name and give us your testimony, and also just a reminder, if you can each get a little, it's a little uncomfortable sometimes, but close to the mic, that'll help us all hear you very well, and we want to hear what you have to say. So if you'll go ahead, state your name and give us your testimony, please.
My name is Sarah Caffey. I live just northwest of Houston in Waller County, and I am a transgender woman who transitioned 28 years ago. Best decision I ever made. No intention of detransitioning, thank you. However, SB 14, the gentleman from the ADF made the claim that the bill is not in conflict with the 14th Amendment's guarantee of equal protection because it regulates based on age. But in fact, the bill does not do that. It regulates based on transgender status. In fact, the bill explicitly says that all of the procedures listed are allowed for non-transgender people, especially intersex people, which is kind of ironic because that means that if the bill is specifically saying that parents may unilaterally impose their own preferred gender on an intersex child without any input from that child, who logically is the only person qualified to state the child's identity. No one can read minds. I would also point out that the bill, by banning puberty blockers, forces irreversible and permanent bodily changes on these trans children, namely that they go through puberty without any attempt to control it. These changes that they will experience are unwanted and traumatic and will contribute to their issues of depression and poor self-identity. And this is simply unacceptable. This bill, in a word, is evil. It is part of a campaign to attack the rights of transgender people across the board. I would like to end you with a reminder, though, that we are all human. We all deserve the same rights to life, liberty, and the pursuit of happiness. And I'd like to leave you with a quote from Shakespeare. If you prick us, do we not bleed? If you tickle us, do we not laugh? If you poison us, do we not die? And if you wrong us, shall we not revenge? Thank you.
Thank you for your testimony. If you would please state your name and give us your testimony.
Good afternoon. My name is Alex Burnell, and I am testifying against Senate Bill 14 on behalf of the organization Move Texas. We build power for young people at the state and local level through voter registration and issue campaigns. Senate Bill 14 provides an inhuman and cruel solution to a problem few people had until power-hungry politicians created one. I'll start by saying that Senate Bill 14 is not a solution to anything. It's inhumane, it's cruel, and it reeks of red meat tossed to a culture war that simply wouldn't exist without power-hungry politicians fanning the flames. Unfortunately, what's worse is this bill is just another hardship that trans children are having to endure in their already tough lives. These children face lives and difficulties that would break many of your hearts if they were faced by your own children. Politicians are using these kids as attack pieces for their next campaigns. Political operatives and activists are targeting them personally, and children are being excluded from society, all because of something they cannot control, who they are. If they were your own children, you would be disgusted at how they're being targeted like this. A broad coalition is gathered today against Senate Bill 14, including members of the medical community who nearly all agree that banning best practice life-saving care for transgender youth is not only spiteful, but also medically endangers these children. The bill's wording is clear. It totally bans transition-related care for children, severely punishes doctors involved in the care, and even blocks public money to those hospitals that provide such care. However, its message is even clearer. This bill tells trans youth that they are not children, that they are not people. The bill tells them that they are just political pawns, and their personal medical decisions are left to the government. That's just wrong. The bill at its heart opens the door to any government attack on evidence-based care. It opens the door to trans children who already face the nation's highest rates of suicide to be further villainized and victimized. That's why I urge all of you to oppose Senate Bill 14. Leave children alone, leave medical decisions alone, let children and their parents and their doctors make this decision. Don't insert politicians into the mix.
Thank you so much for your testimony. I appreciate all of you being here. Members, are there any questions for the witnesses? All right, thank you very much. The chair calls the next panel. Okay, and these names have been called before. We're going to give them another bite at the apple. Pamela Woodishick, Cindy Castilla, Wayne Maines, Cynthia Van Manen, and Susie Carter. If any of these folks are here present, if you would make your way down. All right, go in and have a seat. We're going to go in and call some other folks. Chair calls Kevin Witt, John Carter, Andrew Brown,
Madam Chair, may I ask a favor?
Of course.
While the witnesses come down, even though the room is emptied out, a lot of people are watching. And I believe that the members at this table have been very respectful, even though we may have differing views. But I think that there have been at times people who have made wild accusations about motives. And I'm not questioning anyone's motives on what side, but I think it's disrespectful and harmful and actually painful to people when people are being called pedophiles and they're being called that their motives are very criminal in essence. And so I would like it if we could, because I don't feel it's my position here to do, but I will if I need to. But I just appreciate your help on that.
Well, I thank you. Thank you for that reminder to all of us. I've been very impressed with the decorum in the chamber and a very emotional issue for many people. Thank you, Senator Menendez. I think we're going to call two more folks. Okay. Susanna Carranza. Okay. I haven't called Andrew. Or have I? And I may be repeating myself here. Andrew Brown. Oh, you're already here. Okay. Okay, so maybe two more. Jake Wilson. All right. All right, and we have one more who is making their way down, so we'll go on and get started with the panel. Thank you all for being here, and I appreciate in advance you adhering to our 2 minutes. I know that's a pretty tight timeline, but thanks for that. And if you would get us started, state your name and give us your testimony, please.
Good afternoon. My name is Jake Wilson. I am from Fort Worth, and I'm testifying in my personal capacity in favor of Senate Bill 14, which stops gender transition procedures from being performed on minors. Thank you, Senator Campbell, for carrying this bill. I think a child needs to have a chance to experience adult life as the gender God created them to be first, before they can make an informed decision that if they don't want that. I would want to leave the difficult surgeries and life-changing treatments to adults rather than kids, if it's one or the other. I'll defer to the medical testimony presented, but as all of us have heard, some of the testimony already given has made the point that puberty blockers can have irreversible effects if taken for long enough. If even just one child experiences what some of the witnesses we've heard in expert testimony went through, that is a tragedy. I will also add that when you listen closely to the arguments for raising the age for gender transition and those for the raising the age for buying an AR-15, the lines of reasoning regarding brain development, etc., are actually very similar. Well, how's this? I would support this legislature raising the minimum age for both buying semi-automatic rifles and for gender transition procedures to 21 years old. Personally, I believe that high school students should have more time to experience how the world works outside of high school before they either buy a semi-automatic rifle or try to change their gender. Please pass Senate Bill 14. Thank you all very much.
Actually, I'll go on and take care of this. Thank you so much for your testimony. And would you please state your name and give us your testimony?
Thank you, Madam Vice Chair and members. My name is Cynthia Van Manen. I'm the Executive Director for the Travis County Democratic Party, and I'm representing the party and myself as a proud Texan, born and raised in your district, Senator Parker, against SB 14. We oppose any effort to deny medically necessary and often life-saving gender-affirming care to those who need it, which this bill would do. We also oppose the use of political power to deny medical treatment to a group of people who are already underrepresented among those in power. As you hear from witnesses today who explain to you exactly how this bill would harm people they care about, I hope you'll see this as an opportunity to reflect on your power in this committee and in this Senate, and ask yourself whether or not you want to use this power to cause harm and to direct even more harassment to some of the most vulnerable people in Texas, like this bill does, or whether you want to use your power to improve the state we love and the people and the lives of our fellow Texans by keeping government and politics out of medical decisions. I ask you to please vote against SB 14 because, and has been detailed by many other witnesses you're hearing from today, it will cause harm to the Texans you represent. Thank you for your time today.
Thank you for your testimony. Welcome. Introduce yourself and give us your testimony.
Good afternoon. Thank you for being here, Chair Hughes and members. And I want to say thank you to Donna Campbell for authoring this bill. My name is Kevin Witt, and I am the Assistant Director for Mass Resistance. My pronouns are won't back down, and I am a detransitioner. I am testifying in support of SB 14. I was very androgynous in my appearance most of my life, often being mistaken for a girl, which, as you can imagine, was very confusing for me as a child. And in addition to being sexually abused as a child, led to my gender transition. I began my transition at the age of 16 years old. I hated the way I looked. I hated that I was feminine. I just wanted to be normal and masculine like the rest of the boys, but I did not fit in. This also contributed to the narrative in my head that I should live as a woman. I sought out a gender therapist, hoping I would get real counseling. I shared with her that I had been physically, verbally, and sexually abused by my father and drugged and raped by my best friend. And instead, this certified, trained counselor glossed right over everything I told her and proceeded to ask me to stand up and do a twirl, saying, "Oh my God, you are beautiful, and your body is shaped just like a woman." She then diagnosed me with gender dysphoria and typed up my walking papers, which was simply my letter to take to a doctor to get hormones, used a female restroom, and I just had to show them that letter, and I could even use it to change my name and gender marker on my identifying documents in Texas. This was after just one visit to her office, and I never went back. This gender therapist is still practicing to this day, having never received counseling for the abuse I endured. Taking her word for it, I proceeded to continue living as a female and diving deeper into the LGBT community, all while being traumatized individual without treatment. I got very involved in the club scene, doing drag shows, and eventually went into all forms of the sex work. I went on to take hormones, which led to me having precursors to a stroke from taking hormones, and I then went on testosterone blockers, which took that for years.
Okay, Kevin, hold tight. We'll have some questions at the end, but we're going to try to stay on the time, so
okay,
hold tight there. Thank you. Welcome. Introduce yourself. Give us your testimony.
Good evening. My name is Andrew Brown. I oversee child and family policy for the Texas Public Policy Foundation. Thank you for the opportunity to speak in support of Senate Bill 14. Systematic reviews of the empirical evidence relating to the efficacy of hormone therapy for children and adolescents struggling with gender dysphoria have been conducted by the United Kingdom, Sweden, Finland, and the state of Florida. These reviews all came to the same conclusion. The evidence supporting the medical transition of minors is of very low quality, and the certainty of benefits from the therapy is very low. As a result, these jurisdictions have sharply restricted the medical interventions, instead recommending counseling and psychosocial supports. Just last week, Norway became the latest country to take this approach. The American Academy of Pediatrics, which was mentioned earlier, has not conducted a systematic review and admits that its statement supporting gender-affirming care is not intended as clinical guidance. Another issue raised earlier was the use of puberty blockers for gender dysphoria and precocious puberty. Studies show that when puberty blockers are used for gender dysphoria, 96 to 98% of users go on to cross-sex hormones. When used to treat precocious puberty, 100% go through normally timed biological puberty. A recent paper from the Dutch clinicians who originally developed the protocol we're debating today admitted, quote, starting puberty blockers in itself makes adolescents more likely to continue to medical transition. Based on current evidence, the state regulation of what amounts to an experimental practice is necessary. Such regulation must prioritize the protection of children and adolescents from irreversible and potentially harmful medicalization while respecting the families of minors struggling with their identities. Senate Bill 14 accomplishes these goals and represents the most effective and compassionate solution for safeguarding the health and well-being of Texas children. Thank you for your time.
Thank you for your testimony. Welcome. Introduce yourself and give us your testimony.
Hi, I'm Dr. Susanna Carranza, testifying on my own behalf, and I oppose Senate Bill 14. First, I would like to note that we don't really see trans kids and parents here today because this environment is pretty harsh and hostile to them. Also, as a previous witness mentioned, it can be dangerous for physicians and therapists in this field to speak up, so we don't see that. That means that supporters can say anything in favor of the bill, and we really don't have that many people to counter. Like, we were lucky to have a couple of doctors that were able to counter some of the points that have been repeated and are not true. There was also talk of social contagion. The idea that really people would choose to go through all of this and be marginalized for life just because of some trends. The idea that all of a sudden, like, you just say, oh, I'm trans, go to the doctor, and the next day you start hormone therapy. I mean, the few trans people that were able to come here, you say, like, you go through years and years of counseling and consultations before you actually go through more permanent transitions. So if you really, really, really care about the well-being of kids, as is stated in the opening, we really should make this a welcoming environment to discuss all the issues with all people, not just people that support your side. This body is creating so many laws that vilify the medical profession that soon enough it will be hard for any of us in Texas to find doctors because, who wants to practice medicine here? So I really urge you to oppose this bill, and I think, just get out of, government should get out of the relationship between a doctor and a parent and a child. Thank you.
Members, any questions for the witnesses? I've got a couple, and thank you each for your testimony. Mr. Witt, you were talking about your experience. A number of witnesses today have hypothetically said, oh, well, I've never heard of that happening. You've been through this process. I think I may have rushed you earlier. Tell us again, you sought counseling for this, and tell us how that went. Tell us what the process was like. Tell us if you felt like you were rushed or not. I'm going by what's on your written testimony, but tell us about that, what that process was like.
If you look at my testimony that's been passed out to you, on the second page, you will see the letter that I received from my doctor, my gender therapist, who diagnosed me with gender dysphoria. When I went to her one time. And that very first time she wrote that letter, which allowed me to get hormones in the state of Texas, allowed me to change my gender marker on my ID and everything. I even could use this letter to get SRS, which is sexual reassignment surgery, just with this letter. So the fact that these people say that you go through years and years of psychological therapy, it's absolutely not true. I was abused. I was traumatized. I went to a gender therapist to seek counseling for the trauma I went through as a child, and I never received that. I just was diagnosed with gender dysphoria and told to go get hormones.
So earlier when Dr. Campbell was asking one of the witnesses about the form, about the letter, the witness was kind of resistant to admit that. But is this the document we're talking about? You needed this letter signed by a therapist to open up the door for you to get these medical treatment. Is this the document that we're talking about earlier?
Yes, it is.
And it took you how long to get this?
30 minutes.
And so we've heard testimony about protocols and what happens and what doesn't happen, but you're speaking about your personal experience. Is that right?
Yes, I am.
You also said that after this letter, you wanted to take hormones, and you were talking about some medical problems you had after that. Tell us about that, because I think I cut you off.
Well, after I started taking estradiol, about a year later, I went to the emergency room. I didn't know why. I just knew that the right side of my face was numb. And they did, after doing a lot of testing and keeping me in the hospital, they found out that I was having precursors to a stroke from taking estradiol. And so then after that, they recommended that I come off of estradiol and just take testosterone blockers, which I did take testosterone blockers for many years until about 2 years ago. And these testosterone blockers have now made me sterile and chemically castrated. for life. So whenever they say that these don't have long-term lasting effects, that's absolutely not true. They do, because I'm living with the long-term effects now. And I want to remind you that I started transitioning in 1996. That's whenever I was 16. I didn't go to a counselor for gender therapy until 2005, probably. So this has been going on for years in the state of Texas, and it's still happening now. This doctor is still in practice, this gender therapist is still in practice.
Thank you for your testimony. Senator Menendez.
Thank you very much, Mr. Chairman. Mr. Witt, your testimony, first of all, let me say how sorry I am for the fact that you were sexually abused and raped. It's no one should have to go through that. I feel, though, that unfortunately sometimes it seems as if you're not, I hope you're not trying to make a correlation between that and the rest of what happened, because I mean, this person, this therapist that you said you saw once, and then she wrote you a note so that you could go start gender therapy. We've heard testimony today that that's not the normal practice. You would agree that there are people in every field that do the job right and then they do the job wrong. Would you not agree?
Actually, no, I would not, because the psychology board only allows therapists to offer gender-affirming care. So a gender therapist cannot counsel you away from transitioning. They can only affirm your trans ideology and counsel you toward that. And that's a proven fact that can be, I can email you any information that you need.
Yeah, no, I definitely would like to hear more about that. I just can't imagine that every single person that goes to a gender therapist is told that they need to start therapy. It doesn't seem right.
Well, like I said, I saw this counselor one time and she wrote that letter after a 30-minute session.
Understood.
And she also, if you read at the bottom, her credentialing, she had been working with the transgender community since 1997 and followed the guidelines set forth by the World Professional Association for Transgender Health, formerly known as Harry Benjamin International Gender Dysphoric Association, which is now going by the name WPATH.
So you just testified a few minutes ago that you went to see her, I think, in 2005. Was that accurate?
Somewhere around there.
Around 2005. That would be about 18 years from now ago?
Probably, yeah.
So my math is probably wrong on that, but anyway, how old were you?
How old was I?
Yeah.
Oh, gosh. I was in my 20s.
So you weren't a minor. You were an adult.
No, I started transitioning as a minor at 16.
Correct, but you didn't go see the therapist, you said, until 2005.
I went to go see a therapist because I was traumatized. I had been diagnosed with borderline personality disorder, bulimia, and anorexia previously, as well as distorted self-image.
Right.
So I went to go see her because in my mind, she was a affirming doctor that would affirm my LGBT issue identity, and I felt more comfortable going to a gender therapist than a regular psychologist. That's why I went to her.
That's fine, but you were in your 20s when you made the decision to go see her, right?
Well, yes, but she also saw minors.
I see.
As you heard earlier, my friend that was up here, Abel Garcia, that testified, also went to a gender therapist and also only was there for 30 minutes to an hour and also was given the same type of documentation. And he's 26 years old. So it still happens today.
My understanding is that in addition to today's testimony, you also work on, you oppose drag shows, I think. Is that correct?
Yes, I did perform in drag shows.
Oh, you oppose them. I don't care if you performed. I mean, you're opposed to them in general terms. You're part of a group that goes around opposing drag shows. Is that correct?
Well, I definitely don't think that, well, actually, that's irrelevant to this topic. I mean, but yes, I do oppose drag shows. Okay. I don't think kids should be around any type of gender confusion.
Okay, yeah. All right, thank you, Mr. Chairman.
Senator Campbell, you're recognized.
Thank you. Mr. Witt. Yes, Mr. Witt, right?
Yeah.
Do you have insurance right now? Are you able to receive counseling? Did insurance
no, I'm
pay
not.
for your transition?
Actually, there's not a counselor that I know that I can go to that would see me and counsel me in a way that I need to be counseled. The only type of counseling I can receive is faith-based counseling, and it's because it is not credentialed.
That's it. You said something about somebody doesn't allow the counselor to do detransitioning, only affirming?
Affirming, yes.
What association is that?
So anybody that has
I'm sorry, would you talk a little bit in?
Anybody that's like a licensed counselor or therapist, they can only give you and offer gender affirming care. So if, for example, I go to a gender therapist and I say, I'm confused about my gender identity, I feel like I am female, but I'm not sure, they can only tell you, yes, you are a female. They cannot, they will lose their license if they counsel you away.
Who is giving them that instruction? The licensing board?
Yes. Yes.
So I'm sorry,
The psychology board.
The psychology board, like here in Texas?
Across the United States.
Okay, I just want to double check that. See?
Yeah, I can email you documentation.
That'd be great, or because I'd like to look that up. That obviously sounds a one-sided, so.
Yeah.
Okay. And right now you do or do not have insurance that covers you?
I do not.
By choice, or can you get an insurance company to cover you?
I can't get an insurance company to cover me. Insurance.
So you cannot?
No, because I have pre-existing conditions. That's what they consider it. So they will cover me, but they will not cover any of my pre-existing conditions.
And the pre-existing conditions came from your transition?
Yes, it did.
Which have stayed with you. That's what they won't cover?
Yes, and I have dealt with this my whole life.
Yes. Thank you. Thank you, Mr. Chairman.
You're welcome.
Senator Parker.
Thank you, Mr. Chairman. Just a quick question for Mr. Brown. Mr. Brown, you talked about experience with this issue in other countries, in Europe in particular. Maybe just elaborate on that for a minute in terms of their experience with this, if you wouldn't mind.
Yes, so each of those countries that I mentioned have conducted what's called a systematic review. It's a look at basically all of the evidence that's out there. It's a deep dive into the quality of that evidence. They assess how well those studies were structured, and then they draw conclusions based on that systematic review. Each of those countries and the state of Florida have conducted one of those reviews.
Can you speak?
Oh, yes, sorry. Sorry, I need to get right on this thing. So each of those countries, as well as the state of Florida, that have conducted one of those systematic reviews have all reached the very similar conclusion that the evidence supporting gender-affirming care for minors, specifically hormone therapies, is of very low quality, and also the certainty of benefits for the minors from that therapy is very low. Essentially, they're saying, we don't see evidence that shows that this actually works to bring a positive outcome for these minors. And as a result, each of those jurisdictions that I mentioned have sharply restricted. And an earlier witness did say that they have an outright ban, and that is true. There has not been outright bans, but there have been sharp restrictions to the point of these nations are viewing it as an experimental procedure and are only allowing this in very strictly structured clinical experimental settings.
Thank you very much.
Senator Menendez.
Thank you, Mr. Chairman. And Mr. Witt, you were correct in that the question I asked earlier wasn't relative to the subject, but the question I'm about to ask, it pertains to the fact that we're all under oath here, and that we have to, when we make representations, they have to be within that we're expecting that everybody's making honest representations. My question to you is, I'm reading an article here from February 2021 where it states that you were fired for spreading false conspiracy theories. And so my question is what I'm reading in this article, is this factual? Because then what happens is I have to question what seems to be, for you to tell me that every single therapist that you go to must, by law, nationwide, say to every patient that they can only affirm that if you think you're confused about your gender, you must be. And I'm having a great deal of difficulty with that statement. And so that's what caused me to do some investigation. And so is it true that you were let go from your prior employer for making the conspiracies? The article is in the Texas Tribune, February 1st, 2021.
For what conspiracy?
It says here, Texas...
And quite frankly, I feel like this is a character assassination, and I don't think it really is relevant. My past, I mean, you are trying to discredit me is what you're trying to do.
That's exactly what I'm questioning, yes.
And if I can speak, there has been, ever since I started speaking out against the trans movement and what they're doing to kids, since 5 years ago, this is my third session, I have had a number of hit pieces written about me. I've lost my job. I've lost my career due to people attacking me. And the hit pieces written about me, most of them are absolutely false. And if I could afford an attorney, I would actually sue them.
I don't believe the Republican Party of Texas would have fired you just because someone made a wild allegation. I think they would have only done it for fact-based. And so that's why I'm trying to get to the facts, sir.
The Republican Party of Texas fired me for being at the Capitol January 6th.
Okay. Thank you very much. Thank you. Thank you.
And that's not a conspiracy theory.
Members, any other questions for the witnesses? Thank you each for being here. Thanks for your testimony. The chair calls Pamela Woodschick, Cindy Castilla, Wayne Maines, Haley Harris, Sheridan Mendonca. Again, we're looking for Pamela Woodschick, Cindy Castilla, Wayne Maines, Haley Harris, Sheridan Mendonca. The chair calls Callie Butcher, Jacqueline Murphy, Valerie DeBill, Edie Adams, and Dr. Linda Fowler. Again, we're looking for Callie Butcher, Jacqueline Murphy, Valerie DeBill, Edie Adams, and Dr. Linda Flower. I may have said Fowler. It's Dr. Linda Flower. The chair calls Alice Baker, and the chair calls William Gossett. So Alice Baker, William Gossett. And if we're out of seats, just hold tight. We'll get you up in just a second. Thank you very much. Okay, we're going to begin over on my left, your right. Welcome, introduce yourself, and give us your testimony.
Hi, my name's Callie Butcher. I'm an attorney, and I'm the president of the Dallas LGBT Bar Association, and I'm testifying against this bill. This bill is blatant discrimination against transgender Texans, banning identical health care for some children but not others solely on the basis of that child's gender identity. This bill specifically denies gender-affirming care for transgender children while allowing that same care for children that are not transgender. For example, SB 14 prohibits puberty blockers if prescribed to a trans child, but specifically allows the same drug to cisgender children. In both cases, the drug is being prescribed for the same reason, that is to delay the physical onset of puberty until the child is more mature. Denying this health care only for transgender young people is cruel and unconstitutional, and it attacks the most vulnerable people in our state and will have a direct and devastating impact on the physical and mental health for these children. Further, by prohibiting this health care for trans children, this bill would violate a parent's due process right to care for their families and a physician's right to care for their patients in accordance with medical standards and best practice. The state has long recognized a parent's right to make decisions about the medical care and treatment of their children. Indeed, parents must make difficult medical decisions for their children, many of which have permanent consequences on behalf of their children all the time. A parent's right to consent to that care that is medically necessary and recommended for their children by their doctor and consistent with the standards of care should not be curtailed by the state on the basis of a child's gender identity. This bill supplants the rights of a parent to make medical decisions for their children with the author's belief about what is right. This is an egregious overreach by the government into the lives of all Texans and sets a dangerous precedent for medical care in this state. Thank you.
Thanks for your testimony. Welcome. Introduce yourself. Give us your testimony.
I'm Dr. Linda Flower, and I live in Tomball, Texas, where I'm the medical director of a charity clinic. Can you not hear me? Okay. So, Senator Hughes and members of the committee, thank you for this opportunity. I come before you today as a citizen, a mother, a grandmother, and a family physician with over 45 years of experience, including training residents in 3 medical schools in South Texas. My purpose is to honor and protect the children of Texas from undergoing medical treatments that would harm them. As a medical professional, I find it difficult to understand how or why a child suffering from gender dysphoria or anxiety should have their delusion reinforced by individuals who should be acting in the best interest of the child. As you can tell, I disagree with several major medical societies, some of which I am a member still. We have learned that from data that there actually is no improvement in their anxiety in many cases, and in many cases it increases the psychological distress of patients when they're treated with puberty blockers and cross-sex hormones. It should be a red flag that as these transgender centers and clinics grow, there's such a financial benefit to the doctors who do the surgeries and the drug companies who provide the medications. Some examples of the cost to the patient include the cost for psychological evaluations, which should be done. They can cost, so somebody that doesn't have insurance, they can be $50 to $200 a session. The cost of hormone treatments varies depending on the state and what hormones are used. They can range from $300 to $2,400, and I have seen another resource that said $5,400, depending on what's used. The cost of sex reassignment surgery for those without insurance ranges from $15,000 to $25,000. For reconstruction of genitals and chest surgery is $50,000.
Thank you for your testimony, Doctor. Welcome. Introduce yourself. Give us your testimony.
My name is Alice, and I'm a trans woman. I grew up here in the Austin area. As a preteen, I was an AB student, and I was very much a goody two-shoes kind of kid. When I was 16, I filed charges against my dad. He was arrested, but the state actually chose not to pursue the case despite the images of my bruised body. No matter how many times I reached out for help, nothing changed. And at 16, I was forced to learn a hard lesson, that what is right is not the same as what is legal. Sometimes to survive, you have to break the law. Don't put trans youth in the same position that I was in. where what they need to survive is illegal and the adults who care are powerless to help them. The state of Texas has a duty to protect children, and it is failing. State-funded foster care workers abuse kids. School shootings continue to take lives. I think this body should tackle the real abuse and violence that is happening against children and stop messing with loving parents who provide their kids with life-saving health care. I'm an adult now. I've been through therapy for all of the BS that happened to me. Yet I'm here again asking the state to keep kids safe, and not just the kids, but me too, with other bills that are being brought. If I've learned anything in therapy, it's that I do not deserve this violence. Trans people do not deserve this violence. We just want to live, so please let us live in peace. Thank you.
Thank you for your testimony. Welcome. Introduce yourself and give us your testimony.
Hello, I'm Jacqueline Murphy, and I am here representing myself as a trans woman who received puberty blockers as well as cross-sex hormones as a minor. The first one, I think, to be in front of this committee who is not a detransitioner. All operations and treatment have a calculation of dissatisfaction and regret. In the case of gender-affirming care for minors, the answer is clear. The benefits far outweigh the risk. Cherry-picked, politically groomed detransition narratives from flown-in witnesses, for which I have an immense amount of empathy, and lies from a minority of doctors willing to do harm to trans patients, for which I do not, can't change the fact that gender-affirming care is a proven model with well-understood risk. Those who regret transition are not enemies of the trans community as it is being framed today, but require much of the same medical and therapeutic support as they too have bodies that do not match their visions of themselves. I understand that this committee is unlikely to be swayed by the facts of the issue. I could speak about my own attempted suicide, the trans friends I have lost to suicide, the beautiful and life-affirming effect gender-affirming care has had on my life and the life of my trans siblings, and how ripping care away from them will threaten their happiness and their existence. But I don't believe you will listen to those stories either. Whether it is because of genuine bigotry or merely political expediency, you have made your political mission clear, and you are not protecting me. Stories like mine counter the narrative you are trying to build because you do not want to protect children, you want to control them, but as long as me and my trans siblings are alive, you cannot win. Thank you.
Thank you for your testimony. Welcome. Introduce yourself. And give us
Hello,
your
William Gossett from Houston, Texas. I just wanted to show my support for SB 14. Transgenderism is especially harmful to children. According to the American College of Pediatricians, the public promotion of transgenderism constitutes a form of child abuse. Quote, conditioning children into believing that a lifetime of chemical and surgical impersonation of that opposite sex is normal and healthful is child abuse. Endorsing gender discordance as normal via public education and legal policies will confuse children and parents, leading more children to present themselves to gender clinics, between quotes, where they will be given puberty-blocking drugs. This in turn virtually ensures that they will choose, between quotes, a lifetime of carcinogenic and otherwise toxic cross-sex hormones, and likely consider unnecessary surgical mutilation of their healthy body parts as young adults, end quote. This form of child abuse must be vigorously opposed. Thank you.
Thank you for your testimony. Senators, any questions for the witnesses? Senator Lamantia, you're recognized.
Thank you, Mr. Chairman. My question is for Jacqueline. You said that you started going through your therapy as a child, correct?
Yes.
And did you have parental consent when you started going through the therapy?
I did.
And with that support, did it help, and were they able to ask questions of the doctors and make sure that what they were prescribed, what they're doing, was the right choice for you?
Absolutely. There was a several-month period of consultation before hormones were started, and after hormones were started, I was required to attend weekly therapy sessions to make sure that what was happening was right for me and beneficial to my life.
And after the hormones started and after you started transitioning, did you still continue that therapy as well?
Yes, I'm still in therapy now once every 2 weeks with the same therapist I saw back then. Her name is Adrienne Sneed. She's very nice. Might be watching now. But yeah.
would you say that there were multiple medical providers involved in those decisions and were able to advise you on different issues?
Absolutely. I have a therapist, a psychologist, a physical doctor, a general care provider, all of which are involved in the decision-making process for my body and my medical care.
Thank you very much. Thank you.
Senators, any other questions? Senator Parker.
Thank you, Mr. Chairman. This question is for Dr. Fowler, Dr. Flower, rather. Sorry. Thank you for being here. I appreciate just reading.
Senator, we can't hear you. I'm sorry.
Oh, yeah, very good, Mr. Chairman. I appreciate you being here and reading through some of the material that you gave us. I'm just curious, you know, and I know you've been practicing, I think, for 45 years. Give us your perspective on the issue broadly. And you talked about some of these reports, the Stonewall School report, and some of these others that are concerned from Sweden. So maybe have you elaborate on your concerns about some of those items and kind of give us some more perspective.
Well, so I think it's been mentioned before that the study from Sweden is about a 30-year study. It started in 73 and went through 2003, and they saw that they had a 19 times higher rate of suicide when they had completed after they'd been transitioned. So that's one of the reasons why they've pulled back in Sweden from just, you know, letting that be available without counseling and without further research, as several other countries are doing. It's kind of interesting too that one of the reasons that England quit had their big clinic was because the parents and the children that were treated sued the clinic. And so I believe that's still in process. So in a way, we may be helping the medical profession because maybe keep them from being sued if we pursue the course that we're going. One of the other things that I mentioned in my written testimony was that there's not a code in Medicaid for the doctors to be reimbursed. And so they have to call every treatment with the hormones treatment for precocious puberty, which it's not. You know, they're actually using these drugs to delay puberty. As mentioned before in Dr. Reif's testimony, precocious puberty is a totally different entity than delaying puberty. So you delay, in precocious puberty, you're delaying puberty until the point in which they would normally go through puberty, whereas when you use puberty blockers to stop puberty, they start that like at 10 or 11 or 12 in that area, and that's when the other one is stopped. So it's just a totally different animal, and it shouldn't be confused. One shouldn't be confused with the other. I'm glad to hear that many of the folks have gotten a lot of good counseling before they had any of this therapy. Unfortunately, that doesn't seem to be the case, and even in several of the communities, they're not following the guidelines that were originally proposed in order to do these therapies. And the YPath just recently, I think we heard about that earlier. And I can't give you examples of which cases, except for that I've spoken to individuals who had like one session, and like this other gentleman mentioned. So it just varies, because sometimes the counseling is very good and it lasts for maybe a lifetime. The people that are uninsured who want to do this are faced with very high cost. And I guess the ironic thing is if somebody wants to detransition, the insurance won't pay. Okay. So, I mean, it's just, there's this, I don't know, I don't think we understand enough about it, and I think we need to do more investigation. I appreciate the folks that are here that are trans, and I don't have anything against them. I just feel like it's better for us to wait and do more research and to come out ahead rather than behind, with these problems.
Thank you, Dr. Flower. Thank you all for being here.
Thank you, Dr. Senator Campbell.
Dr. Flower, thank you. Thank all of you for coming. It's always a good perspective to get a diverse perspective. Well, certainly, Dr. Flower, I know you've been here all day, but thank you very much for staying and helping us. I know you work with children, so thank you. Thank you.
Senators, any other questions for these witnesses? Very good. Thank you for being here. The chair calls Valerie DeBill, Edie Adams, Theo Adams Hernandez, Ash Hall, Jinx Delay. The chair calls Valerie DeBill, Edie Adams, Theo Adams Hernandez, Ash Hall, Jinx Delay, and Chloe Goodman. I was looking for Chloe Goodman. The chair calls Adriano Perez, Lorenzo Bees, Ricardo Martinez. So we're looking for Valerie DeBill, Edie Adams, Theo Adams Hernandez, Ash Hall, Jinx Delay, Chloe Goodman, Adriano Perez, Lorenzo Bees, and Ricardo Martinez. Welcome. Introduce yourself. Give us your testimony. Go ahead.
Thank you. My name is Edie Adams. I'm a medical student here in Texas, and I'm here on behalf of myself to oppose this bill as a concerned future physician. I'm almost done with my third year of medical school, which puts me about halfway through my training to become an independently practicing primary care physician. If I want to be a specialist, that's another few years of fellowship training on top of the minimum 7 years of medical education I need to have. Medical students work 60 to 80-hour weeks taking care of patients in multiple hospitals and clinical sites all over the county. And then on top of that, we use our free time to study for a multitude of written and clinical exams we have to take to prove our knowledge base is up to the standards established by the National Board of Medical Examiners, which includes 3 all-day licensing exams and a board certification exam on completion of residency. We are extensively trained to evaluate and interpret data, to judge the quality of that data and the studies that supplied it, and to follow the available evidence despite our preconceived notions. Due to this rigorous training, physicians are by far the most qualified to interpret medical evidence and use that evidence to educate and inform families so those families can make the best decisions for their children. These individualized, private decisions should be made between families and the physicians they trust, not legislated by elected officials. If passed, this bill would set a dangerous precedent by overriding a physician's authority to determine what health care is necessary for what patient and allowing non-medical governing bodies to dictate medical best practices. I urge you to oppose this bill and leave medical decision-making in the hands of medical providers. Thank you.
Thanks for your testimony. And welcome. Introduce yourself. Give us your testimony.
Absolutely. My name is Ash Hall. I am here testifying against the bill. I represent myself and the ACLU of Texas. I want to start out by saying that it is disingenuous to say that this bill is about protecting children. Starting with the arguments about genital mutilation, that's not actually what is happening here. As a member of the trans community, I would know. And furthermore, if it was really about concerns over surgery for people who can't consent, there wouldn't be a carve-out in the bill for intersex infants who cannot consent to that. And the intersex community has actually asked for a ban on surgery for intersex infants, but that's still in the bill. So let's not pretend that it's about protecting children from any sort of physical harm. It's also not about being worried about side effects for different kinds of medication or hormones, because there are plenty of treatments for different illnesses that have horrible side effects. For example, chemotherapy for cancer, or some of the side effects for antidepressants that people take. But we've made the decision in that case that it is worth it to prescribe those medications anyway because it keeps people alive. What this is really about is trying to get rid of transgender people and erase us from public life. This is part of a national coordinated attack on our community because there's a select group of people that profit off of creating animus against my community. And the ACLU of Texas, my community, and I will not stand for it. Trans people have always been here. Whether we are supported or spurned, we continue to show up in this world and shine brightly. Our lives are not up for debate, and our youth deserve dignity, respect, and love just like their peers. Thank you.
Thanks for your testimony. Welcome. Introduce yourself and give us your testimony.
My name is Theo Adams Hernandez. I am a trans adult, and I am testifying against SB 14. As a trans adult, I urge you to stop interfering in healthcare that does not concern you. It is simply between a trans child, their parent who loves and supports them, and the trusted healthcare professional. Earlier, we heard from a doctor who said there is no scientific-based evidence for gender-affirming care, and that is simply untrue. When it turns out that 1% of people who have received gender-affirming surgical care have experienced regret. Compared to that, 65 to 83% of people who have received cosmetic surgery have regretted it, including breast augmentation and rhinoplasty. Instead of protecting young transgender Texans, you've made villains out of us, making us the boogeyman of your societal landscape instead of focusing on improving education or expanding healthcare to impoverished Texans. Healthcare is about health, not morals or the beliefs that people like Donna Campbell hold, or as an ER doctor, not an endocrinologist or plastic surgeon who works with trans people. If you want to do no harm, then you must let doctors, experts in this field, tell you what that is. Campbell and the people that she has shown particular interest in are not experts in endocrinology or trans healthcare. And it has been made very apparent by members of the trans community that she does not know anything about what she's talking about when she advocates for this bill. I have heard a number of people come through here to testify, and the majority are cis people who do not know or love trans people. I am a trans person, and I knew I was trans when I was a child. I did not have the knowledge or language to advocate for myself, but here I am today as a trans adult and wishing that I had had the ability to access the healthcare I needed so that I could be further along in where I want to be. I think it's insulting to bring non-Texans here uninvited testimony because they're not going to live the repercussions of this law. Trans Texans will live this. Vote no on SB 14.
Thank you for your testimony. Welcome. Introduce yourself and give us your testimony.
Good evening. My name is Lorenzo Beas. I'm here today representing myself in opposition of SB 14. I'm a transgender Texan. I drove up from San Antonio today to testify. Unlike some of the speculation being mentioned today, I did not grow up to embrace my gender by simply ignoring my gender dysphoria. I did not medically or socially transition until the age of 25, mostly due to societal pressure and lack of access to medical care. The talk about irreparable damage to children's bodies, ignoring the fact that best practice healthcare does not involve administering surgery on minors. I am here to speak on the irreparable damage and psychological trauma of forcing a child to live within the confines of a gender that they do not identify with. I can relate from firsthand experience, living under those conditions did rob me of my childhood. Disempowering parents to listen to their children's concerns about their gender identity and banning the avenues for parents to make informed decisions about their children's care is not the answer. As some of the powerful testimonies presented earlier today state, we must focus on the relationship between doctors and parents and the children to identify the best path forward for their specific cases. Thank you.
Thank you for your testimony. Welcome, introduce yourself, and give us your testimony.
Good afternoon, Chairman Hughes. Pleasure to see you again, and members of the committee. My name is Adri Perez. I live here in Austin, and I'm here to testify against SB 14. I knew I was transgender when I was only 4 years old, and contrary to your belief, the only social pressure that I felt was to stay in the closet because I didn't want to disappoint my mother, my family, or the church that I belonged to. Growing up, it was clear to me that the LGBTQIA+ community lacked legal and social protections and faced increased discrimination because of it. But when I was 17 years old, I fell in love with my first girlfriend, and thanks to that love, I finally felt safe to come out as transgender and queer. I grew to accept and love that I was born this way and that was okay. For the next 3 years, I struggled to find a doctor that was experienced in providing healthcare to transgender patients, and for those 3 years, I was depressed and reluctant to live my life. I knew that this healthcare existed, and not being able to access it because of where I lived, how much money I made, and the general lack of acceptance was almost too much to bear. Shortly after being able to access this healthcare, my depression and anxiety went away, and for several years, it stayed that way. I started to see an increase in the acceptance of transgender people, and I felt so much joy every day. I want every person, regardless of where they come from, where they live, or who they love, to feel the joy of being protected, respected, and able to access the healthcare that they need. In January of 2017, the depression and near constant anxiety came flooding back when newly elected President Donald Trump announced that he would systematically roll back the progress that had been made for transgender people. That same year, I testified before this committee for the first time, and in the 6 years since, there hasn't been a single sincere discussion about what is actually best for transgender Texans. Certainly, this bill is not about protecting children by preventing surgeries on minors. It explicitly allows genital reconstruction surgeries on intersex infants and says nothing about circumcision. In truth, most of the people who have testified for this bill today are not here to protect children. Your allies are here because they think transgender people do not exist, but here I am, existing, beautiful and without a single regret because this healthcare saved my life. The only significant detrimental factor to my health now is not the healthcare I receive, but rather the hateful, unaccepting, and misinformed attitudes and messages that this chamber, the governor, and attorney general perpetuate against me and my community. Please vote no on this legislation and start treating transgender people with the respect and the humanity that every person deserves. Thank you.
Thanks for your testimony.
Yes. Yeah, I'll be happy to.
You recognize Senator Menendez?
Yeah, absolutely, Mr. Chairman. I completely agree. I have a few questions here, but what I want to do before I start questions so that you hear it from me and not the chair is let's try to just, even though we know there has been the issues that you're talking to are fact-based, let's not call anybody out by name or anything like that because I've asked others not to call anybody out. So, you noticed that?
Oh, thanks. Yeah. Go ahead, please.
Yeah, absolutely. Thank you, Mr. Chairman. So, let's get back to the bill. You mentioned you knew at 4 that you were. Others probably knew at a young age. Could you tell me how, if you had been able to access gender-affirming care, how would it have helped you in your coming out? Especially, I think you said you didn't have access, and then I think my thoughts are, because I know that this is, we've heard some people talk about regret from other people testifying, and how do you feel that this is making others feel in the community? So, couple things. One, would gender-affirming care have helped you? And then 2, what do you think about the bills? Because what are the effects of these bills on you as a trans community? Anybody?
I believe that gender-affirming care would have helped me. Now as an adult, I think back to a childhood I could have experienced had I not been constantly disassociating from the experience that I was forced to live in. I think it would have just been, I hear a lot of people said today, let children be children, and I think I would have just been allowed to be a normal child.
So I think it's funny that you folks from the testimony that I've heard today tried to describe this as some sort of social contagion or as something that parents are imposing on their children. And as I tried to encapsulate in the beginning of my testimony, the only pressures that I felt were coming from my family and from the church. to adhere to being a cisgender straight child and teenager and adult, because the messages all around me were that if I came out, I would not be accepted or loved, and who under those circumstances would want to jeopardize their relationships. And I think this is all very important to mention because some of the people in this committee and in their testimonies have tried to speak to the comorbidities of anxiety and depression as though those were the causes for gender dysphoria, when really those are the comorbidities that exist because of a lack of societal acceptance and the messages that you are near constant, that you receive, that especially in a conservative state like Texas, that there will not be a community to embrace you. And especially growing up, I think it's important to note I came out as transgender in the year 2010. That was before Obergefell. That was before Bostock court decisions. At the time, being a senior in high school, that was around the time that they were debating whether or not same-sex couples could get married in California. So in falling in love with my girlfriend, one of the most near constant messages that was in the back of my head was, oh no, if we end up spending the rest of our lives together and something happens to you, I won't be able to be in a hospital room with you when you are dying. Or any of the other several thousands of privileges that are granted to married couples, right? And we all grew up, I think, right, with that idea that we didn't have legal or social protections for being who we were, for loving the people that we loved. And it is that causes the depression and the anxiety, not the fact that we were transgender, gender diverse.
So while I do appreciate that we have to stay on the bill, so the situation that I want to ask about is just to keep in line with the bill. We've heard today that there's a concern that young people can be guided by either a therapist or a doctor, or even sometimes their parents, misguided, that to be led down the road to get transitional. The reason we need this bill is because the children are too young to know what's best for them. Has anyone ever tried to convince you or suggest to you that you should be trans?
No.
No.
Do you know anybody
Quite the
who's
opposite.
been the opposite?
The opposite.
I have been asked to be cis. I have been rejected and disowned for being trans. So everyone would rather I be cis, honestly.
Thank you very much. Thank you, Mr. Chair.
Every conversation I had with a psychiatrist or therapist, I initiated the part where I said, I feel like this, and then they picked up on what I put down. It was never them approaching me, telling me, hey, are you trans? And leaving it open for me to only say yes.
And I want to add that I was able to access trans-affirming care after trying to look for safe doctors where I knew I wouldn't be treated poorly, because I have already received that kind of care for trying to say that I was trans and being bullied into being cis by the doctor.
Especially at the time that I came out, I'm from El Paso, Texas, and there was a church in my community that was pretty well known for conversion therapy. And so in seeking out a doctor, it can be a scary environment because you can end up in a doctor's office or with a therapist that may want to subject you to conversion therapy. And
once again, I don't mean to, but I have to, it's going to be a long night for everybody here. And one of the things I want to tell you is thank you for being here, like we've told a lot of other people. Thank you for your bravery. And keep telling your truth. Thank you, Mr. Chairman.
Thank you.
Thank you.
Thank you, Senator. Senator Lamontia.
Thank you, Mr. Chairman. My question's for Ash. I know you're very involved in the community and have a lot of contacts there, and we haven't heard or seen, for very clear reasons, a lot of parents of trans kids here today. So I was wondering, if this bill passes, what are parents of trans kids thinking about doing or willing to do, or what happens to the community in that respect?
Yeah, so it depends on the resources that the family has. For people who can afford to do it, a lot of parents and families are talking about moving out of the state, which may sound like a small price to pay to some people, but when you consider that there are entire clans of families who are located in the state, grandparents that need to be taken care of by these parents, in addition to taking care of their kids, These are really hard decisions that these families are making. They're uprooting their lives potentially to save their children from harm from the state. So that's one of the conversations a lot of people are having. But there's also a fair amount of families who wouldn't even be able to afford a move like that. And so what we're looking at there is there's a sense of panic, in particular among folks who have less resources, because there's questions about, do we hide this? Is there a way that we can keep our child's identity hidden while at the same time not making them feel ashamed of themselves or feel like they can't be themselves at all? Especially when we know that when children are forced to stay in the closet, there are really severe mental health outcomes for that. And yeah, more than anything, that's what comes up is, what am I going to do to keep my child safe when they live in a state where they can't access the care that they need, even though other people can access the exact same care for different reasons? How do I keep my child safe? How do I convince them that this is a life worth living? How do I keep my child alive? And those are questions that parents shouldn't have to ask. But bills like this, the rhetoric that comes with bills like this, the narratives that are being spread about these families, that's being absorbed by those kids too.
Right. And there's an organization, I believe, called the Trevor PAC that's supposed to help with a lot of these type of concerns.
Yes.
With parents. And so you have a lot of, or do you have you seen more people in the transgender community reaching out to those outside resources to try to get help?
Yes, outreach to the Trevor Project skyrocketed during and after last session, and I would not be surprised to find in a couple of weeks that it is going up even as we speak. And furthermore, the Trevor Project conducted a study on LGBTQ youth in Texas right after last session ended, and the rates of anxiety and depression were startlingly high. And what I found particularly disturbing was, I think it was 20% of transgender youth were experiencing a suicidal ideation. Actually, let me double check that. It was either suicidal ideation or they had made an attempt. I have that pulled up. One moment. Okay, it's horrible. Yeah, had attempted. 20% had attempted. And it's actually 47% of them had considered suicide in the past year. And it would be easy to just say that's a result of discrimination or comorbid illnesses, but 84% of the youth that were surveyed said that state politics were a reason that they were feeling so terrible.
Thank you so much.
Thank you.
Thank you, Mr. Chairman.
Thank you, Senator. Members, any other questions for the witnesses? Thank you each for being here. Thank you very much. Is there anyone else present wishing to testify on, for, or against Senate Bill 14? And thank you, guys. You're excused. Thank you very much for your testimony. Anyone else wishing to testify on, for, or against Senate Bill 14? We don't have any more. No more witnesses have registered. Then we'll find out who we've got here, and we will look forward to your testimony. So introduce yourself and give us your testimony, please.
Hello, thank you, Chairman Hughes and members of the committee. My name is Chloe Goodman. I'm with Equality Texas. I'm an LMSW. I have another master's degree in public affairs. And first off, I'll remind everyone here that the GOP platform states, quote, "We oppose all efforts to validate transgender identity," end quote. So this bill is not about protecting transgender and gender expansive children, but about ensuring there are no transgender people, period. If terms like transgenderism, choosing trans, and the transgender process are not enough evidence that members have waded into unknown waters and are now in over their heads, the belief that trans people will simply disappear makes this very clear. We have always been here and we are here to stay. All this bill accomplishes is hurting children, families, and their communities. I've heard a lot of accusations that there is no proof that the healthcare banned in this bill saves lives or that transgender children grow up to be transgender adults. To which all I have to say is, what empirical evidence would it take to convince you otherwise? The proponents of this bill have tried to find holes in the empirical evidence when there are none, and are now gasping for straws. Grasping so far, in fact, that we're hearing about issues with California's medical system as if Texas infrastructure bore any resemblance to that of California. Now we're being told Texans should follow the lead of Finland, Sweden, and the UK. And you're right, there is nothing that says Texas values quite like cherry-picked out-of-state testimony and Sweden. This bill is hateful and invasive. Transgender children are not hurting anyone, and they deserve to explore their identities without the Texas legislature breathing down their necks. Thank you.
Thanks for your testimony. Welcome. Introduce yourself and give us your testimony. We're going from right to left. Go ahead.
I'm just being kind.
Thanks.
Of course. Thank you, Chairman. My name is Ricardo Martinez. I'm the Chief Executive Officer for Equality Texas, and I am here representing myself and Equality Texas in opposition of SB 14. I don't get it. We know that this care has improved the lives of so many, and for so many, this care has been life-saving. Trans Texans, their families, and allies have come before you to testify to that effect today. Medical and mental health professionals have also resoundingly provided their own expertise and offered peer-reviewed, scientifically backed data to support the personal stories of so many trans people who are living authentically, healthfully, and truly thriving. So I don't get it. I don't get why you don't believe the people who have come to share their stories, their lived experience. The way I see it, no matter what you believe, you can agree that every Texan deserves to visibly live, work, contribute to our communities, and access crucial resources that allows us to thrive. That includes health care. All Texas families deserve to be respected, allowed to make private medical decisions, and live their lives without government overreach. Transgender people are part of the fundamental fabric of this state and deserve the same access to privacy, respect, and community as our fellow Texans. I was raised to believe that people are inherently good. I assume that each of you wants to help, wants to save a life. I don't know what you want your legacy to be, but whatever you choose will forever include the specter of every trans, non-binary, intersex, and LGBT kid that will suffer if this bill moves forward. Free states don't ban health care. Free states don't rob their neighbors of integrity. Today, you have a powerful choice to make. Please remember that lives are on the line.
Thank you for your testimony. Welcome. Introduce yourself. Give us your testimony.
Thank you, Mr. Chairman and members. My name is Don Garner. I'm the Executive Director of Texas Faith and Freedom Coalition, whose mission is to give people of faith a voice in government. And toward that end, I have the privilege of speaking in support of bills like Senate Bill 14. We are the world's largest Get Out the Vote organization. In the most recent election cycle, we distributed voter guides through volunteer door-to-door canvassers to 8.2 million voters, with over 500,000 of those being distributed here in Texas. And those we represent are troubled by the lasting and irreversible damage being done to young people through gender modification procedures. Though a child's dysphoria may prompt a desire for these procedures, we can all agree that children do not always know what is best for them, which is especially true for children suffering from dysphoria. Love provides what is needed rather than catering to misguided wishes. In Europe, the fields of medicine and psychology see a growing consensus to draw back from these procedures to pursue more conventional means of treating gender dysphoria. We should follow the evidence and do the same. Most children would prefer a diet of donuts and soda, but accommodating such a preference would be disastrous to the child's health. Obviously, in this case, the stakes are much higher. I urge you to support the passage of Senate Bill 14, to the full Senate.
Thank you. Senators, any questions for the witnesses? Well, thank you for your testimony. And I thank each of the witnesses. That is all the witnesses that have registered and expressed a desire to vote to testify on for or against Senate Bill 14. So public testimony is now closed. Bill is left pending at this time. And for the benefit of the witnesses and those watching, we have obviously a number of bills left, and with witnesses with various schedules, and we're trying to work with everybody and accommodate as many witnesses as we can and make it as convenient as we can while allowing everyone who wishes to testify. So with that, the chair lays out Senate Bill 959, and recognizes its author, Senator Campbell, to explain the measure.
Thank you, Mr. Chairman. In the 86th legislative session, Governor Abbott signed SB 22 into law that all state and local taxpayer dollars, prohibited all state and local taxpayer dollars from funding abortion providers and their affiliates. A conflicting definition in statute unintentionally left open enrollment charter schools out of the definition of a governmental entity. This bill, 959, remedies this issue by adding open enrollment charter schools into the definition of governmental entity in the government code. That's it.
Thank you, Senator Campbell. Members, any questions for the author? Senator Menendez.
Sounds like a simple, good bill, including them. Does that also include them in the whole education code as well?
No.
I'm just checking.
Thank you. Thank you, Senator Menendez.
Thank you, Senator. Any other questions for the author?
Too fun.
Very well. Testimony is open on Senate Bill 959, and the chair calls the following witnesses: Pamela Woodschick, Mary Elizabeth Castle, Jake Wilson, Miriam Spencer Morrison, Joe Poyman. Again, the chair calls Pamela Woodschick, Mary Elizabeth Castle, Jake Wilson, Miriam Spencer Morrison, and Joe Poyman. And the chair also calls Valerie DeBill. Valerie DeBill. Welcome. Introduce yourself. Give us your testimony. We'll start over here on your right, my left.
Okay. Hello again. My name is Jake Wilson. I am from Fort Worth, and I am testifying in my personal capacity in favor of Senate Bill 959, correct? So one thing I'd like to use my time to address the argument many have been making against these bills is that the bill hurts the mental health of transgender individuals. Mental health is an important concern, and I think almost everyone testifying today would agree that we need to help those in the LGBT community who struggle with depression. We may just disagree on how to accomplish that goal. And you know,
hold tight. We want to hear from you now. We're on Senate Bill 959 that has to do with charter schools. Oh, very good. Okay.
959.
Carry on.
Yeah. So in all these transgender-related bills, mental health's important, and we may disagree on how to accomplish that goal. I actually think it's my observation, I think there's some basic worldview differences in play. The Christian worldview, which I'm a Christian, is that there is objective truth, that our feelings should come into line with what external realities are and recognize the external realities. Whereas postmodernism takes the idea that basically we create our own truth and our feelings, that the external has to be brought into line with our feelings. And, as a Christian, I think external truth is important. Let's say hypothetically that we have a boy who is depressed that he is not a horse, which we all agree that it's not practical to surgically make him a horse under current technologies. If this boy said he was experiencing serious depression for not being a horse, what would our response be? Would our solution be to give the boy hay for each meal, surgically place a horse tail on his body, and pretend that he is a horse? After all these efforts, when the boy went home and saw that despite all this he was still not a horse, would that make his depression worse or better? But what about another solution? What if we told the boy that God made him a boy on purpose, that God has a plan for him as a boy and as a man, and he's going to be all right? What if we sought counseling for the boy to help him feel happier about how he actually is? Would that be better for his mental health? I think so.
Okay. Thanks for your testimony. Welcome. Introduce yourself. Give us your testimony.
Good evening, Chairman Hughes and members of the committee. My name is Mary Elizabeth Castle, and I'm the Director of Government Relations for Texas Values Action. I'm very happy for SB 959. It is a very much needed closure of a loophole that we didn't know existed. I was here in 2019 when SB 22 was passed, and we were very happy about the positive effects of the law stopping sex ed curriculum coming from Planned Parenthood to Austin ISD. I remember testifying 3 times before the Austin ISD board, warning them that they could be in legal trouble for choosing Planned Parenthood materials after the passage of SB 22. And we can go on to talk about the bad aspects of Planned Parenthood sex education at a later time, but several examples showed that they encouraged role play, inappropriate relationships between kids and adults, and even strong emphasis on gender identity. Needless to say, we did an open records request, and it revealed that Planned Parenthood lobbyists warned Austin ISD that if SB 22 were passed, then their contract cannot continue. That led to Austin ISD eventually moving to a Canadian abortion provider to get their sex ed materials. And while we were so happy that we were able to stop Planned Parenthood from going into the public schools in Texas, it is very disappointing to learn that some charter schools are now finding a loophole in order to obtain these Planned Parenthood sex education materials. The very positive effect of SB 22 was stopping these government contracts, and it was very good that we were able to keep Planned Parenthood sex education out of our public schools. So if there is a loophole, then we definitely want to close it, and that's why I'm in favor of SB 959.
Thanks for your testimony. Welcome back. Introduce yourself. Give us your testimony.
Good evening now, Mr. Chair, senators. You know, this is a strange bill to me because I thought the intent of...
Even though we know, go ahead and say your name.
It's charter schools is that...
Need to tell us your name.
Oh, I'm sorry, Marion Spencer Morrison. Yes. I'm from Hood County. This bill is pretty interesting to me because as I was reading it, it seemed to run afoul of all the other legislative bills that are being presented about charter schools and private schools, and that they should have their own rules and guidance and based on their own beliefs and rule systems that they should have. And so I find it interesting that this Senate bill is proposing to put them on the exact same playing field as the public schools, when yet the voucher programs and systems do not require the same things. So I find it interesting and intriguing that we are looking to create a similar system for charter schools as we do the public schools, when we've specifically said throughout all the legislations where we want to encourage charter schools that they get to have their own rules and their own governance system and what their curriculum is, and that if parents want to enroll in those schools, that they would be aware of the curriculums that those charter schools would be teaching. And so I'm speaking against this bill because I think if we're going to say charter schools are different than our public schools and our private schools, then they should be able to make their rules and submit that as part of their charter, as they've had to do for other things. And if parents choose to attend that charter school that uses that other curriculum that this bill is against in the public schools, then those parents have the choice not to send their kids to the charter school. That's my time.
Thanks for your testimony. Welcome. Introduce yourself. Give us your testimony.
Mr. Chairman, members, my name is Dr. Joe Poyman. I'm Executive Director of Texas Alliance for Life. We strongly support Senate Bill 959, and we thank the author for bringing it. As you may recall, in 2019, the legislature passed Senate Bill 22 to remove taxpayer funding from abortion providers and their affiliates. It prevented the state and all political subdivisions, cities, counties, hospital districts, and independent school districts from contracting with those organizations, abortion providers and affiliates. That bill has worked tremendously well towards accomplishing the intent of the legislature. For example, here in Travis County, an abortion provider lost a $1 million contract for a sex ed program with a local school district as a direct result of SB 22. Meanwhile, Texas provides vast resources for low-income women through Medicaid, the Healthy Texas Women's Program, and the Alternatives to Abortion Program. These programs already provide women's health services, counseling, mentoring, and more, which some of the abortion providers supposedly do. However, there's a significant hole in SB 22. That bill did not apply to open enrollment charter schools. There's a provision in the Education Code, and it's there, Section 121058C, that states that an open enrollment charter school is not considered to be a political subdivision unless a state statute specifically states that the statute applies. That's what we need here. And I've provided a fairly egregious example in which a large charter school mentioned purchasing a curriculum from Planned Parenthood, the abortion provider. Those minutes are from a September 2019 meeting, only 11 days after SB 22 went into effect. SB 959 will plug that hole in the law and ensure that tax dollars do not go from an open enrollment charter school to abortion providers or their affiliates. Thank you.
Thanks for your testimony. Members, any questions for the witnesses? Thank you all for being here.
Could I have 15 seconds to clarify something really quick? Sure.
Hang on. I didn't say yes.
Okay.
You already had more time than anybody else. Sure, 15 seconds.
Okay. I got my papers mixed up and I was going first, so that was my testimony for SB 250. My apologies, my mistake. But I do support Senate Bill 959 as a pro-life advocate, and I think Senator.
Very good. We got your support. Thank you very much.
All right.
Thank you for being here. Chair calls Jonathan Covey and Carol Ayala. Chair calls Jonathan Covey, Carol Ayala, bless you. Anyone else present wishing to testify on, for, or against Senate Bill 959? Senate Bill 959. Very well. We have Carol Ayala, Jonathan Covey. Welcome. Have a seat, and we'll, Ms. Ayala, welcome. We'll start with you. Introduce yourself. Give us your testimony.
Well, good evening. My name is Carol Ayala. I am here representing myself as a former public school teacher and the director of Concerned Parents of Texas. Thank you all for filing this bill that will extend protection to all Texas students, including charter schools. According to the Texas Public Charter Schools Association, there are more than 700 public charter schools in Texas, serving nearly 375,000 students. Charter schools include an enormous amount of students who are at risk. That is, students who have been retained, are emergent bilingual, pregnant, homeless, and economically disadvantaged. In short, most charter school students enter their school doors with harmful hurdles against them. Being sexualized by Planned Parenthood should not be one of those hurdles. For example, one of the charter schools that is using Planned Parenthood is KIPP, Texas, a charter school system that has 59 campuses and an enrollment of 34,000 students. In 2021, our organization was made aware of Planned Parenthood coming in to provide wellness lessons. At that time, we were familiar with SB 22, prohibiting Planned Parenthood from having transactions with public schools. Upon inquiry, we found that charter schools were exempt and are exempt. Since KIPP Charter School proudly uses Planned Parenthood, is it any wonder that on September the 2nd, 2022, 7th grade students at their Poder KIPP campus in San Antonio were sexualized by playing a teacher-led game during advisory called Bear, Hunter, Hooker. In other words, prostitute. Yes, you heard that right. The students were to do the following: growl like a bear, position themselves about to shoot someone, and to position themselves in a way to seduce. Please protect charter school students from being sexualized with this bill. Thank you all.
Thank you for your testimony. Welcome. Introduce yourself. Give us your testimony.
Mr. Chairman, Jonathan Covey. I'm the Policy Director for Texas Values, testifying in favor of SB 959. I appreciate y'all also being here. It's been a long day, and I appreciate y'all hanging in there. We appreciate this simple bill. It's a necessary bill, as others have mentioned. The intent of SB 22 back in 2019 was to prohibit all future state and local taxpayer dollars from funding abortion providers. It should have included charter schools using curriculum from abortion providers seeking to sexualize children. Children are not sexual beings, as the director of Planned Parenthood Center for Sex Education said. Why is the abortion lobby trying to show vulgar graphics, desensitize kids to sexually explicit content, teach them about curriculum, sexual rights, comprehensive sex education? It's because they know it's a pipeline to get young people to abortion centers. It's unconscionable for Texans to have their own dollars used against them by our own charter schools to promote anti-life issues. So please vote against this bill. Thank you.
Any questions for the witnesses? Thank you very much. You're both excused. Thank you.
I should have said for it, so I'm sorry. Thank you, Senator.
We got it. Thanks. Yeah, thank you very much. Mr. Kevin Misiala, you're excused. Thank you very much. Did you register for this or want to testify on this?
I did. Thank you for the grace. I may have hit the wrong button when you're doing the kiosk.
No problem.
I appreciate it.
No problem. But even though we got you before, tell us your name.
My name is Denise Seibert.
Yes, ma'am.
I'm representing myself. I support SB 959, prohibiting charter schools from abortion industry influence. I am a woman who, under the belief that the government and a doctor would never harm me, had an abortion. Abortion providers are an industry selling a product called abortion on demand. We should protect our children from the selling of medical procedures and from the influence of abortion being an answer for an unexpected pregnancy. The abortion industry doesn't provide unbiased information. I experienced such bias when I went to an abortion facility in LA and was given no other options. I never even met the doctor. They have one thing in mind, and that is to sell a product of abortion. I support SB 959. I thank you, Senator Donna Campbell, for fighting the good fight to protect our children against this industry. Thank you.
Thank you for your testimony, and we've got your information all here, so thank you very much.
Thank you.
Senators, any questions? Very well, thank you each for being here. That is all the witnesses that have expressed an interest in testifying on, for, or against Senate Bill 959. So public testimony is closed. The bill is left pending at this time. Thank you, Senator Campbell. The chair now lays out Senate Bill 1029 and Senate Bill 250. Senate Bill 1029 and Senate Bill 250, both filed by Senator Hall and similar subject matter. And so we lay out both of those bills, and welcome Senator Hall back to State Affairs. And we will, in a moment, recognize him to explain first Senate Bill 229 and then Senate Bill 250. You want to reverse those? Okay, how about this? The chair lays out Senate Bill, well, they're both out there. We'll recognize Senator Hall first on Senate Bill 250. Senator Hall, you're recognized.
And members, 250 is very similar to SB 14, so I will spare you the rather lengthy introduction I had to it describing the heinous aspects of this unspeakable procedure that we've inflicted upon the children. But I will say that this is something that Texas will, when we pass these bills, we will not be leading the nation in this practice of protecting children from gender mutilation surgeries. There are at least 15 other states that have in the process of passing legislation, not the least of which is Tennessee, Mississippi, Oklahoma, South Dakota, and South Carolina. Minor children experiencing gender dysphoria, permanently disfigurement, and lifelong health care issues from medical professionals who perform medical treatments to modify their gender appearance. This goes back to Vanderbilt, and there's a video on the internet for everyone to see. Opened a trans clinic in 2018, and during the lecture that same year, Dr. Shane Taylor explained how she convinced them to get into the gender transition game. She emphasized that it is a big money maker for the hospitals, especially because the surgeries required a lot of follow-up, and those doctors in performing this surgery would create patients for life. Folks, I think we heard testimony today from witnesses that have experienced their need for medical care for life. And we also see that, unfortunately, our hospitals and some of our medical professionals have put profit above patient care. We saw that in COVID, in which hospital policy killed more people than the COVID did, and now we're seeing it in this, what could be classified as cosmetic surgery. Members, Bill 250 would prohibit physicians and other healthcare providers from prescribing treatments and performing procedures which would modify or alter the physical sex characteristics of a child suffering from gender dysphoria. It would also prohibit professional liability insurance coverage for physicians who prescribe gender transitioning drugs and gender mutilation procedures for minors. Additionally, the bill will require the permanent revocation of the license of a healthcare provider who prescribe gender transition drugs or who perform gender transition procedures. This would not apply to procedures meant to treat children that have sex characteristics that are not congruent with their sex chromosomes. There's a concern that was brought to us about the language in the bill that references the transitioning of a child's biological sex, and we want to make sure our intentions in this bill are emphatically clear and address any possible loopholes. So we may be considering a language change amendment to clarify this language. With that, Mr. Chairman, I'm happy to take any questions. We've got two invited witnesses. And I'll now lay out 1029.
Thank you, Senator. Any questions for Senator Hall at this point?
Again, I will skip the why we're doing this. I think we spent a day doing that. This bill, 1029, would make private health benefit plans strictly liable for the lifetime care of the patient for the consequences of gender modification treatment procedures covered by this plan. Again, folks, I think you heard plenty of testimony from folks of the problems that they had being rejected for medical services afterwards. And this bill would also make physicians responsible for transgender treatment procedures and strictly liable for a patient's medical, mental health, pharmaceutical costs, and for the life of the patient as a result of the procedures. And the bill would also prohibit public funds from being used for the provision or administration of a gender modification procedure or treatment, and prohibit state-funded insurance plans from covering transgender modification treatments or procedures. With that, Mr. Chairman, be happy to take any questions. We do have a couple of witnesses.
Thank you, Senator Hall. Members, any questions of Senator Hall on this bill? Senator Middleton.
Thank you, Senator Hall, for bringing this bill. On 1029, you have a healthcare coverage mandate for health plan insurers, right? That would, and it was one of the concerns we heard in Senate Bill 14, that they would have to cover the cost of the detransitioning treatments, basically. And so I've got to point this out. So Texas Medical Association handed out a letter to the committee as why they couldn't support Senator Campbell's Senate Bill 14. And one of the reasons on the second page is the cessation of hormone therapy, and that that's not provided for. Well, your bill would do that, correct? It would provide for a healthcare coverage mandate for ceasing hormone treatment and detransitioning, right?
Yes.
Okay.
Yes.
And have they reached out to you to support your bill, Texas Medical Association?
No, they haven't.
Okay. And I just checked. I don't think they've registered in support of it either.
I haven't seen the registration. No.
Thank you.
Thank you, Senator. Any other questions? Senator LaMantia.
So one of the other differences between your bill and Senator Campbell's bill is that your bill doesn't allow for any exceptions regarding precocious puberty or treatment for prostate cancer or any other aspect.
I'm sorry, say that again.
So your bill doesn't allow for exceptions for treatment of precocious puberty or prostate cancer, which a lot of these drugs, the hormone stoppers, can be treated for?
The bill would allow for that.
Oh, it would? Okay, because in Senator Campbell it's specifically stated, whereas in this one it's not.
Okay.
Okay. And then the one on insurance, that coverage that applies into the bill, you're saying that would apply for life? So if someone was on a plan with their employer and then they got terminated, that employer's plan would still have to cover those treatments even though they're no longer paying premiums or part of that plan?
If the insurance paid for the transitioning, they'd be responsible for continuing medical coverage and detransitioning for that patient for life.
Even though they're no longer covered by that plan?
Even though what?
Even though they're no longer covered by that plan?
That's correct. That's the commitment they would make. If they were going to pay for the transition, they would have to recognize they were responsible for whatever other medical problems that were induced as a result of that transitioning, and if they decide to detransition.
So it's almost like a workers' compensation model? A workers' compensation model?
I think so. I'm sorry, the sounding is so hard.
It's like a workers' compensation model?
I think so, yes.
Thank you. Thank you, Mr. Chairman.
Thank you, Senator Hall. And so we will start with invited testimony. And on the chair calls Dr. Linda Flower, Dr. Bethany Rife. Dr. Linda Flower, Dr. Bethany Rife. Senator Hall, there's plenty of seats up here wherever you're comfortable. You take your old seat if you want to. Get situated there. Thank you for staying with us, and we have you both here on Senate Bill 250.
Trying to find my notes. You go first.
And when you are ready, when you get set up, introduce yourself and give us your testimony. Welcome.
Good evening again. I'm Dr. Linda Flower. So happy to be here, Senator Hughes, except for the hour, and distinguished members. Thank you for having us. So again, I come as a citizen, a mother, and a grandmother, and her mother. And I'm a family physician, been doing family medicine for 45 years, and trained family physicians affiliated with 3 Texas medical schools. Discussion of the issue of gender dysphoria, and I'm here to support 250. Discussion of the issue of gender dysphoria, gender incongruence, and diversity is fraught with social, scientific, and cultural disagreement. So I'll endeavor to provide some of the reasons I support this legislation and similar bills as well. In 1979, Dr. Paul McHugh, head of the Department of Psychiatry at Harvard, stated that the problem with transgender persons was in the mind and not in the genitalia, and that biological sex cannot be changed. Unfortunately, after they discontinued the program at Harvard, they did not do any follow-up, long-term follow-up of these patients, so we don't know from that particular instance what the outcome of the patients that did undergo surgery was. Over the past decade, there has been a rise in the number of centers offering transition services, not only to adults but to minors. Parents are being blackmailed into thinking that if they don't allow their child to transition, he or she might commit suicide. On the back portion of your of the testimony that I've submitted, the written testimony, you'll see an example that we've labeled misleading that's from the Mayo Clinic, where I really feel like they soft pedal a lot of the side effects of these issues and of these treatments. And the only thing that they say about being sterilized, they just have a note that says future fertility. So how is a parent going to understand that they might be, what they're doing could make their child sterile? So all kinds of implications that are not fully delineated in that handout for the parents. They're told that their child might commit suicide, and we've heard that mentioned more than once today. And this notion of increased suicide ideation and self-harm has been debunked when the statistics are fully analyzed. We know from detransitioner testimonies that there is a honeymoon period after they've had the surgery. Now, this is more hopefully in adults, but it can be in children in some states, that there's a euphoria for about 2 years. And then most of them have said that after 8 years or more, that's when they start to really realize that the treatment that they got was not helping their mental issues. So, and again, I'll mention again the Swedish study that was mentioned earlier today. The U.S. study from the National Center for Transgender Equality in 2010 showed increased rates of attempted suicide after both medical and surgical transition. For medical transition, it was 45%, and for surgical transition, it was 43%, higher rates of attempted suicide than those who had not. And that is, the ones that had not were 34 to 39%, respectively. There is increasing awareness among parents, caregivers, clinicians, and therapists that there is a clear link between gender identity issues and autistic spectrum disorder. Although there is an astonishing number of young people sharing characteristics that are usually only present in 1% of the population, while there is clear evidence that there is a link between the number of children and young people with gender dysphoria or identifying under the transgender umbrella, there is no research that looks at why. Part of the reason for this is that the exponential rise in children and young people experiencing gender dysphoria or identifying as trans has taken place very quickly, too fast, in fact, for research to keep up. There has been an unprecedented overall increase in referrals to the National Health Service Gender Identity Service of over 3,263% over the 10 years from 2009 to 2019, with an increase in referrals from adolescent girls over that period of 5,337%. With the understanding that a significant portion of all referrals indicate autistic traits, it may be many years before we see the results of any research into the reason for this.
Thank you for your testimony. Dr. Reif, introduce yourself and give us your testimony.
Okay. Hi again. I'm Dr. Bethany Reif. I'm a pediatrician. I have 10 years, been practicing for 10 years in the state of Texas, and I'm raising my 5 children as well. We've heard a lot of testimony today, and I think we can all agree that the detransition stories that we have heard and the harms that these people are going through is awful, and that we need to protect these children from these things happening. We've also heard some success stories, which is great and wonderful that these trans people are living well and doing well with their life, and that it worked out well for them. But how do we tell the difference, and why are we having such awful outcomes? And that is what these clinics and this and the medical world is refusing to acknowledge and refusing to research and figure out why is there such a huge difference. One of the points that I wanted to bring up is that when a person presents with a body dysmorphism such as anorexia or bulimia, we in no way tell these patients, oh, you are overweight, and oh, you should, continue to treat yourself in this way. But with gender dysmorphism, we are doing that. We're telling them, oh, you are, and going along with their mental disagreement with their body. I would also evaluate these children that are complaining about gender dysphoria, especially at very young ages. This is more based on they want to play with the boys, they want to, dress in boys' clothing, or vice versa, they want to wear girls' clothing. I don't know how much these children understand or relate this to their actual body and their sexual organs, and how much they truly understand that they're doing. Most of these children are they're prepubertal, so they have no sexual experience, no understanding of what sex is or sexual attraction. Yet what the medical community is doing, that is transitioning these children and giving them hormones, is destroying their chance of ever having a normal sexual experience. And we've heard that most of these trans children have also been abused. Who's treating the abuse? We seem to be ignoring it. And that is devastating to these children. We need to help all of these children regardless. I want to make sure also to say, just to reinforce that we have no negative feelings or thoughts toward trans people in any way, fashion, or form. Every person is created in the image of God, and they deserve every love and care that we can give them. My concern is that transitioning a child at a young age with hormones is causing more harm than good, and we need to figure out a better way for these kids. Thank you.
Thank you for your testimony. Senators, any questions for the witness? Senator Parker.
Thank you, Mr. Chairman. Dr. Flower, just a couple of questions on some of the data that you gave us. Specifically, I guess, from the National Center for Transgender Equality in 2010, the suicide rate being at 45%, it's just unbelievably horrifically high. Do you have any new data on that that's any fresher or newer that you could speak to beyond?
Since 2010.
From 2010?
I don't.
Okay, all right. And then the other stat that just stuck out to me was that 10-year period, the overall increase in referrals from the NHS Gender Identity Service went up over 3,000%. And just wanted to
So it was over
elaborate on that.
3,000% for overall, and then but the girls went up over 5,000%, and that's partly where you look at this and you think, why is this happening, and why didn't it happen before? And so that's where that at least I extrapolate that to be some of the things that were mentioned earlier today, the social media, and also the pressure, the peer pressure from others. That this, when these young girls, especially adolescent girls, they want to be accepted. And so when they see their friend that's, trying to be a boy, well, they want to be like them. And so we think that some of that is just a social contagion, and that's where that notion comes from, that we still are doing, we still need to do research to understand more. That's why we need to understand what's going on and why. And some of it we think is from childhood trauma, because we do know that a lot of these kids have been traumatized in one way or another. It doesn't have to be sexual trauma. It can be loss of a parent. It can be divorce. So it can be any kind of trauma that they're dealing with that's anxiety, that's causing anxiety, that's pushing them to do something different.
And how do these figures that we just discussed, how does that relate to your own practice? I know you've been practicing for 45 years, and the kind of experiences that you've had with this topic.
So the interesting thing about that is, in the 45 years, including teaching in medical schools, I have not encountered this problem, because it only, in at least back when I was, even to this point, it's 1% of the population. So these statistics come from referrals to those clinics, and so since I don't work in one of those clinics, I'm not experienced with that. But I did it's interesting, because I was talking to my colleague, and when he was in private practice just in the last few years, he's younger than me, and he had a 16-year-old girl, and the mom was wanted to transition to a male. And family was supportive, mom was supportive. She came in dressed in, boys' clothing and everything. And then a year later, came back, and she was a girl again. So that was a very short period of time, at least from what we're being told from other sources. But it just shows that, we don't know why and what causes this kind of change or dysphoria, and how long it takes to go through that, because this person was obviously already past puberty if she was 16. So why is this happening, and why does it go away even later?
Yes, thank you. Thank you.
Senators, any other questions for the witnesses? Thank you both for being here. Thanks for your testimony. We'll now open public testimony on Senate Bill 250 and on Senate Bill 1029, and so witnesses can testify on either or both. There's a lot of overlap in the testimony, and so the chair calls the following witnesses: Matt Long, Luke Macias, Dr. Jessica Zwiener, Dr. Kurt Peters, Dr. Ben Wilson. Again, the chair calls Matt Long, Luke Macias, Dr. Jessica Zwiener, Dr. Kurt Peters, Dr. Ben Wilson. And the chair calls Denise Seibert, Paul Hale, Pamela Woodshake, Dr. Cody Pike, and the chair calls Cindy Castilla. Chair calls Sarah Caffey. And the chair calls Sasha Butchert. Sasha Butchert. And the chair calls Tracy Shannon, Kevin Whitt. Tracy Shannon, Kevin Whitt. All right, welcome to each witness, and I think we've each testified before. We're on new bills, so introduce yourself and give us your testimony. Welcome. We'll start over here again, Mr. Witt.
My name is Kevin. Thank you for being here, Chairman. And I just want to say that I support this bill. I think that detransitioners should be afforded insurance, medical insurance, to treat their experience that they went through. You know, as I mentioned before, I experienced abuse as a child, physically, verbally, sexually. I was molested. I was also drugged and raped. And it's very hard for me to get up here and talk about the trauma that I experienced and that I went through. I don't have any way to pay for therapy now. So therefore, I don't get therapy. I've been diagnosed with borderline personality disorder, PTSD, upon a numerous of other things. And I'm up here speaking as a survivor of the gender medicine. And I feel like that it is very disingenuous for Menendez to try to verbally attack me and discredit me, especially whenever I am talking about my lived experience. This is not some other story. This is what I went through. And I just feel like that's horrible. And so that's all I can say, because it's hard for me to be here right now. Thank you.
Mr. Hale, welcome. Introduce yourself. Give us your testimony.
Yes, sir. Thank you, Senator Hughes, and thank you again, State Affairs Committee. Glad to be here. I am thankful that my mother and daddy was not transgender, or I wouldn't be here to testify for these bills. I'm for these bills. It is heartbreaking knowing these pharmaceutical companies and educated doctors turn into barbaric, bloodthirsty greed. They turn to that when we need a cure for cancer. And we can't get in to see doctors for weeks, months on certain issues because our hospitals are stocked up with other stuff. And, you know, we have the responsibility. It's what we got this Capitol for here, and it's what we got this beautiful building to meet in for. We have the responsibility to make law that is right in the sight of God, and we have the responsibility to make law against what is wrong. And God will hold us accountable for what we do, and in this case, what we don't do if we can't pass these bills. And I ask you to pass all these that's related, and thank y'all for hearing these two together. It gets us out of here a little quicker. But I want to tell you, I was born a man 58 years ago, and if anybody walks in here and tells you I'm a woman, they are a bald-faced liar, including me. If I tell y'all I'm a woman, I ain't nothing but a fraud, because I'm a man. I was born a man. If I grow dumb enough to get somebody to start chopping my body apart, then I'm still a man. I'm just a very screwed up one. And I'm not aiming that at anybody that's done that. I feel sorry for them. And we need sweeping laws against this stuff. We have transportation and water and education issues to look after, and we can't do it because we're here fooling with this. I ask you to pass Senator Hall's bills. They're well written. Thank y'all again for letting me be here.
As we continue, I'll say to each witness testifying before the committee, we understand these are difficult matters. These are personal matters to many people. If we're going to address members of the Senate, A member of the Senate has been duly elected and represents almost 1 million people, so we'll address them by their title because the title is important, as we're all part of the system and the system of government in Texas, just like the respect we show to everyone who comes into this chamber to testify. And welcome. Give us your testimony.
Hi, I'm Tracy Shannon, and I'm the Texas Director for Mass Resistance, and I'm supporting both of these bills. Public dollars should not be used to further transition of children because it makes the taxpayers complicit in an egregious crime against children. These procedures are not medically necessary, not evidence-based, and should not be covered by insurance at all. But when they are, the victims of these atrocities deserve to be afforded insurance to reverse any harm done to their bodies. Clinicians providing this care are following a trend in medicine and not practicing ethical care. These doctors have a responsibility to provide ethical care, to question studies, validity, and the methods of the studies. Liability insurance should not cover these procedures because it is medical recklessness to even do this to children. These doctors deserve to be in prison, but at the very least, we could stop providing liability insurance to protect them for what they're doing to these kids. Their victims deserve to be made whole. Thank you.
Thank you. And thank you for your testimony. Welcome. Introduce yourself and give us your testimony.
Thank you, Chair Hughes and members of the committee. I'll try not to duplicate the testimony from earlier, but
Oh, of course. And
Sasha Booker.
Get a little closer so we can hear you. Want to hear your testimony.
Sorry, can you hear me?
I got you.
Okay, Sasha Booker with Lambda Legal, and I am here in opposition of SB 250 and SB 1029. I'll try not to duplicate my comments from earlier, but I just want to remind the committee that this exact legislation was enacted into law 2 years ago in Arkansas, and a district court enjoined it from going into effect because of the science. The court weighed the science and said, no, this violates the constitutional protections of transgender people. It violates their right to equal protection. You clearly state in the bill language that you'll provide care for some people, but not for transgender people. That's a violation of the Equal Protection Clause, and that's how the court saw it. The Eighth Circuit agreed with them. It was appealed, and they agreed with them. Similarly, in Alabama, they had an evidentiary hearing that looked at the science, which you're doing today. And the court in that case also issued a preliminary injunction holding a law from going into effect while litigation proceeds for the very same reasons, because they looked at the science and said, no, this is rigorous. This is based on peer-reviewed evidence. And they also found, again, this is a preliminary injunction hearing, but they also found that it was likely a constitutional violation of parents' fundamental rights to provide their kids with the best care possible. Just a couple of other points I wanted to make that I wasn't able to make earlier is that I think that oftentimes with regard to care for gender dysphoria, it's treated with a double standard. For example, with regret rates, we've heard from folks that regret the treatment they've received, and I get that, and my heart goes out to them. I don't want anybody to suffer, but you should not treat treatment for gender dysphoria differently than you treat any other surgery, and regret rates are a part of medical practice. And as was mentioned earlier, the regret rate for people that have undergone gender dysphoria treatment is less than 1%. And I'm happy to give a cite. It's from an Amsterdam study from 1972 to 2015. So it's a very large study, and it's disingenuous to focus on that 1% and not the 99% that have been helped by accessing treatment. Thank you.
Thanks for your testimony. Welcome. Introduce yourself again. Give us your testimony.
Mr. Chairman, I have paper copies also of my testimony. I don't know who I should give those to.
Ms. Babb will get those from you and get those distributed.
Thank you, Mr. Chairman, and good evening. For those who weren't here earlier, my name is Dr. Cody Pike. I have a medical doctorate, a law degree, a master's in health law, and a master's in bioethics. I've also worked as a staffer on this very Senate floor. But more important than my credentials, I am a transgender Texan. I'm testifying against SB 1029 for 3 reasons. First, while the bill claims to be in favor of the public interest, that claim is not based in any real evidence or facts. Instead, the bill ignores mountains of medical evidence promoting gender-affirming care, and the bill further ignores legal precedent protecting the sanctity of the physician-patient relationship. SB 1029 is big government at its worst, with legislators telling doctors how to take care of their patients, and not just children, adult patients too. 2, this bill will seriously injure Texas's position as a leader in medicine. For nearly 20 years, medical professionals and industry have flocked to Texas, in part thanks to the 2003 tort reforms. I know, I practice med mal law. But this bill throws that tradition out the window by creating a strict liability cause of action against providers and insurance companies for the entire lifetime of the patients who receive gender-affirming care. SB 1029 will drive providers, insurers, and health-related businesses out of this prosperous state. And finally, this bill is blatantly discriminatory against transgender people, which the United States Supreme Court has recognized as a protected class under the U.S. Constitution's prohibition on sex discrimination. That was the Bostock versus Clayton County, written by Justice Gorsuch, a conservative justice. In addition to being morally contemptible, any financial savings this bill claims to generate will immediately be lost in a flood of civil rights litigation against the state, litigation which will be paid for by the Texan taxpayers. For these reasons, I ask you and this whole committee to vote no on SB 1029. Thank you. I am open to questions.
Thank you for your testimony. Senators, any questions for any of our witnesses? Senator Menendez, you're recognized.
Thank you very much, Mr. Chairman. Mr. Witt, when I originally, the first time I addressed you, I told you how sorry I was because I read and I heard you say you were physically, verbally, and sexually abused by your father and that you were drugged and raped by your best friend. I'm sure it wouldn't surprise you to know that many of us here, and I personally have experience with loved ones who've gone through similar things, and I can understand how hard it would be. My concern was that you had made a comment that when you went to see Miss Porter, that you saw her once, and that there was something written somewhere that said that every gender therapist nationwide, when you go, is required to tell you that you must have gender-affirming care. When you went to see Miss Porter, did you have insurance then?
Excuse me, did I what?
When you went to see Miss Porter, did you have insurance then?
No, she's a self-payment counselor.
Pardon me, I couldn't hear you.
She's a self-pay counselor. She doesn't take insurance.
She doesn't take self-pay, okay. And you said she still practices today?
Yes.
Here in Austin?
Oh, no, I'm not from Austin. I'm from Dallas.
Okay, in Dallas?
Yes.
Okay, thank you very much. Now, you said that you currently don't have health insurance and you can't get therapy. We'd be more than happy to help you. You said you don't have insurance and therefore you don't have access to therapy. We would be more than happy to help see if we could help find some therapy. But you're in Dallas?
Yes, I am.
Okay, and if you felt attacked, it wasn't that I was trying to attack you. I was just trying to get to the credibility of your testimony. That was what I was trying to get to.
Well, my testimony is 100% true. So I think whenever you try to attack a survivor's story, it's like you're trying to erase their lived experience. And so it was very traumatizing for me, actually. I've never had that happen before, and I've been testifying for 3 sessions.
I understand. Thank you very much. Thank you, Mr. Chairman.
Thank you, Senator. Senators, any other questions for our witnesses? Senator LaMantia, you're recognized.
My question for Dr. Pike. You brought up a concern I had as well regarding the 2003 tort reforms for doctors. Does this strict liability open up a window into and break down those protections for tort reforms?
Yes, ma'am. That is how I read the bill and understand the bill. It creates a strict liability cause of action. This is not just a insurance pay for their medical care that they need for detransitioning. This is the person who received gender-affirming care, if they later change their mind, decide to detransition, have issue with the doctor that provided that care, they can privately sue it as a civil cause of action against not just the provider, but also the insurance company that covered that care. And not only can they do that, but they can do it for the lifetime of the patient. Medical malpractice in Texas normally has a 2-year statute of limitations. If a surgeon cuts off the wrong leg on accident, you only have 2 years to sue that surgeon. But if you change your mind in your late 70s about something you did in your 20s, under this law, you could sue the insurance company that covered that care.
And that would apply even if you're an adult and fully consent?
Correct. This
that procedure and ask for it.
Senator Hall's bill 1029 is not restricted in age. And I think that harkens back to something we heard Senator Campbell say repeatedly. Just wait until they're adults. If that's truly the position of this august body, then why are we trying to tell adults they can't get the care now?
Thank you. Thank you, Mr. Chairman.
Thank you. Senators, any other questions? Very well. We thank each of our witnesses for being here. Thank you. You're excused.
Thank you.
The chair now calls Marion Spencer Morrison, Jake Wilson, Callie Butcher, Elisa Tamayo, John Tamba. Again, the chair calls Miriam Spencer Morrison, Jake Wilson, Callie Butcher, Elisa M. Tamayo, John Tamba. And the chair calls William Gossett. William Gossett. And the chair calls Theo Adams Hernandez. Theo Adams Hernandez. And the chair calls Jinx Delay. Jinx Delay. And the chair calls Martha Schultz. Martha Schultz. The chair calls Stephen Hotze. Is Dr. Hotze still here? All right, Dr. Hotze, come on down. Very good. Well, I think everyone's testified before, but we're on a new set of bills, so we'll start over here. You can introduce yourself. Give us your testimony.
We're doing 250.
Testimony is on both Senate Bill 250 and Senate Bill 1029. 250 and 1029, Senator Hall's bills. And welcome. Go ahead.
Hi, Marion Spencer Morrison again. Mr. Chair, Senators, I have concern with both of these bills. The first bill I have concern with is that removes the liability protection from the doctors. We've heard testimony throughout the day that there isn't enough research and science on the transgender health care, and my concern with the removal of the liability protections and the insurance for the doctors is that means that we will lose doctors who are willing to practice and gain further knowledge. Just in the years since some of the people in the audience have transitioned, there have been evolutions of this care. In fact, one of the people who spoke earlier mentioned about bone density testing. Do you know that my niece has to undergo bone density testing 3 times a year to make sure that her bone density is on par with children her age? So as with all other medical care, because I can guarantee you today that we are not treating heart patients the same way we were treating them in 1979. If your heart doctor is still treating you the exact same way that they were treating you in 1979 with evolutions in technology, medical advancement, then I think your doctor and you need to have a conversation. And just like this bill, I think you should have liability protections for terrible medical procedures for the rest of your life, for all of the things that doctors have done outside of just, if this bill passes, my fear is the medical profession, every session going forward, will be here for the cardiologists that have screwed up, for the cancer patients that have died. I think this is not the hill we need to start dying on. Thank you.
Thanks for your testimony. Welcome back. Introduce yourself. Give us your testimony.
My name is Jake Wilson. I am from Fort Worth, Texas, and I'm testifying my personal capacity in favor of Senate Bill 250 and Senate Bill 1029. I thank Senator Hall for bringing these bills up. And Chairman Hughes, I will just say, I will say this under oath, I greatly respect the work you're doing on many issues. As a courtesy to your time, I yield the balance of my time on these two bills.
Thank you very much. Listen, your testimony is important just like everybody else's. Thank you very much. We appreciate you being here. And Dr. Hotze, introduce yourself and give us your testimony.
I'm Dr. Stephen Hotze from Houston, Texas, CEO of Hotze Health and Wellness Center. Mr. Chairman, committee members, I'm supporting Senate Bill 1029 because it would allow individuals who were abused as children by physicians and by the transgender medical industry who perform transgender treatments and sex mutilation surgery to sue for malpractice. It would also prohibit the funding of these treatments by any governmental agency and by healthcare plans and Medicaid. I'm also in support of Senate Bill 250 because it will protect children from abuse by the transgender medical industry and its pedophile proponents who sexualize children in order to groom them to participate in their evil, perverted, immoral lifestyle. Senate Bill 250 would ban all transgender sex change drug and sex mutilation surgery. It would require the Texas Medical Board to revoke the license of any physician who participated in these treatments. It would also prohibit professional liability insurance policies from covering these transgender procedures. Now, senators, you all have a grave responsibility before God to protect the children. These pedophiles are now promoting transgender sex change and sex mutilation surgery. Jesus said, whoever causes one of these little ones who believes in me to sin, it would be better to have a heavy millstone wrapped around your neck and be drowned. Senators, you should lead the way in protecting and defending children from the perverted transgender pedophile movement. Thank you.
Introduce yourself, give us your testimony.
Buenas noches, good evening, Chairman Hughes, Vice Chair Paxton, and members of the committee. My name is Elisa Tamayo, Governmental Affairs Manager for El Paso County, today in opposition of SB 1029. Thank you for the opportunity to speak today on some of the concerns that we have with Senate Bill 1029. The bill defines several necessary procedures that protect the health of our employees as gender modification procedures or treatments and prevents public funds from being utilized for those procedures. However, public funds pay for the county's health insurance plan for our employees. When we contract for insurance coverage for our employees, we don't know whether any of these procedures being sought out by our employees is for gender modification or not. It's not clear to us whether our health plan could cover an emergency hysterectomy needed to save the life of the patient because it has been defined as a gender modification procedure or treatment. We also may not be able to cover orchiectomy if one of our employees finds out that they have testicular cancer because it is defined, again, as a gender modification procedure or treatment. We also may not be able to cover prophylactic mastectomies if our employees find out that they have a genetic predisposition to breast cancer. We want to be able to provide our employees with all the necessary treatments they need to live long, healthy lives and be productive Texans. This bill, as filed, would prevent us from doing that. Happy to answer any questions.
Thank you for your testimony. I can see you now. Introduce yourself. Give us your testimony. Go ahead.
Hi, my name is Callie Butcher. I'm from Dallas, and I'm the president of the Dallas LGBT Bar Association. I'm testifying in opposition to Senate Bill 250 and Senate Bill 1029. As with SB 14, SB 250 discriminates in care available to a child and a parent's ability to consent to that care based on the child's gender identity. This is an unconstitutional violation of the child and the parent's rights. On SB 1029, this would be an unprecedented under Texas law for the sweeping and near limitless liability it imposes. The clear implication from this bill is that it is designed to punish and dissuade physicians, hospitals, and insurance providers from providing evidence-based health care that is critical to the health and safety of transgender Texans, regardless of whether they are youth or adults. This would have devastating effects on transgender young people and adults. So both of these bills result in limiting access to health care by trans Texans and this will result in harm to Texans. I know. I came out as trans at 14 after struggling for years with how to tell my parents what I was feeling. My parents weren't supportive. They denied me that care. I was told it was a phase. I was sent to therapy to fix me or help me get over it. Spoiler alert, as with the vast majority of other trans-identifying youth, I did not outgrow it. As someone whose parents did not consent to me receiving gender-affirming care, I had to experience my puberty with the gender I was assigned at birth. That caused me significant physical and mental harm. I had to, my voice dropped. I had significant increase in body hair. My hips didn't widen. My shoulders did. All of this caused me significant anguish and recurring suicidal thoughts that did not go away until I started receiving gender-affirming care as an adult. Thank you.
Thank you for your testimony. Senator Menendez, you have a question? You're recognized.
Thank you, Mr. Chairman. So, all day, we've all been here listening patiently. Some of you have lived the difficulty that these bills are going to address or trying to address. It is, this can be difficult enough as it is to try to do in a very professional and respectful way. So, Dr. Hotze, I know you're a medical doctor and you're a professional. I would just ask you to refrain from calling people pedophiles, because I don't think the doctors who've come before us today are pedophiles. I think that
By definition, sir, by definition, they are pedophiles. Anybody that sexualizes children is a pedophile. The schools are full of pedophile teachers, so they sexualize these little children.
I'm not talking about schools right now. I'm talking about the medical doctors who are helping.
Dr. Hotze, let him ask. He hasn't asked a question yet.
Saying, Doctor,
he hasn't asked a question.
I understand. You're for the legislation. I get it. You have your reasons. But I get you have your feelings, but I don't think it's appropriate for you to call people you don't know whether they're pedophiles or not. Because what happened?
I do know.
No, sir, you don't. Because, and here's the thing that happens, Dr. Hotze. I have trans friends, I have trans staff members, I have trans members of my community, and what you do when you cause them, it's very hurtful to them.
That's what they are.
No, sir. They are not pedophiles. They are not perverts and pedophiles.
It means you do something out of the normal, out of the norm. If cutting off your penis, if taking female drugs for a man to turn yourself into a woman isn't a perversion, help me know what the word perversion means.
Dr. Hotze, they're living their true selves, doctor.
That's bullshit.
That's fine. That's fine, doctor. We have a...
Senator, Dr. Hotze, we don't use that kind of language. You're excused. Any other questions, senators? Very well. We're going to call the next panel of witnesses. The chair calls Carol Fedrick, Christopher Hamilton, Susanna Carranza, Jacqueline Murphy, Valerie DeBille. Again, the chair calls Carol Fedrick, Christopher Hamilton, Susanna Carranza, Jacqueline Murphy, Valerie DeBille. Chair calls Ash Hall, Chloe Goodman. There's Ash and Chloe Goodman. Almost here. The chair calls Jay Consiglia. Jay Consiglia. Welcome, introduce yourself, and give us your testimony.
Thank you, Chairman and Senators. Senator Menendez, thank you for calling out hateful rhetoric. It is harming our community, and it is resulting in extremism that has resulted in violence and threatened violence against healthcare professionals in our country. Hello, my name is Christopher Hamilton. I'm the Chief Executive Officer of Texas Health Action, a community-informed nonprofit dedicated to providing healthcare in a safe and supportive environment with clinics in Austin, San Antonio, and Dallas. I'm here to speak against Senate Bill 250 and 1029. These bills send a clear message to physicians and other healthcare professionals. The legislature does not trust their training, expertise, or ability to practice medicine. Senate Bill 1029 is a stealthy attempt to chill healthcare for all trans people without a direct ban. Senate Bill 1029 imposes upon physicians an unlimited lifetime personal financial liability. No healthcare provider will then want to provide medical care for trans people. The result is that trans people in Texas will be unable to access healthcare in this state, a state with an estimated 92,000 transgender people who reside here. Additionally, there are some seeming inconsistencies to remove coverage from some insurance plans through public money, but expand liabilities for other insurers. These bills are designed to threaten doctors and insurers and put them in complicated situations, knowing there will be medical issues that do not fit into this bill and it will cause harms. We cannot afford to turn away healthcare professionals from this state by legislating against best practice medical care and telling parents they don't know what is right for their children. Thank you.
Thank you for your testimony. Welcome, introduce yourself, and give us your testimony.
I'm Jay Consiglia. I am here representing myself. I'm a disability advocate for a living, but I'm not with my organization tonight. But a function of my job is reading all the bills that have been filed since November till Friday of last week. And, you know, since November, I've been seeing more and more of these bills that, you know, attack me, people like me. I'm a trans person in Texas. And it feels like a systemic attack on trans lives, on my life, and it's done more damage to my psyche than my trans self-awareness ever has. SB 1029 is as clever as it is cruel. It doesn't make gender-affirming care explicitly illegal, but it frames it in a way where it basically is saying, let's make doctors and insurance companies so terrified of providing this care due to liabilities and damage that they just won't. It also says, let's have the bill's language frame this as a public spending issue. While it strips state employees and adults and children on Medicaid access to this care. SB 1029 will make my life measurably worse, as well as I have a number of friends that work for the state that are trans. They won't be able to access care if this passes. And I serve Medicaid recipients, many of whom are trans, who will now not be able to access this care should this pass. So my suffering, my friends' suffering, is not an uncertain future. So I'm asking that this bill go no further. Thank you.
Thanks for your testimony. Welcome back. Introduce yourself. Give us your testimony.
There we go. All right. Hi, Ash Hall with the ACLU of Texas, also representing myself against both bills. Interesting that we're having to testify on both of them at once because I find them to be pretty different from each other. But what they do have in common, right, is that they are designed to create a chilling effect so that healthcare providers will not want to help transgender people or anyone who may be experiencing gender dysphoria. And I actually slightly disagree lovingly with my friend next to me here in that I don't think that's clever at all, actually. It's a very old tactic that when a angry group of people wants to target a vulnerable group of people that is being protected by other people, one of the ways that they will try to isolate that group is by attacking the people who would help them. And so in this case, we're attacking healthcare providers and making it really dangerous to do the right thing by the transgender community. But I've seen some of the same people that author bills like this or push for bills like this do the same thing around access to reproductive health care and even around people who want to help folks get registered to vote. So frankly, I don't find it clever at all. It's actually kind of annoying and a bit of a bore. Moving on past that, obviously this healthcare is life-saving healthcare. It's wild to me that we had such a long conversation this whole day about how it's so important that we need to protect children from this, and now we have a bill that would make it a lot harder to access healthcare for trans people who are my age. So clearly, again, consent wasn't really the reason we were doing this either. Again, I don't think we're trying to protect anybody. I am convinced that we are simply going after transgender people when the fact is there is no bill in the world that will make us go away. We are going to continue to fight and live and take care of each other. Thank you.
Thanks for your testimony. Dr. Carranza, welcome back. Introduce yourself. Give us your testimony.
Hi, I'm Dr. Susana Carranza. I'm here on my own behalf. I'm testifying against both bills. And I'm here in part because a close friend of mine just couldn't stick around. Like, her son is trans, and she just like, I just cannot take this anymore. So I decided that it was my duty to be here and be her voice. I'm not speaking on her behalf, but I'm speaking because of her. I was also very, very sad that a doctor earlier tried to imply a correlation between abuse and being a transgender, like saying that somehow being abused leads you to be a transgender, which is bogus. This further stigmatizes the community. This bill also puts doctors in a horrible position that they have to decide between care for the community, do their job, and lose their license or losing their ability to function because they're going to be sued forever. This not only will deny the entire trans community the care they need, this may end up leaving Texas without doctors, because what doctor in their right mind would want to practice in a state that does this kind of bill and many other bills that essentially prevents them from doing their jobs? Like, why? I wouldn't. Because, I mean, I'm a doctor, but I'm an engineer, thankfully, because I don't think I would have the stomach for this. Many of the testimonies today pick a few of the worst cases of regret and potential, having had a bad experience with a bad doctor, and extrapolates to the entire community. I know a lot of people here keep saying, bad apples, and don't use the bad apples to judge the entire profession. Well, you're doing that, so.
Thanks for your testimony. Welcome back. Introduce yourself. Give us your testimony.
Hello once again. I am Jacqueline Murphy, and for the third time in front of this committee, I am a 22-year-old Austinite representing myself as a trans woman who received gender-affirming care as a minor, and I'm continuing that care today. While detransitioners, rare as they are, should absolutely receive medical care, this bill abandons all flimsy pretense of safeguarding children, instead targeting the insurance coverage of adults and liability coverage of the doctors who provide care for them. I think the arc of history bending towards progress is a comforting idea, but I'm under no illusion about the state of things. If today's bills are put into law, life for trans Texans will become incredibly difficult. I understand that this is the goal. At best, we are pawns in a political plot. At worst, bugs to be squashed. To my trans siblings, as these laws attempt to drive you from the state, I am begging you to live, if only because living is a spit in the face to those that want you gone, even if that life cannot be in the great state of Texas. To this committee, your ideas of personal freedom, medical self-determination, and limited government fall apart when you see an opportunity to target a vulnerable group of people for political gain. There are roughly 100,000 transgender Texans. There are millions more who are friends, family, or co-workers to transgender Texans. You are gambling with the future of conservative philosophy, hoping that the persecution of an outgroup will rally enough bigots to continue your dying, self-serving ideology. If these bills pass, Texas will see the pain your decisions here today inflict, and with any hope, it will begin to hate you as you hate us. I hope everyone involved in the creation of this bill lives a long and healthy life so that you may see your descendants grow to despise you. Thank you.
Senators, any questions for the witnesses? Very well. We'll call up the next panel. You're excused. Chair calls Johanna Sugg. Johanna Sugg. And Johanna is the last witness we have registered on this bill. Come on now. Very good. All right, introduce yourself again. Give us your testimony.
Yep. Hello again. Thank you, Chair and members of the committee. My name is Chloe Goodman. I am the Constituent Services Manager for Equality Texas and LMSW, have another master's in public affairs. And I think it's clear, based on a lot of the testimony and back and forth from tonight, that the authors and proponents of this bill don't understand the trans experience. But the thing is, you don't have to understand trans people. You don't have to wrap your mind around where gender dysphoria comes from. We don't even have to agree. I don't have to justify myself based on the tenets of your religion, and you don't have to live according to my values. That's the beauty of a separation of church and state. However, you do have to respect the dignity, autonomy, and inherent value of each and every person. Luckily for me, that is written into my code of ethics under the NASW. But look at the supporters of this bill. Do you want to be associated with hate speech like that of Dr. I don't remember his name? Because that's what these bills accomplish. They fuel hate speech, and it turns into violence. And I would like to share a voicemail, actually, that Equality Texas received last November, and I will note it was after pre-filing started.
Let's just, you can offer your testimony. We don't, but not exhibits like that. You can share your testimony.
Okay,
That's fine.
I will read the auto-generated transcript and substitute cursing.
Thank you for your testimony. Your time's expired.
Okay.
Welcome. Introduce yourself. Give us your testimony.
My name is Joanna Sugg. I am a trans woman representing myself, and I would like to yield a little bit of my time so you can share.
No, sir, that's not how it works. You have 2 minutes
Oh,
to testify.
only 2 minutes? Okay. All right, so... Hey, how about you? Go suck yourself, a bunch of fucking faggot, fucking woke terrorists.
You are excused.
Keep all your fucking transgender shit out of these schools, out of the state of Texas. These are the people who are pushing for these bills.
You're excused.
That's what this inspires. Thank you. I will stay in case anyone has questions.
You're excused.
Oh, I am. Okay. Thank you.
That's all the witnesses we have registered on Senate Bill 250 and Senate Bill 1029. Public testimony is closed. Bills remain pending at this time. The chair now lays out Senate Bill 1269. 1269. Senators, this has to do with another sensitive topic, the termination of parental rights. It's been deemed the death penalty of civil cases. Fundamental rights of parents, of course, have to be protected as much as possible when the stakes of permanently losing their children are so high. It's a balance that has to be maintained in these cases where the protection of children is so important, as are the rights of the parents. And it's a difficult balance that has to be struck in public policy. Senate Bill 1269 adds protections for statements that a parent makes during the course of voluntary or court-ordered substance abuse evaluations and treatment, psychological exams or therapy, and counseling sessions. This is necessary because often a parent will refrain from divulging information that's necessary for treatment out of fear of a statement being used against them and ultimately losing the child. The department often requires parents to admit wrongdoing, which causes a severe conflict and interferes with the parent's constitutional rights and the goal, of course, of real treatment. Senate Bill 1269 also prevents the statement of a confidential reporter from being admitted into evidence unless the statement can be independently corroborated by another source. Out-of-court statements that can't be corroborated or hearsay and highly prejudicial against the parent without any other evidence to back them up. And finally, the bill prevents evidence from being admitted at a hearing or trial unless it's admitted in compliance with the evidence rules under the Code of Criminal Procedure. For instance, in a criminal case, the results of drug tests are not admissible against the accused unless there's a sponsoring witness or the defense does not object. Same rules and protection should apply in termination cases where the state's a party, and again, the stakes are so high. That's what the bill does, and I'll yield for questions. No, thanks, Senator. We'll open testimony. The chair calls Julia Hatcher. Julia Hatcher testifying for Senate Bill 1269. Welcome. Good evening.
Chairman Hughes, members of the committee, thank you so much for staying late to hear this testimony. My name is Julia Hatcher. I'm an attorney in Galveston, and I'm also the president of the Texas Association of Family Defense Attorneys. We're a statewide organization of lawyers who represent parents and children in CPS cases, and we support this bill. Thank you so much, Chairman Hughes, for carrying this bill, because we think that due process is lacking in regards to the admissibility of evidence in cases involving the Department of Family and Protective Services when it comes to terminating parental rights. CPS cases are all too often coupled with criminal cases. CPS cases are all too often head down on a path of termination of parental rights. The Texas Supreme Court, as you said, has said that termination is a death penalty of civil cases. We now have multidisciplinary teams that meet weekly all across the state and involve law enforcement, CPS caseworkers, investigators, district and county attorneys, and they all exchange evidence with each other. This is why application of Chapter 38 of the Code of Criminal Procedure is so necessary. With the looser rules in CPS cases in regards to the admissibility of evidence, the state has the unfair advantage when seeking to terminate parental rights. The Supreme Court has stated that parental rights are fundamental and should be jealously guarded. Further, not applying the criminal standards in CPS cases when it is used for those cases to be, it's usual for those cases to be pursued in tandem with criminal charges or to result in criminal charges, allows the state to circumvent its duties and obligations. Currently, the state can use the looser rules in CPS cases to get evidence, which is then shared with law enforcement and used to get convictions in criminal cases. This should not be allowed. The next two sections of the bill address statements made by parents during the course of treatment for substance abuse or mental health disorders. And these sections are necessary because parents are required to participate in these services in order to redress the reasons for removal of their children or the abuse or neglect that was alleged to have occurred in the home. The department generally wants parents to admit wrongdoing as part of their treatment. I actually had a case once where the caseworker told us that the therapist wanted my client, who was a mother of 3 children, to write an apology letter to her children, admit everything that they said that she did wrong as a part of her therapy, and if she wasn't willing to do that, then she would be non-compliant with her therapy, she would be unsuccessfully discharged from therapy, and then her parental rights could be terminated under Ground O, which says you can be terminated for not completing all your services. Of course, that didn't sit well with me, so I had to file a motion and go to the court and get the court to order that my client did not need to do that. But that's not really something that we should have to do. And so the sections, the 2 sections of the bill would address that and keep those statements, if they need to be part of therapy, from being admitted into evidence, and also would allow the parents to be more feel more freely, like they can talk more, and that what they say isn't going to be used against them. Also, parents who haven't done anything wrong, which is often the case, wouldn't be forced into saying something that they hadn't done just to comply with their treatment. I know some of you heard from Ashley Pardo yesterday from the Pardo case, and she actually had a family service plan where the therapist wanted her to admit that she did all these wrong things they accused her of, and of course we all know that she was exonerated. So our courts, actually, our appellate courts have held numerous times that parents are faced with making a choice between protecting their constitutional rights to raise their children and their Fifth Amendment right not to incriminate themselves. That's really abominable. A parent should not have to make that choice. Most parents would rather go to jail than lose their children, and I think that anyone in this room could agree to that. But no one should have to make that choice. DFPS should not be able to get the evidence to try to prove their case by threatening parents to make incriminating statements and then using their statements against them. We want parents to be rehabilitated. We want families to be reunified. That's why we exist. Can I finish?
Okay. Wrap up that thought, thanks.
I'm sorry?
Sure, finish that thought, thanks.
Okay. Prohibiting their statements from being used against them if made while in a course of treatment would enable parents to be more open so that they can actually be successfully treated.
Thank you for your testimony. Senators, any questions for the witness? Senator Middleton, you're recognized.
Thank you for bearing with us here tonight.
Well, thank you.
Important bill. So really, this is a due process issue, right?
Yes, it's absolutely due process.
That's what it comes down to, because this is court-ordered treatments, right?
Correct.
And they have to make, parents in some cases are having to make a decision, right, between really being able to rehabilitate themselves and be open and honest with their court-ordered treatment and their rights as parents.
Correct. That's correct. And getting back to Chapter 38 on that notion, as y'all know, in a criminal case, if you plead the Fifth, it can't be held against you.
Right.
That's ingrained in our brains. But in civil cases, which is CPS is a civil case, if you plead the Fifth, it can be held against you, and it is. And day after day after day, judges say, you can plead the Fifth, you don't have to say anything, but then I'm going to assume it's true. And that would go to the Chapter 38 provision that's in the bill.
Thank you.
Mm-hmm.
Thank you. Senators, any other questions for the witness? Thanks for your testimony. Thanks for staying up with us. We'll open public testimony, and Chair calls Cecilia Wood, Sean Hall Lacona, Miriam Spencer Morrison, Melissa Munoz. Again, the Chair calls Cecilia Wood, Sean Hall Lacona, Miriam Spencer Morrison, Melissa Munoz. Ms. Wood, welcome. Introduce yourself. Give us your testimony.
Thank you, Chairman. Good evening again. My name is Cecilia Wood. I'm here on this bill for Family Freedom Project as well, which is a group devoted to protecting parental rights and is significantly involved both at the trial and the appellate level in helping parents make sure that they are able to maintain their not only their relationship, but that their cases are handled in a constitutional manner. I'm also here on behalf of myself as a board-certified attorney. The most important part in my mind, although all this bill is wonderful, is the part regarding the mental health and the services and the parenting plans. In 37 years of practice, I have never had a case, regardless of what the allegations were, that did not require a parent to be in therapy, did not require a parent to have a psychological evaluation, and did not require a parent to take parenting classes, even if they had older children or whatever. It's kind of the thing they do. And the goal is supposed to be, under the law, of reunifying the family. That's supposed to be the primary goal. So many times you have an anonymous report, and there isn't something that happened, but someone showed up to their 10-day hearing. They didn't know how to represent themselves, and now they're in the system. But if there is a problem, and sometimes that is the case, what we want to do, we know, our law tells us this, and we know that the best place for children, if they can be with their parents safely, is to be with their parents. We don't have enough foster homes. Not every child gets adopted. And just recently, this body has I call it the Recycling the Parents group. If nobody has adopted your kids, nobody wants your kids, and you get your act back together, you can actually go back in and petition. So hopefully parents will be able to use these services more effectively with this bill. Thank you.
And thanks for your testimony. Ms. Connor, go ahead and introduce yourself. Give us your testimony. Welcome.
Thank you. Can you hear me?
Get a little closer to the microphone.
Okay. My name is Sean A. Hall Aquona. I'm here on behalf of myself, my family, my law practice, my ministry, our church, and every other human being on the planet. In Ancient of Days, I stand knowing He is the God in whom we trust. For SB 1269. Thank you, Chairman Hughes and the State Affairs Committee, and to you, Senator Middleton. Be in peace, joying. I shall boast in Him with the time I have, this committee getting understanding as to why. Dear Lord God Almighty, even though the government owes a great debt, I shall praise you, decreeing what you desire for your order. Light as loving kindness, always revealed easily in plain sight, having confidence in the day of judgment, having walked in your truth. You said, don't be afraid, little flock, for it is your Father's good pleasure to give you the kingdom. Thankfully, Supreme Judge of the world, for the rectitude of our intentions, you know the perfect law of Christ Jesus. 100 years ago, you sent grandfather south to work on a thrashing machine that started in Texas and followed the wheat harvest to North Dakota and up into Canada. He left home to find peaceable enjoyment, doing work in the general welfare, secured in the blessings of liberty to your posterity, having received what you ordained and established in this Constitution for the United States of America. Lo, victoriously in case number 18069 and 18869, worshiping you in spirit and in truth, the greater one and I, to do you will, O God the Father, sovereignty accorded, swearing by yourself the harvest goal reached, accomplished. Glorifying you, standing forever in our blood covenant, you fulfilled covenant of peace, freely upholding us as one so that our will be done just as promised. Amen. For where your treasure is, there will your heart be also.
Thanks for your testimony. Welcome. Introduce yourself. Give us your testimony.
Hello, my name is Melissa Munoz. I'm an attorney from San Antonio, Texas. I'm also a member of the Texas Association of Family Defense Attorneys. I'm here to testify in support of Senate Bill 1263. Specifically, I'd like to comment on proposed section 104.105, which would exclude from presentation as evidence the anonymous reporters or the undisclosed reporters' comments made to the CPS hotline. These comments are often included in the affidavits that are submitted to the court with the petition to terminate the parents' rights and the petition for emergency removal of the children. This hearing happens without any notice to the parents, without any copy of the pleadings, without any opportunity for the parents to participate. Yet these reporters' statements are uncorroborated, and these uncorroborated statements are offered in support of emergency removal. The children are then removed, an experience that is extremely traumatizing to any child, even if removal is justified. And the parents, 2 weeks later, while the children stay in a shelter, have an opportunity to refute the testimony. The testimony is again presented at the adversary hearing. The testimony that is inadmissible hearsay. It is a statement made by parties who are not presented in court. It is a statement these are statements that are not corroborated by the investigator's investigation, and they're simply made to bolster the investigator's representations to the court. The court hears this evidence again, and this evidence from the reporter that cannot be cross-examined becomes the theme of the entire case. This information is provided to counselors as the reason why these parents need counseling. Thank you.
Oh, Senator Menendez.
Thank you, Mr. Chairman. Ms. Munoz, I was under the impression that we changed the law. Representative Frank passed a bill that created a higher burden for removal of children, that they had to be in immediate danger. The language itself was changed, and then the number of cases that were brought before the DA's office for immediate removal dropped like in half.
In order to present evidence that supports the argument that the children are in immediate danger, the reporter's uncorroborated statements are presented to the court to support that representation. The burden of proof at that first hearing is very low. The hearing at which the parents get to participate, it's just a reasonable person standard, which means that if a reasonable person would be worried, then the court is going to order that CPS have temporary custody of the children while the parents work services. And this can continue for a year, waiting for the parents to complete all of their services.
I'm just a little surprised. I think I feel like I'm supportive of the legislation, but I'm surprised by the testimony because I recall that I was listening to the county tell me that the number of cases brought before them for removals had dropped in half. And so
that's not my experience, but I can only testify as to the number of cases that are referred to me. And the last few years, it's difficult to tell the size of the docket.
Right. Very good. Thank you, Mr. Chairman. Thank you, Ms. Munoz.
Thanks, Senator Menendez. And welcome back. Introduce yourself. Give us your testimony.
Hi, Marian Spencer Morrison. I applaud this bill, but I have some concerns with this particular legislation when it's coupled with Senate Bill 885 that we heard earlier today, because I guess my concern is when we're looking at terminating parental rights, which is awful, we're looking for a standard or burden of complete innocence for the parents. And I'm glad that the parents are going through therapy, and I'm glad that they have plans for parenting plans, and I think that is great. My concern is, I guess I'm a little confused as to whether or not the bill that requires complete exoneration would affect this legislation. And so that's why I'm trying to listen a little more as well.
Senators, any questions of the witnesses? Thank you very much for being here. Thank you for your testimony. That's all the testimony we have registered on this bill. Is anyone present wishing to testify? on, for, or against Senate Bill 1269? Seeing and hearing none, public testimony is closed, and the bill will be left pending at this time. Members, we have one more bill on the agenda for the evening, and Senator Perry, due to weather, had to head back toward Lubbock and asked us to lay this out on his behalf. So the chair lays out Senate Bill 162. Senate Bill 162. Members, the current rule at the Department of State Health Services, where, of course, vital statistics and important records are maintained, their current rule requires the birth certificates to include sex if it's known. The process to amend the sex listed on the birth certificate in Texas requires a court order, but the law does not specify what's required to be submitted to a judge, and it's up to broad discretion of a judge to decide what documents are required. There's really no standard for that in statute. This bill would require by statute that birth certificates list the biological sex of the newborn. If it's determined by the physician that the child was born intersex, the sex does not have to be listed at that time. SB 162 prohibits the sex listed on the birth certificate of a minor from being amended unless the change is to correct a clerical error or to complete the birth certificate if the sex was not listed or if the child is intersex at the time and sex is later determined. That's what the bill does, and I'll yield for questions on behalf of Senator Perry. Very well. We'll open up testimony on this bill. The chair calls Michelle Evans, Luke Macias, Jonathan Covey, Denise Seibert, Paul Hale. The chair calls Sasha Butchard. Sasha Butchard. And the chair calls Mary Elizabeth Castle. Mary Elizabeth Castle. And the chair calls Tracy Shannon. Tracy Shannon, all right. Well, Ms. Shannon's on the way. We'll go ahead and get started. So if you're ready, you go first, and then we'll come back to her. Introduce yourself again. Give us your testimony. Welcome.
Good evening. My name is Michelle Evans. I'm representing myself in favor of SB 162. At a minimum, it is expected that elected officials govern based upon a foundation of truth and fairness. Allowing natal males to change government documentation based on an identity or feeling risks not only the safety and dignity of women and girls, but the future of what it means to be and live as a female. Birth certificates help determine who can occupy spaces that are intended to be sex segregated, from domestic violence shelters to prisons to bathrooms. They inform history and ancestry, and in that regard, the ability to change one's birth certificate or have a death certificate reflect an identity rather than a sex will change our understanding of motherhood. I know that my experience as a female is formed in large part by women's history as a whole, which is influenced by female biology. That is as inevitable as it is unique. Much of my own personal and professional life has been shaped by my physical abilities and disadvantages as compared to males. Everything from my perception of self-worth as a teenage girl to having been drugged at a bar as a young woman to my 3 bouts of bed rest during pregnancies to the death threats I've received in response to me speaking out about this issue. These have all been rooted in my sexed body. This is not a costume I can remove. It's not something I can erase by declaring myself a man. I am not a cis woman. I am a woman. That is not my truth. That is the truth. And no amount of misogyny disguised in a dress can change that. Indeed, this legislative session, lawmakers will be debating the tampon tax, period poverty, and expanding Medicaid to 12 months postpartum. In discussing these issues, we cannot avoid acknowledging that they impact women specifically and exclusively. To pretend otherwise is disingenuous, disrespectful, and lacking in self-awareness. To allow others to pretend otherwise would be perpetuating a lie, commodifying biology, and denying the distinctive history of womanhood. Please pass SB 162 to maintain the longstanding recognition of truth and material reality. Thank you.
Thanks for your testimony. Welcome back, Ms. Castle. Go introduce yourself. Give us your testimony.
Good evening, Chairman Hughes and members of the committee. My name is Mary Elizabeth Castle, and I'm Director of Government Relations for Texas Values. I am supportive of this bill for several reasons. Having the correct sex on your driver's license and other government documents can be very beneficial. It could help you in having correct information for a passport, getting accurate medical care if something were to happen to you, and even being able to locate a person who's a victim of a crime. But the main reason why I'm coming to testify in favor of this bill is because I know Senator Perry's intent, which is to help it be an assistance to a law we passed in last session, which is the bill protecting K through 12 sports, which requires UIL to reference the sex on a birth certificate. If we were able to allow people to change their sex on their birth certificate, then it could undermine current laws that we have to actually protect biological sex. And so I'm supportive of this bill in that it will be an assistance definitely to our Save Girls Sports bill that was passed last session. Thank you.
Thank you for your testimony. Ms. Covey, welcome back. Go ahead.
Thank you, Mr. Chairman. Jonathan Covey, Policy Director for Texas Values, testifying in favor of SB 162. We also appreciate Senator Perry bringing this bill. We think it's a common sense bill. It's vitally important to know a person's sex at birth. As others have mentioned, it's particularly important in light of fairness in women's sports competitions. It's a priority for us as an organization where girls and women compete for unique opportunities and scholarships, and where men wanting to compete in women's sports refer to birth certificates that were amended years later to reflect the sex to allow them to compete. So it's almost too obvious to state that purpose of a birth certificate is to establish a record of biological birth and certain relevant factual details on that occasion as a means of identification. To change a designation on a birth certificate puts fair competition in danger. It also effectively allows falsification of the document. So we'd ask you to support this bill.
Thank you for your testimony. Mr. Hale, welcome back. Introduce yourself. Give us your testimony.
Yes, sir. Paul Hale from Queen City, Texas. And thank you all again for letting me testify, not only on this bill, but all of them. Like I said, I love this committee, and thank you all for putting up with all of us. Thank all of you for that. I want to just go to the supporting document that I turned in, and it's just simply a page, the very first page of the Bible, very first page of Genesis. It says, "So God created man in his own image. In the image of God created he him. Male and female created he them." And the scripture goes on after that and says, "Be fruitful and multiply." And they've covered that thing about the sports, so I won't go over that. But there's another concern that I have. There seems to be such a driving motivation from the far left on this transgender issue. I think, they were talking about changing the birth certificate at a later time. My concern is that we'll see doctors changing that at birth, right at birth, as part of this agenda that I'm really baffled by. And once again, this is fraud. This is absolute fraud. And I was raised in a household, I was taught not to lie. And of course, I was a kid, I did every now and then, but got disciplined for it. But a lie is fraud, and we need a penalty for fraud, especially when something like this is done. This is our kids we're talking about, and in this women's sports, this is a no-brainer. I cannot stand to turn on my TV and see a man dressed up like a woman over there, putting all those girls to shame. The Bible tells us the man is the stronger sex. And, well, y'all know the rest of this story. Y'all have done a good job, and I appreciate y'all from the bottom of my heart. And y'all got a good committee here.
Thanks for your testimony. And welcome back. We want to give you plenty of time to get here. Go ahead and introduce yourself again. Give us your testimony.
Thank you. My name is Tracy Shannon, and I'm the State Director for Mass Resistance. My pronouns are biological sex is real. When it comes to vital records, historical documents, and medical documents, The truth should be reflected, not a lie. The state should not come into agreement with a lie, because to do so threatens liberty and justice. We cannot have liberty and justice if we are not tethered to the truth. Does Texas know what a woman is? I would have to say no. As a trans widow, I can speak firsthand to this fact. A court order was written for my husband for his documents to be changed to reflect that he was a woman while I was still married to him in the state of Texas, compelling me to call him by female pronouns in his new female name, making me a paper lesbian on our divorce documents. This is a travesty, and it adds insult to injury. I married a man, and I was forced to divorce a fake woman. The state should not come into agreement with a lie. We need to start correcting this, and this bill is a good first step. Thank you. I support the bill.
Thank you for your testimony. Senators, any questions for the witnesses? Thank you each for being here. The chair now calls Kevin Witt, Miriam Spencer Morrison, Jake Wilson, Jacqueline Murphy, Valerie DeBille, John Tomba, William Gossett. The chair calls Jacqueline Murphy, Valerie DeBille, Ash Hall, Jinx Delay, Chloe Goodman, Very good. Welcome back. We'll begin over here again and introduce yourself again. Give us your testimony.
Miriam Spencer Morrison.
And get a little closer to the microphone so we can hear you.
Sorry. Miriam Spencer Morrison from Hood County. I'm here to speak against this particular bill because after all of the hurtful, hateful, and harmful things that all of these bills today will do, this one hurts the most. The reason it hurts the most is because right now, my niece can get a court order to change her birth certificate so that she can take that birth certificate, get a passport, get her driver's license, get all the documents she needs so that she can have her name match on all of her government documents. And that's important because the name on all your government documents is the name that your school has to call you. And if you can't change that to match you, you're forever tied to a name that is dead to you. And I'm sorry for all the people who've been hurt by the doctors that weren't hearing their pain. But to prohibit people the ability to make this change because clearly they're going to have to probably leave the state is unfortunate.
Thank you for your testimony. Welcome back. Introduce yourself again. Give us your testimony.
Thank you, Chair Hughes, members of the committee. My name is Sasha Bookert, and I'm with Lambda Legal, and speaking on behalf of Lambda Legal myself, and I'm here in opposition to SB 162. The birth certificates are a foundational document, and as was just mentioned, they're needed to fully participate in society. You need it for housing, you need it for education, you need it for employment, you need it for a passport. It's just a critical document. And when people have identity documents, especially trans folks, that are inconsistent with who they are, it places them at great risk. It places them at risk of violence, bullying, and even harassment. There was a survey that was mentioned earlier called the National Transgender Equality Survey that surveyed over 15,000 people, and a third of them reported experiencing harassment and bullying because their ID didn't match who they are, even at the voting booth. And this is especially concerning given the fact that Texas has one of the highest rate of violence targeting transgender folks, in particular trans women of color. And we've litigated case after case after case with these kinds of restrictions, telling the courts that, these kinds of restrictions violate equal protection principles by refusing to give identity documents to some people, but allowing others to get them, and that it infringes on their right to privacy. You force them to present an identification document that identifies as transgender, and it violates their free speech rights. You're compelling them to carry a message that isn't who they are. So it's just out of step, and with the vast majority of jurisdictions around the country who allow people to, youth and everyone else, to obtain identity documents that accurately reflect who they are. And I urge you to vote down this bill. Thank you.
Thank you for your testimony. Welcome back. Introduce yourself again. Give us your testimony.
Hi, I'm Jacqueline Murphy again, and I'm here representing myself as a trans woman again, this time as a trans woman who had the gender listed on my birth certificate changed from male to female as a minor. Having this change made before the age of 18 made it easier to acquire identification, college enrollment, and ultimately employment as a woman. The benefits for my peace of mind and physical safety cannot be overstated. However, I expect the intent of this bill is entirely divorced from the ability to change the listed gender of a minor's birth certificate. I expect the aim of this bill is to undermine the legitimacy of trans identity as a whole, particularly among children. I understand that the people supporting this bill do not consider me a woman, and I will not legitimize their desire to debate by defending my ability, now and when I was a minor, to know as such. I live my life as a woman. I love, learn, work as a woman, now and back when I had my birth certificate changed. And as much as you might want it to be so, that cannot be taken away from me. Regardless of your justifications, legislating something as minor and reversible as a single letter on a piece of paper is nothing short of malicious. It is indicative of a vapid and empty philosophy that worships power. There are no physical side effects. There are no spaces being accessed. There are no irreversible social repercussions. This is a drop of ink on a document. There is no justification that stands up to scrutiny. This is a power play aimed at making the lives of transgender children as difficult as possible. I hope attempting to dismantle every aspect of trans life, no matter how unobtrusive it is worth it to you. Despite your best efforts, as long as I am here, there will be at least one trans kid in Texas. Be'ezrat Hashem, I know I am not alone. Thank you.
Thank you for your testimony. Senators, any questions for the witnesses? Senator Menendez.
Just one. You said something that was very, the imagery struck me, the drop of ink. It may, you're right, on a piece of paper, just a little bit of ink, but that ink, if this bill passes, will deny you who you are, won't it?
That's correct.
Thank you. Thank you, Mr. Chairman.
Thank you. Thank each of the witnesses for your testimony. Is there anyone else present wishing to testify on, for, or against Senate Bill 162? Thank you. Thank you. We got yours. Thank you. All right. Please have a seat. Our last two witnesses on Senate Bill 162. Welcome back. Introduce yourself. Give us your testimony.
Yeah, hi. Ash Hall, representing myself and the ACLU of Texas against the bill. this bill is aimed at making, again, transgender and especially non-binary people like myself completely invisible. As it is, it kind of sucks that we don't really have a gender marker option for a number of different ID documents, so I don't get to see myself reflected in that way anyway. I know that's got to be pretty unfortunate and sad, frankly, for younger members of our community, and I want better for them than what I've had. So that's part of what comes to mind when I think about this. The other thing, though, is like, it's weird that it acknowledges that intersex people exist, but then says that they have to pick male or female when you literally just said that they're intersex. It doesn't really make sense to say, like, we know that this is who you are, but you need to pick one of these options. That doesn't tend to go over very well, especially when you're looking at litigation. Which brings me to the other point, which is that this is pretty unconstitutional. I'm not a lawyer, but it's strikingly obvious to me, and I imagine somebody would sue over this very quickly, ranging from the freedom of speech to freedom of expression to equal protections aspects of this bill. But more than anything, youth don't need to be told who they are by adults that don't even know them, and that's really what this bill comes down to. This is an attempt by lawmakers and other folks to tell youth who they can and cannot be, and the fact is, you don't have any business doing that. Kids know exactly who they are, and they're going to tell us. Thanks.
Thanks for your testimony. Welcome back. Introduce yourself. Give us your testimony.
Yeah, hello again. Thank you, Chairman Hughes and members of the committee. My name is Chloe Goodman. I'm here representing myself in Equality Texas in opposition to this bill, in part because it fuels hatred and violence against our community. And I have the transcript in front of me since you do not want to hear the recording, understandable. I have bleeped and substituted where needed. So we received this voicemail on November 23rd of last year. How about you go F yourself, bunch of effing maggot, effing woke terrorists. Keep all your effing transgender excrement out of these schools, out of the state of Texas. It makes no effing sense, and it's against the nature of man. Go F yourself, you stupid effing maggot, woke transgender Fs. And then we received another one, February 23rd of this year. Yeah, go F yourselves, you bunch of pedophiles, you bunch of effing maggot queers, and your effing toxic leftist communist ideology is gonna die. And all you penis-sucking effing maggots are gonna beg for your lives at the end of our boots. You bunch of communist Fs, F you. So, you might notice some similarities between what I just read and what we have heard in testimony for bills like this that are seeking to push trans people out of Texas. This shrinks the spaces that we can occupy until people literally have to leave the state or have to hide who they are, and that is stifling. And bills like this also incite violence against my community. So please vote no.
Members, any questions for the witnesses? Thank you both. And that is all the witnesses we have registered. Senate Bill 162. So public testimony is closed, and the bill will be left pending at this time. Senators, we have motions in writing from Senator Perry, Senator Birdwell. Without objection, those will be adopted. She's here. Oh, and Senator Paxton. I have a motion in writing with Senator Paxton. So without objection, we'll adopt the motions in writing from Senator Paxton, Senator Perry, Senator Birdwell. And with that, the Senate Committee on State Affairs stands in recess, subject to the call of the chair. Good evening.